Uno, dos, tres. ¿Me escucha, cabina? Partamos por inglés. Sí, yo lo escucho súper bien. Pasemos al español, por favor.
Ahora en español. 1, 2, 3.
Súper, muchas gracias.
Mis colegas, por si acaso.
Sí, español por mientras.
Sí, y inglés.
Probando español, español, probando la cabina de español. Ahora voy a cambiar al inglés.
Muchas gracias, chicos. Uno, dos, tres. Uno, dos, tres. Uno, dos.
Muy buenos días. Bienvenidos. Vamos a iniciar los trabajos del día de hoy que está dedicado al aprendizaje entre pares. Tenemos por delante 4 mesas en el día de hoy y una mañana. Quiero iniciar presentando la mesa 1, ODS 3, Salud y Bienestar. Para su moderación contamos con la presencia de la señora Susana Sotoli, directora regional para América Latina y el Caribe del Fondo de Población de las Naciones Unidas. Tiene la palabra, Susana.
Muchas gracias, señor presidente. Buenos días a todos y a todas. Tengo el placer y el honor de moderar esta mesa dedicada específicamente a
Discussion devoted specifically to something that is very relevant, and for that purpose we have a luxury panel with us here today. But let me introduce this discussion by saying that indeed over the past few years Latin America and the Caribbean have witnessed significant progress in the creation or in the achievement of the crucial goals of SDG 3. For example, which is devoted to good health and well-being. And among these significant achievements, we can highlight the reduction of infant mortality, which on average is far lower than the threshold established for this goal. And this achievement was the result of the prioritization on the part of countries of investment in specific public policies focusing on prevention and on structural reforms such as the expansion of education for women, health networks, and access to basic services. We have also strengthened the implementation of the framework agreement of the WHO for the control of tobacco that has placed our region in the lowest region in terms of tobacco consumption at a world level. We have also seen a reduction of deaths resulting from dangerous chemical products and as a result of air, soil and water pollution. And these are indeed achievements that we must congratulate ourselves for. However, the road towards good health and well-being for everyone does imply important obstacles still. And I dare say that those obstacles are even unacceptable for today, 5 years before the deadline of the 2030 agenda. Out of the 13 goals of SDG 3, only 3 will be achieved at the present pace. In fact, it's alarming that 4 specific objectives are distancing themselves from the achievement at the present pace. Now, obviously, this leads us to focus on the practices and experiences that have worked in order to accelerate them and escalate them. First of all, we are very distant from achieving the regional goal of maternal mortality. Maternal mortality has not only made progress, but has increased in many countries and has fallen back to levels of the beginning of last century, which is unacceptable. Of course, the pandemic has exacerbated this situation, but the underlying causes such as unequal access to prenatal and postnatal care and the lack of sexual and reproductive health services, quality services, must be tackled urgently. In that sense, this is a challenge that we have to focus on. Limitations to universal access of these services, including timely diagnosis and treatment of HIV and other sexually transmitted diseases. An additional pending challenge refers to the reduction of adolescent birth rate and the use of contraceptives. The region of Latin America and the Caribbean has the doubtful position of being the second highest, having the second highest rate of teenage pregnancy, only below sub-Saharan Africa. Every 20 seconds, a teenager becomes a mother in our region. As from the UN Population Fund, we have estimated that the combined annual cost of teenage pregnancies and early maternity represents $15.3 billion, which is equivalent basically to 1% of the GDP of 15 combined countries in the region. As a result of loss of years of education, the result of income expectations, less employment opportunities, an increase in health expenditure and a drop in fiscal revenues, and all this as a result of early maternity. We also find premature health as a result of non-transmissible disease, a reduction of risks, and for health and universal health coverage. Now, behind all these obstacles, we find inequalities as a structural characteristic of our region and an enormous challenge that we have to deal with. And this is evident both in countries and within countries. And all this also involves socioeconomic variables, gender aspects, place of residence and age. Dealing with these inequalities is indeed a priority. And we must also acknowledge the interdependence of SDG 3 with the other objectives or goals of the 2030 agenda. And in that sense, primary health care plays a crucial role. Strengthening this service enables us to improve the prevention of diseases, promote health, conduct early diagnosis, and provide continuous treatments and controls. In this panel, we will be able to reflect upon these challenges, but also focus on those that have worked and that, as I said, we may be able to accelerate and escalate. Indeed, in the region, we have innovating and effective solutions that we must learn from. So I would like to welcome the members of this panel. I believe that the dialogue and the exchange of knowledge will enable us to identify strategies in order to accelerate the advancement of this SDG and build a healthier and more equitable future for everyone in this region. I have the pleasure then of beginning this panel discussion through the intervention of Jimena Aguilera, who is Minister of Health of Chile. Minister, may you be very welcome. Thank you very much for being with us here, and you have the floor. Thank you, Susana. First of all, I would like to thank the invitation. The 2030 agenda for us as a government and its sustainable development goals is a fundamental milestone in the political commitment of states with the well-being of its citizens. And that is the first thing that I would like to highlight during these very complex times for multilateralism. And this shared vision enables each country to establish concrete goals, acknowledging that health for us is an end in itself and also an essential condition for development, for sustainable development and for human dignity. Guaranteeing healthy life and promoting well-being for everyone at all ages is not only a priority objective, but also a fundamental pillar that enables the achievement of all the other SDGs, as highlighted by Susana, illustrating the interconnection between health, social well-being, economic development, and environmental sustainability. Now, with regards to my intervention, I would like to highlight the historical experience of the health sector, then the progress that we achieved in universal health coverage and health indicators, and the challenges and strategies that we view for the future. Last year, we celebrated the centenary of health institutions with the creation of the Ministry of Health, with an approach focusing on the control of infectious diseases at first, towards a comprehensive approach to health and well-being.
Y Previsión Social en 1924, junto con el inicio de la Seguridad Social en Salud, parte con una serie de hitos transformadores que han permitido avanzar en la situación de salud y en el bienestar de los chilenos. Otro hito fundamental fue el año 52, cuando se crea el Servicio Nacional de Salud, que sienta las bases de un sistema público orientado al acceso universal que hasta el día de hoy es fundamental para nuestros logros sanitarios. En la década del 80, durante la dictadura, hubo otro punto de inflexión con la creación del Sistema Nacional de Servicios de Salud y el inicio del proceso de descentralización de la atención primaria, que fue transferida a los municipios. Estos cambios fueron complejos, sin embargo, finalmente acercaron los servicios a la comunidad y después de 40 años se ha permitido generar capacidades locales para responder a las necesidades específicas de cada territorio.
After 40 years, we were able to see progress. So in 2005, we implemented explicit health guarantees, HES in Spanish. This was yet another turning point because it provided access, protection, primary health care for and other types of care for priority.
Derecho a la salud como principio rector de las políticas públicas. El impacto de estas garantías explícitas de salud en estos 20 años ha sido sustancial, especialmente para transformar un sistema que estaba basado en la atención materno-infantil hacia un sistema que diera cuenta de las principales patologías que están relacionadas con las enfermedades no transmisibles en Chile. Y también el impacto en lograr mayor equidad en las respuestas hacia familias más vulnerables, disminuyendo mortalidad por causas específicas y mejorando significativamente la calidad de vida de miles de chilenos y chilenas. Esta trayectoria histórica refleja una constante búsqueda de equidad y universalidad en nuestras políticas de salud, adaptándonos a los cambiantes perfiles epidemiológicos y demográficos en un contexto de transiciones múltiples que caracterizan a nuestra región. Para hablar de los avances de los Objetivos de Desarrollo Sostenible, quise separarlo en dos aspectos fundamentales. Primero, la cobertura universal de salud. En nuestro gobierno, Chile ha dado pasos significativos hacia la cobertura universal de salud, con medidas concretas para reducir particularmente las barreras financieras y expandir servicios esenciales de calidad. La implementación del copago cero en FONASA ha beneficiado a más de 6 millones de personas en los tramos de cotizantes del seguro público, que hoy día cubre a más del 80% de la población. Eso ha reducido el gasto de bolsillo y ha protegido especialmente a quienes enfrentan enfermedades crónicas y de alto costo. Esta política, que podría parecer simplemente financiera, tiene profundas implicancias en la adherencia a tratamientos, en la prevención del empobrecimiento por gastos catastróficos y en la dignidad de las personas que ya no deben elegir entre su salud y otras necesidades básicas. Además, hemos fortalecido la seguridad social en salud ampliando coberturas, mejorando la protección financiera a través de FONASA, que como decía atiende prácticamente el 85% de la población. Hemos logrado la implementación o la legislación de una nueva modalidad de atención en el seguro público, la modalidad de cobertura complementaria, que en estos días comenzará la licitación, permite trabajar con seguros complementarios privados, haciendo una vanguardia de la transformación del sistema con un seguro público prácticamente universal que avanza hacia la complementariedad público-privada con seguros complementarios privados, eliminando procesos administrativos complejos y las barreras de acceso, thereby equidad en el acceso hacia una mayor protección financiera y una mejor complementariedad en un sistema mixto. Este enfoque pragmático reconoce la realidad mixta de nuestro sistema y busca maximizar los beneficios para los usuarios sin comprometer los principios de solidaridad que tienen que regir la seguridad social en salud. También hemos tenido avances en acceso a medicamentos, basado también en avances en gobiernos, la ley de Sanabá, que ha permitido mejorar el acceso a medicamentos a menor costo. Hemos situado la atención primaria de la salud como el corazón de nuestra agenda de transformaciones, aumentando su presupuesto en más de un 24% e implementando un plan de inversión histórico. La estrategia de atención primaria universal, que está al centro de nuestra agenda de transformación, refleja nuestra convicción de que la cobertura universal no es un objetivo técnico, sino una expresión tangible del derecho a la salud y un mecanismo fundamental para reducir desigualdades y fortalecer la cohesión social. En cuanto a los otros aspectos relacionados a los objetivos de desarrollo sostenible, el logro en indicadores sanitarios, podemos decir que los esfuerzos institucionales y la historia del sistema de salud chileno se han traducido en logros concretos en los indicadores sanitarios. En salud materno-infantil, Chile exhibe una tasa de mortalidad infantil de 5,8 por 1.000 nacidos vivos y una mortalidad materna de 19,7 por 100.000 nacidos vivos, indicadores que nos posicionan favorablemente en el contexto regional. Estos resultados son fruto de estrategias sostenidas como la cobertura universal del control prenatal, la atención profesional del parto y programas innovadores como Chile Crece Contigo, que desde el 2007 aborda integralmente el desarrollo infantil temprano desde una perspectiva intersectorial junto con el Ministerio de Desarrollo Social, coordinando servicios de salud, educación y protección social para asegurar condiciones óptimas de desarrollo desde la gestación hasta los 9 años de edad. Complementariamente, nuestro Programa Nacional de Inmunizaciones garantiza el acceso gratuito y universal a vacunas, que se ha reforzado recientemente con la introducción de nuevas tecnologías como los anticuerpos monoclonales para el virus incisional, protegiendo a recién nacidos y reduciendo hospitalizaciones, especialmente en los meses de invierno. Para las enfermedades transmisibles hemos avanzado en VIH-Sida, donde el 97% de las personas que viven con el virus conoce su diagnóstico y el 94% reciben tratamiento y logran supresión viral, resultados que reflejan el impacto de nuestra política de prevención combinada y el acceso universal a terapia antirretroviral. En tuberculosis hemos visto retrocesos. Enfrentamos un aumento post-pandemia a 15,8 casos por 100.000 habitantes. Estamos fortaleciendo la vigilancia activa y el tratamiento oportuno, enfocados especialmente en poblaciones vulnerables. Con respecto a enfermedades no transmisibles, que son nuestra principal carga de enfermedad, como mencionaba, la implementación de las garantías explícitas de salud han permitido garantizar acceso, diagnóstico y tratamiento oportuno para enfermedades cardiovasculares, cáncer y diabetes. La lucha contra el cáncer fue fortalecida con la Ley Nacional del Cáncer, promulgada en 2020, que creó un marco integral para abordar esta enfermedad. Complementariamente, la iniciativa HERTZ ha alcanzado el 88,4% de implementación en la atención primaria y ha mejorado el control de la hipertensión arterial. En cuanto a factores de riesgo, Chile ha sido pionero con la ley de etiquetado de alimentos, reconocida internacionalmente como modelo para enfrentar la malnutrición. Los sellos de advertencia alto en han modificado tanto el comportamiento de los consumidores como la composición de productos por parte de la industria, con reducciones significativas en contenidos de azúcares, sodio y grasa saturada en alimentos procesados. El 2024 lanzamos la estrategia para detener.
In 2024, we launched a strategy to address childhood obesity and overweight. This has been very challenging for the Chilean reality. We have 29 strategic areas addressing regulatory aspects and educational interventions. We can say that, in fact, we have made progress in several areas related to the sustainable development the significant progress, the most important challenge, the most relevant challenge is not leaving anyone behind. We know there's a great deal of inequality in this region, and of course it affects our country as well. We have an insurance system that is segmented and brings about unacceptable gaps with regard to health results. That's why we have driven a transformation of the public sector as a guarantor of universal services. The accelerated aging of our population has also made it necessary for us to focus on lifelong services and provide services for the elderly. By 2035, a significant portion of the Chileans will be over 65. This involves managing degenerative disease and chronic disease. What about territorial inequity? This is yet another challenge with regard to the rural areas, which have worse health indicators than urban areas. Our strategy is focused on boosting the first level of care and integrating this with social services by way of the primary universal service care system. This implements new care models with communities and people at the core. This involves introducing new technologies that are more appropriate and securing capacities among our professionals. We are speeding up the digital transformation in the health sector by implementing the first national virtual health system. This is based on the successful strategy called the digital hospital, and this reinforces telemedicine appointments and allows for having interoperable health information systems that boost secure services. This technology is a powerful tool, by the way. Just for your information, the interpreters inform the participants that they are doing their best, but the speaker is reading at the speed of light, and unfortunately, the interpreters are not privy to the document. We work closely with other ministries with regard to health as a cross-cutting aspect. We work very close with the Ministry of Social Development with regard to implementing the national care system, which services the key needs of our population regarding aging, for example. And again, the sectoral coordination is key for just service. And we know that we don't want the main burden of care to fall upon women. I would be remiss if I did not mention the multilateralism challenge. These advancements would not have been possible without the global framework of the 2030 Agenda. We have exchanged experiences and technical assistance, and all of this has been crucial for progress with regard to health around the globe. We have seen that, for example, addressing the smallpox disease and the pandemic, the COVID-19 pandemic, were only made possible through cooperation. We know that health knows no borders, and addressing shared issues involves sharing support. SDG number 3 is key, and with our vision of universal care, we believe that we are making progress there. Thank you.
Muchísimas gracias, ministra.
Thank you, Madam Minister, and thank you for underscoring the financial aspect with regard to health access. We know we need strategic investments, including public-private partnerships and the combination of innovative solutions that may allow for expanding service and limiting the burden on individuals. And thank you for pointing out the connection with multilateralism as a necessary platform for addressing the health sector challenges. I would like to give the floor now to Pilar Torres. She's the head of the Office for Planning and Sectoral Studies of the Ministry of Health and Social Protection of Colombia. Thank you, Pilar. Thank you, Susana. Good morning. Greetings from our president, Gustavo Petro, and Guillermo Mosajame, the minister. It's a pleasure to be here today addressing the Good Health and Well-Being panel, Goal 3. Let me provide you with a summary of our progress with regard to SDG 3 and what we have done. Essentially, COMPES 3918 from 2018 establishes following up on the SDGs with a series of indicators. These allow for us to have more dynamic approaches to the SDGs. We did this by boosting the data, and this is a strategy that was launched nationwide, not just under territorial development plans, but also the health territorial development plans. This involved non-governmental alliances with local governments and other sectors. And thanks to this, we have made progress with regard to attaining with regard to SDG 3. In addition to that, we also changed the 10-year public health plan. This is about addressing, moving away from a disease approach and moving towards a health approach. There are several key components of this, and we have come up with some thematic areas to better order public health services. This has allowed us to address the social health inequalities, which are the result of certain social health determinants. There are several of these. For example, social political conflicts, internal conflicts, forced migration, climate change, discrimination and exclusion of certain communities. Now, we have 8 key strategic areas of action that involve public health governance, ethnic people and communities, farmers or rural groups, and all of these areas allow us to address social health determinants and have primary health care as the 2 key tools for addressing these social health-related issues. In Colombia, we have developed another important strategy dating back to 2023, and this is called Colombia tiene quien la cuide. Colombia has caregivers. This is focusing on boosting primary health care through by sending individuals out into the communities, into the peripheral groups located nationwide. Since 2023, we have funded 10,599 basic health teams, and this is in keeping with the epidemiological profile of the different groups, and so it varies. We have groups of young professionals that work there, and we have basic health teams and 110 teams that have specialized in young people. These include psychiatrists, gynecologists, and all of this amounts to 3.9 billion in a budget. Now, we have also visited 4.3 million households, serving 3.3 million individuals, and 24,000 of these are pregnant women, 147,000 of these are persons with disability, 323,000 of these are under age 5, and 613,000 older than 65. We have several strategies, in fact, to reduce maternal mortality rate, such as the PAREM plan, which has enabled us to drop this rate to a level reached only 7 years ago. In 2023, it was 46.94 as the number of deaths. You can see the progression on the screen. As far as the mortality rate of children under 5, we aim to maintain the compliance with the goal. Last year, you can see what the rate was, 13.03, and that our SDG target was 15. And thanks to the specialized teams and equipment, we have been able to serve these children who have urgent, immediate health needs. And we had an overall shock plan that has allowed us to reduce the mortality rate of this group. With regard to our struggle against communicable diseases, we are working on HIV, the AIDS HIV rate, on reducing this. Last year, we obtained a license that allowed us to gain greater access to treatment and to begin treatment of individuals with HIV during an earlier stage. And as a result, we were able to expand coverage and by reducing the cost related to importing the medication required for treatment. With regard to reducing the mortality rate for non-communicable diseases, you can see the progression here. This has allowed us to reinforce certain strategies, such as breast cancer prevention strategy. This is one of the programs that we have developed working with the World Bank and the IDB, and as a result, we have reached greater groups throughout the national territory, a larger number of groups. With regard to preventing substance abuse, we have invested 51 million, which has enabled us to provide services to 90,000 individuals. And you can see the number of the progress we've secured on the screen. We have also helped a significant number of, benefit a significant number of young people as part of the strategy. With regard to 3.7, universal access to productive care, planning, and education, in keeping with SDG 5 related to gender equality, we have been able to reduce the birth rate in adolescents from 15 to 19 years of age. You can see that the figure is 31.78 at the end of 2024. Now, this is not a specific SDG target, but it's important to mention that being able to drop the pregnancy rate among girls ages 15 to 19 has been quite a success. And I would also like to underscore that the national government set certain targets for the 2030 agenda, and these have been incorporated into the National Development Plan. These are the same we've in trying to attain these targets, we have fostered other progress.
Universal health coverage of 98.5%. We still have the certification and eradication of polio and other viruses and measles, etc. And the coverage is up to 17 years of age with HPV, human papillomavirus vaccination. Something important that we've seen in Colombia was the increase in financing of the healthcare system. This has allowed us to provide the services, and 2022 to 2023 has increased by 22% in the last years. It has also increased by 30%. This has allowed us to deploy all these prevention systems, and not only with our plan of basic equipment, but also infrastructure coverage. It's important for our country to have primary healthcare centers, which had been abandoned and deteriorated in of different areas of the country. This has allowed us to have greater access and has allowed us to also have resources that we didn't have earlier, which allows us to guarantee these services within the access framework, more equitable, more inclusive, and more resilient. In terms of the implementation of the WHO Framework Convention on Tobacco Control, we have compliance by 100%. However, in 2023, we saw an increase because of this boost of vaping and others. However, Colombia is one of the 11 countries in the Americas that has adopted the measures to protect citizens from the consumption of tobacco substitutes and imitators in accordance with the WHO framework. In terms of supporting research, development, and universal access to these affordable vaccines and drugs, as we mentioned, people will benefit from the dolutegravir compulsory license, DTG, by means of the issuance of Resolution 184 from 2024, adopting the medical devices policy. Over 19 medications have been offered to obtain access. Finally, in terms of increasing health financing and support of the workforce, we have seen an increase of the budget, which has allowed us to strengthen the provision of services and financing the liabilities of the providers. This because we have reached a performance agreement and that has allowed us to train human talent. As of 2024, we formalized 2,807 positions. This has allowed us to reaffirm and strengthen the commitment Colombia has the 2030 agenda and maintaining compliance of the goals set forth and the ones we still need to strengthen in order to reach these. Thank you very much. Thank you, Pilar. Thank you for sharing the strategy, this core strategy of the CENAL with us, and of course the deployment of the basic healthcare systems to address social, territorial, political inequalities. Thank you. I would now like to offer the floor to Regina Guzman, who is in charge of the electronic government, the head of e-government and information systems of the Ministry of Public Health of Uruguay. Good morning, all. In the first place, I'd like to thank you on behalf of the Minister of Public Health in Uruguay. We have also the opportunity to present what our work has been here. I have a presentation. If you could please upload it. There it is. In the first place, I'd like to offer you some general characteristics of Uruguay. We have a population of 3.5 million people, not more, concentrated in urban areas. 51.6 are women, and it is an aging population with a lower birth rate, and the life expectancy is 78.3 years, and of course a replacement rate that is very low. So we have a healthcare system that is the National Integrated Healthcare System. It's very young. It is 17 years old. It was created in 2017, and the objective is based on PAHOs and its equity, solidarity, and of course, a single system. We look at it by risk, age, and sex. And of course, the system includes all providers, public, private, and NGOs. They are all part of a single system under the Ministry of Health. In this context, since 2016, the ministry thought about how to comply with SDG 3 and how to implement it. So a national health strategy was devised, national health goals, and this was done together with PAO in the local office. And what we worked on basically was taking the SDGs explicitly to form the national sanitary goals, the NHGs, and using these indicators as frame of reference for prioritization of the health issues in the country. We looked at outcomes targets and monitoring indicators in order to offer continuity, and the NHGs also sought to serve as a tool for steering and strategic planning in health. These were done in 2 blocks in 2030, and there was a difference in the methodology. In 2016, it was a methodology that was more participative, very open, with the participation of civil society, academia, and the objectives set forth for 2030 were the result of a more closed process where not all voices were represented, but it was decided to continue with the strategic planning process designed in 2016. So the NHGs did not change. The idea was always the same: to achieve improvements in the health status of the population, to reduce inequalities in the right to health, improve the quality of healthcare processes, and generate conditions for people to have a positive experience in healthcare. In this sense, the objectives, the strategic objectives defined were the same of 2016: promoting lifestyles, healthy environments, and reducing risk factors, decreasing avoidable burdens of morbidity and mortality and disability throughout the life of the person, intervening in a timely manner on the stages of the life of the person based on primary health care strategy, promoting access to the first level of care as a gateway to the system, building an institutional culture of quality, safety, and efficiency in healthcare, and moving towards a healthcare system focused on people's health needs, as well as finally strengthening the health system's response to emergencies, disasters, and epidemics. That was added in the 2030 plan for obvious reasons. Here are a few examples of the strategic lines. There's many, but for strategic objective 1, it was promoting healthy lifestyles, and some had already been included in the 2005 to 2010 period. So we increased the prices of tobacco, and the packaging and labeling was modified. Of course, there was a lawsuit that fortunately we won, and we were able also to focus on and generate the agreements for these guidelines. These have also had some issues, but we've been able to maintain it. On objective 2, decreasing avoidable burdens of morbidity and mortality, 2 main strategies were used here. Analysis of the non-communicable diseases, and especially in neck cancer, and measuring the wait times on surgery, for example, in the medical specialties. Strategic objective 4 was about building an institutional culture of quality, safety, and efficiency in healthcare. Here we developed 2 examples. One was the implementation of prevention programs associated with healthcare, and this is something that both Uruguay and other countries have seen an increase in and after the pandemic, and we were able to build a unique plan for the prevention, hospital infection prevention and control. And we also worked with PAHO, the PAHO office in the country, and we also asked that there be work on antimicrobial optimization. So these were the strategic lines that were taken. They're main ones because there are 50. Here are some of the main indicators and some results. In Uruguay, we know that the universal health coverage has 3 dimensions: In numerical terms, we understand that all residents in Uruguay have access to health care via private, public, or other systems. It is free, so coverage in numbers is 100%. But in terms of the coverage itself, we have the different programs, the diagnosis, therapeutical treatments, and here we have financed medication that is part of the Universal Health Coverage Plan, and we have a higher prevalence of vaccination. This is also a free vaccination scheme at a national level, both public and private. It can be done with any provider. Non-communicable diseases cause 85% of mortality in our country. And on tobacco control policies, what matters most is two results here. We were able to reduce the prevalence by 13% between the years of 2009 and 2017, from 25 to 21.6. We also would like to show you some indicators. This is the maternal mortality rate. I'd like to share with you that it is between 0 and 1, and that explains the frequencies. But the reason that this happened in 2021 was that we had a few extra. There was a different evolution in this year. But in 2019, the maternal mortality ratio was 19.1. And basically, the effect of the pandemic is that maternal mortality was having an increase. Under 5 mortality rate per every 1,000 live births also shows an increase of at least 1.2. You can see that since 2016, when we began with the strategy, it was 8. We had seen a decrease given the public policies and healthcare policies, and it was maintained for some time during the pandemic, but then it increased again in 2023. If we further analyze it, we see that the neonatal and post-neonatal mortality rates also increase. It is not one at the expense of the other. There could be many answers to this. We do see that there is a lower birth rate, a lower weight upon birth, but there's no doubt that it has a lot more to do with the conditions, the living conditions of the children, and that could explain that increase in mortality. Well, tuberculosis, we see a mortality rate of 20 to 100,000, and in 2024, we have 37 every 100,000. And if we look at this more in detail, we also could say that's very few cases, but there is a high incidence, and we feel that 37 every 100,000 is not homogeneous, it's heterogeneous, and it's mostly in cities and in jails and in more vulnerable sectors. The mortality rate by diseases in the circulatory system, we see that there was a greater number of consultations for cardiovascular illnesses, and there was an assistance so that people would continue to take care of themselves, and this gave positive results. The mortality rate by cancer was quite constant, and last year we began to be more aggressive in the analysis and control of treatments. and mortality rate due to respiratory system diseases per 100,000. Also, in the period 2016 to 2019, we had around 100, and we closed 2023 in 107. We were not able to recover to pre-pandemic levels. Mortality rate by suicides. Unfortunately, we do not have good numbers to inform with mental health. They have increased. There was a considerable increase in 2020 and 2023. Not only suicide, but there's another set of pathologies. And finally, new HIV diagnosis. It is pretty similar to the case of tuberculosis. And to conclude, I'd like to say that in the first place, as you know, the challenge is to recover some of the goals set forth. And on March 1st, we began with a new administration. So we would like to guarantee the objectives of the early childhood law, offer timely access to medication, improve access to consultations like diagnostic procedures by reducing waiting times and addressing mental health from a comprehensive perspective. Thank you very much.
Muchas gracias, Pilar, y sobre todo por
Thank you,
traer
Pilar,
el tema de
and
la salud
for
mental,
bringing
que es un
mental
aspecto
health
clave que tenemos que resaltar. Y
to
esta
the table because it
nuevamente
is
destaca
very
la
important. I'd like to
dimensión
stress
financiera,
the importance of the
ya
financial
que
dimension,
todos los
what
esfuerzos
everything
por
there is
traducir el
behind
derecho a la
these
salud
efforts
en
to
materialidad
translate
al derecho de
materiality
la salud.
to health.
Me quedan
I have 4
intervenciones y voy a
interventions
rogarles
left, and I'm
que
going
se
to
puedan tener, por favor, a los 7 minutos
beg that you
para
stick to
que
the allotted
sigamos
7
con
minutes because
un
we
cierto
are
atraso
already
en este
running
panel.
late.
Entonces, pasaría a mi colega
Now,
Luisa
I'll
Abad,
offer the
directora del equipo regional de apoyo del Programa Conjunto de las Naciones Unidas sobre el VIH-Sida. Luisa, adelante.
Gracias, Susana.
I mean, it's
y
that
muy
or
buenos
fiddling with the phone.
días a todos y a todas.
Sucks at it.
Señor presidente
Yeah.
de la mesa, ministra Aguilar, panelistas, amigos y amigas. Es un honor estar en esta importante mesa donde discutimos los avances en el ODS 3. Sabemos que sin salud y bienestar como un derecho humano fundamental no es posible el desarrollo sostenible. En un momento de desafíos sociales, económicos y políticos globales y regionales, quisiera comenzar destacando que los avances en materia de salud en América Latina y el Caribe han sido gracias al liderazgo histórico de esta región donde se han impulsado estos avances destacables. Y la respuesta al VIH ha sido uno de estos ejemplos, una historia de grandes luchas y esfuerzos para lograr el compromiso colectivo frente a una pandemia, liderado por las demandas de las comunidades más afectadas, con impulso esencial de muchos gobiernos y donantes, y liderado desde una perspectiva multisectorial que entiende que es fundamental invertir no solo en la
I tried
respuesta
to help you with the
biomédica,
Colombian
sino
one, but it
también en las
was like,
determinantes
I understood
sociales
because
para
I
hacer
put it in the
frente a una
depot, but it
pandemia.
got jumbled.
Fue en este
Even though it
espíritu que
arrived.
UNUCIDA fue
Yeah,
creado
The
como un
presentations,
programa
because you're working, you
conjunto
don't know they
que
come in.
aglutina a 11
Es que
agencias,
llegaron
fondos y
antes, pero
programas
eran
del Sistema de
PowerPoints.
Naciones
Yeah.
Unidas.
Y I just stuck it in
Hemos,
the
por
depot,
tanto,
pero como
demostrado
it got
lo que es
jumbled,
posible cuando hay voluntad
te iba
política
de redo.
y compromiso,
Sí.
y este se traduce
No,
en
pero la
acción.
ministra de Salud de Chile,
Ejemplo
por
de ello es el
favor.
hecho que en
Uy,
América Latina
Solo
la
escribí la
cobertura de
cuestión, no
tratamiento
puedo
antirretroviral
creer.
para las personas con VIH
Y
ha
más encima
aumentado
que trabajar
considerablemente de un 34% en el
No,
2010
claro, y al
a un
inicio,
73% en el 2023. En
you
el
have to be
Caribe ha
careful
aumentado de un
because if you
20%
turn
en
your
el
thing
2010
on
a un
before
70% en el
like I
2023.
turned it on before he was done,
Creo
and
que
then
la
he
ministra
turned his
Aguilar
off and
y el
me
gobierno de
or
Colombia nos han
something.
mostrado
Te puede
ejemplos de estas
desconectar.
Sí,
ampliaciones.
claro.
And I was,
En
yo
América
juraba que estaba
Latina, las
encendido mi
muertes relacionadas
micrófono
con el
y
SIDA han
no.
disminuido en un
Porque primero,
28% desde
hablé sola.
2010 y en el Caribe en un
Segundo, es chicharreo.
57% en este periodo.
Tercero,
Yeah, no, it's
Aunque
all very
sabemos que en
Ay,
el
frustrante.
2025 no
Eso
debería
es
haber
lo que
ninguna
es.
muerte aún relacionada con el SIDA.
Sí, y metí el de
Esto
Colombia
nos
y el de
demuestra, por
Uruguay.
tanto, el mundo de lo posible
I mean, what I
cuando
do when
juntamos
it's like
voluntades y
desperation,
cuando hay
stick it in there y va
solidaridad
borrando
internacional.
en este
Pero
y
enfrentamos
así va
desafíos
subiendo. El
políticos y de
problema es que
financiamiento que
cuando
hemos
hay
venido
números
hablando estos
se
3 días del
desordenan, pues la
foro,
tabla se
sumado
desordena.
a que en nuestra región,
Yeah, whatever, I
desafortunadamente,
tried.
muchos
I mean, she
piensan
was
que
reading.
el VIH es una
I
Yo
epidemia
was
can,
del
reading at the
pasado.
speed of light,
yeah.
and por eso
Por
te lo
tanto,
escribí tal
estamos en una
cual, like, dude.
encrucijada.
You're like, I
Si
mean, I could
asumimos ejercer el
read
liderazgo
what's on the
necesario para poner
presentation,
fin al SIDA
do a
como
site
desafío de salud
translation, but when they're
pública al
reading a speech,
2030, que es nuestra meta,
la
o
PPT decide
retroceder en el
bajo.
camino ganado y no
I don't
cerrar
know.
las brechas.
Whatever.
Déjenme mencionar
Saying
algunas.
trash in,
El número anual de
trash
nuevas
out.
infecciones por
And they don't
VIH
give
en
a crap
América
because
Latina
they're
aumentó
speaking
en
to
un
the audience, not to
9%
the English
desde
speakers. They don't
desde el
care.
2010 al
They're
2023,
speaking to the
mientras que la
primarily the
reducción
Spanish
global
speakers.
fue del 39%. La prevención es el área donde menos se invierte y muchos países tienen alta dependencia de la cooperación internacional. Solo para poner un ejemplo, 63% de la respuesta en el Caribe es financiada por la cooperación.
No,
La
serio?
situación en muchos países de Centroamérica es similar.
She just told you?
Sabemos también que las personas más afectadas siguen siendo aquellas que sufren mayor
Oh, qué pena.
discriminación y marginalización en
Chuta.
nuestras sociedades.
Easy come, easy go.
Hombres que tienen sexo con hombres, mujeres
Qué
transgénero,
raro porque el
trabajadoras
otro
sexuales.
Men, sexual workers and indigenous communities and Afro-descendants.
Presentan las tasas de prevalencia en nuestra región.
I
Por
just want
tanto, el
to
llamado
I
SIDA es a que en
Uh,
estos 5 años tomemos el liderazgo histórico para que seamos la región que haga realidad la meta de poner fin al SIDA como desafío de salud pública. Yo llamaría a 3 acciones esenciales desde ONU-SIDA. Una, la sostenibilidad de la respuesta. Tenemos grandes logros y aunque muchos países en nuestra región han demostrado el liderazgo cubriendo el tratamiento antirretroviral, como lo hemos escuchado esta mañana, seguimos fallando en asegurar la sostenibilidad de la respuesta en los países. Esto no es solo, y este desafío y este llamado no es solo porque es parte de garantizar el derecho a la salud, sino porque el costo económico acumulado de la inacción será de casi $2.000 millones para el 2030 y para el 2050 esta cifra se elevará a casi $7.000 millones. Segundo llamado a la acción, cerrar las brechas y ampliar la innovación para la prevención. Tenemos como nunca en la historia una caja de herramientas para prevenir el VIH, pero debemos invertir en ellas. Estas son las herramientas que la ciencia nos demuestra son efectivas para prevenir la transmisión del virus, que va desde la educación integral en sexualidad, la disponibilidad de la prueba, la autoprueba, el acceso a los preservativos, pero también las innovaciones que tenemos como la profilaxis preexposición. Y déjenme decir, porque muchos no lo conocen, que fue anunciado el año pasado que el lenacapavir es un fármaco antirretroviral que funciona para la prevención con un inyectable 2 veces por año y es considerado como una posible revolución en la lucha contra el VIH. Fue nombrado como el avance científico del año en 2024 por la revista Science, con hallazgos preliminares en ensayos clínicos cercanos al 100% de efectividad para la prevención de la infección. Es fundamental que nuestra región se una para garantizar la asequibilidad cuando éste esté disponible, porque nuestra región no ha sido beneficiaria de la licencia voluntaria que se otorgó para que más de 100 países puedan hacer asequible este medicamento. Aunque los ensayos clínicos, muchos de los ensayos clínicos se realizaron en muchos países de nuestra región. Finalmente, el tercer llamado a la acción es tomar medidas para la reforma legal y de política pública y la inversión en la lucha contra la discriminación e invertir en el liderazgo de las comunidades. Sabemos que las respuestas nacionales que potencian el liderazgo de la comunidad, reforman las leyes punitivas y discriminatorias y combaten la exclusión, tienen respuestas efectivas que reducen las nuevas infecciones, la mortalidad y generan bienestar. Desde UNUCIDA, por tanto, seguiremos trabajando de la mano de ustedes para que en el 2030 podamos decir que el SIDA sí va a ser en realidad una pandemia del pasado. Muchas gracias.
Muchísimas gracias, Luisa, y muchas gracias por atenerte al tiempo. Pero además, muchas gracias por este llamado muy claro, muy urgente y por darnos como este sacudón de no pensar que esto es algo del pasado y la necesidad de renovar este esfuerzo colectivo. y también de poner en términos de costos la inacción. Esto es muy importante y nos acerca a conversar mejor con los ministros de Finanzas. Entonces, me gustaría pasar a otro colega, Giovanni Escalante, representante en Chile de la Organización Panamericana de la Salud. Giovanni.
Gracias, Susana. Distinguido presidente de la mesa, excelentísimos representantes de los países.
Countries, distinguished colleagues, members of the panel, dear Minister of Health, Jimena Aguilera, Minister of Health of Chile. For us, as a Pan-American health organization, it is an honor to have served for 123 years at the member states of Latin America and the Caribbean, and to over the past, serving over these years implies an acknowledgement with regards to the efforts conducted by all countries in Latin America and the Caribbean in order to have health systems capable of responding to the needs and demands of the population. And the key message that we would like to convey now is indeed the need to invest in health and well-being via health systems based on the strategy of renewed primary health care, health systems that may be resilient and respond to the multiple threats that public health faces. And for that reason, for us, investing in health is the best bridge in order to achieve sustainable development goals in Latin America and the Caribbean. Here, I would like to highlight that we have conducted a joint publication with ECLAC and PAHO with a document that I believe is fundamental, where we put forward the need to make a comprehensive investment in health. Next slide, please. I can see the presentation there, but I don't have the pointer to change the slides. But let us move on in view of time. Oh, thank you. Today, I would like to share with you a reflection on the urgent need to transform our investment in health as an element that catalyzes sustainable development in Latin America and the Caribbean. The pandemic, the COVID-19 pandemic, exposed very crudely the structural vulnerabilities of our health system. This crisis paradoxically provides us with an unprecedented opportunity in order to innovate health systems founded on renewed primary health care systems that not only guarantee equitable access to quality services, but also deal in a comprehensive fashion the social determinants of health. Now, with regards to the progress and challenges in terms of sustainable development goals related to health, the present outlook has both lights and darkness, despite the fact that a third of the indicators in order to measure the achievements of SDGs in health and the evidence progress, there are still significant gaps. For example, maternal mortality, despite the fact that it has dropped to 68 per 100,000 born dead, it still remains below the goal of 30 by 2030. The births dealt with by qualified staff represent over 52%, but we must achieve universality. Infant and neonatal mortality shows progress, but we still face increasing challenges in terms of the prevention of mental health and mental diseases. The impact of the pandemic has shown that there has been a collective fallback. The health crisis produced a generalized drawback in terms of health. We have the coverage of immunization, for example, of vaccinations. It has dropped, increase in infant maternal mortality and malnutrition, together with an increasing crisis in terms of mental health. The interruption of essential services has left millions of people without access to adequate medical care. Persistent inequalities. This is an urgent call. Inequalities in terms of access to health have become much more acute, especially in rural areas and indigenous communities and Afro-descendant communities. The fact that many countries devote less than 6% of their GDP to health reflects a systematic fragmentation that we must be able to correct. It is imperative to increase public expenditure on health at least to 6% of the GDP, allocating at least 30% of that budget to primary care, acknowledging that health is a fundamental human right. In consequence, health is a fundamental pillar of multi-dimensional sustainable development. Health goes beyond the absence of health, but becomes an essential component of comprehensive well-being and a pre-requirement for sustainable development. Strategic investment on health generates multiplying effects on the reduction of poverty, the drop of inequalities, and the strengthening of education, labor inclusion, and also economic growth. And this is something that we must also always highlight. Health and well-being, investment in health opens up doors and opportunities, and it is a bridge for peace and development. And the intersectorial formula as a strategy. Well, scientific evidence establishes that social determinants of health, such as poverty, inequality, and education, have a direct impact upon health results. An intersectorial approach that brings together primary health care and social protection will enable us to deal with these structural inequalities and guarantee a basic level of well-being for the whole population. In addition, the democratization and social participation are fundamental when it comes to this pillar. Civil society organizations play a fundamental role in terms of the health governance, and we must strengthen this participative component in order to ensure that policies truly respond to the territorial and populational needs. The return over the investment, a win-win situation or a win-win equation. We sometimes face a challenge when it comes to arguing how to increase investment in health, and yet evidence reveals that investment in health does not represent an expenditure, but rather an investment with a high social and economic return. Programs such as the prevention of TB, vaccinations, and access to water and sewage provides benefits that go far beyond the costs. The transformation of our health systems requires an efficient management with integrated networks, the strengthening of the essential functions of public health, and a comprehensive formula to deal with the social determinants. And in addition, we also have innovations because Latin America and the Caribbean are able to do this. We have regional initiatives that catalyze changes. The strategies promoted by PAHO accelerate regional health progress, founded on scientific evidence and comprehensive approaches. And these initiatives promote cooperation among countries, integrate technological innovation with equitable access, and guarantees solutions that are adapted to local situations, promoting a development that is much speedier and sustainable. And there you have 4 examples. Better care for non-transmissible diseases. This is a comprehensive package, a comprehensive approach to all diseases based on evidence and technology. The initiative Zero Avoidable Maternal Deaths. This is an initiative that we all share. And we have a very interesting initiative underway to eliminate more than 30 transmissible diseases in the Americas and in the Caribbean. And finally, a tool, a solidarity tool, which is the regional revolving funds, both for vaccines, equipment, and critical inputs for public health and appropriate technologies. And to round up, we have a collective commitment, which is health and well-being. And investing in health implies investing in the future of Latin America and the Caribbean. The road towards universal health and the reduction of inequalities implies a collective and sustainable commitment. And only through this shared determination will we be able to advance towards sustainable development and multidimensional development and a comprehensive well-being for everyone. Thank you very much. Thank you, Giovanni, for sharing this series of strategic guidelines and analyses that that PAHO provides to countries. Now, I'd like to offer the floor to Andrés Martínez Garcia, who is Regional Coordinator for Latin America and the Caribbean of the Joint Learning Initiative on Faith and Local Communities. Andrés, you have the floor. Thank you. Dear colleagues and government representatives, civil society and international organizations, it is an honor for me as representative of GLI, Latin America and the Caribbean to contribute to this discussion on SDG 3. This discussion is urgent, and not only in view of the challenges that we still face for fair and equitable access in terms of health care in the region, but because we're at a crucial point at a global level where the acknowledgement of mental health and psychosocial support as a fundamental component of well-being cannot be left aside. For this reason, I would like to talk to you about the persistent gaps in the achievement of SDG 3 as from the perspective of mental health. Despite the fact that we have made progress in the reduction of infant mortality, and progress in terms of life expectancy, Latin America and the Caribbean still face great disparities. Equitable mental health care that are universal and culturally sensitive aggravates the existing vulnerabilities between the population impacted by conflicts, displacements, and chronic poverty. Mental health is a human rights issue. Despite that, it is also a structural challenge that implies that governments and institutions think beyond conventional care models. Many people that suffer mental health problems never seek formal help because of stigmatization, lack of access, or economic barriers. And this is especially true in the case of boys, girls, and teenagers that require safe interventions that are accessible and also based on the community, adapted to their development needs. UNICEF research on mental health and psychosocial issues clearly shows that early intervention, exposure to violence, forced displacement, or natural disasters lead to psychological suffering in the long term, and in consequence to future development challenges. The region, shaped by the frequent exposure to traumatic events, has seen generational cycles, invisible suffering, and despite that, mental health programs and psychosocial programs are still marginalized in national policies. Public expenditure in the region continues to be low. On many occasions, represents less than 2% of total health budgets, with notable variables between countries.
This makes this one of the most unmet areas of public health. To provide you with some perspective, in some of the countries, the mental health budget is less than the annual spending in governmental advertising. That is why investing in mental health coverage, specifically through initiatives led by the community, should be the focus. How can we talk about health and well-being when mental health services are still considered a luxury in our region? In this context, one of the most underappreciated services is the role of faith-based organizations and community-based or community-led responses. Now, there is an investigative learning initiative, and that is also supported by World Vision and others, and that has shown that international players, local players, are at times the only mental health providers in affected marginalized communities. We know that they are also profoundly integrated within the communities. We know that crises have affected their legitimacy, making it difficult for them to provide services to groups that are often invisible or inaccessible by state factors. Many communities, faith and spirituality contributes to this resilience. Many communities depend on religious traditions, rituals, and spiritual frameworks to address pain and forced displacement. The healing power of these practices should not be underestimated. We know that in regions where war and interpersonal minds and sexual violence have left profound scars, these faith-based faith-based practices offer immediate consolation as long-term coping mechanisms. Despite that, it is key to address this relationship with respect and care. The religious players must not be used as instruments for political ideological means. They must not only be seen as service providers, but rather as genuine partners in providing psychosocial mental health quality care. We should ensure that their role be recognized as part of a more holistic, broader approach to respect spiritual integrity, and not just as a tool to meet immediate needs. Despite their crucial role, religious actors have are often operating on the margins of formal health systems. So in order to fully recognize their potential, we need formal mechanisms for collaboration between governments, international organizations, and faith-based mental health providers. Capacity building initiatives as well that train religious leaders in different types of care, and policies that integrate traditional curative practices and that are sensible and sensitive to faith. Now, in addition to these efforts, the well-being of girls, boys, and adolescents in Latin America and the Caribbean cannot be separated from the broader challenges the region faces, including concerning levels of violence and inequality. First of all, being exposed to violence and instability brings about psychological, cognitive, behavioral, profound emotional consequences for the children, and we know that oftentimes the children's well-being is severely affected. Now, secondly, children in movement, whether they're migrants, refugees, or displaced individuals, are often the most vulnerable ones. In order to protect their well-being we need to address not only the symptoms, but also the structural conditions that exacerbate the suffering. Moreover, without radical change in the structure of our interior realm or worlds, that is, we cannot bring about the radical changes that we need. Now, this is an integral approach to addressing health and well-being, and as a result, it's essential to underscore the IDGs that promote capacity building, such as emotional resilience, empathy, social intelligence, and the IDGs invite us to take into consideration well-being as not just an external factor, but also to take into consideration the health infrastructure and the inner development of individuals. Now, finally, I would like to propose a bold idea with regard to the transformative potential of mental health as a collective asset in the context of the SDGs. Although individual well-being is essential, we must recognize that mental health is not only about healing, but it has this the potential to foster this collective creativity to address the global challenges. Let's imagine a model in which the experiences related to suffering and overcoming this actually become the seeds of social innovation. Now, if we have the right conditions, we know that communities can bring about strategies to solve complex issues, not just in the field of mental health, but also with regard to sustainability, education, and economic development. For example, developing new types of community governance based on traditional curative practices and mutual support, or global ways to address other aspects. Now, this perspective is not just a challenge to the traditional intervention models, but also places communities at the core as agents of active change. And this way, we can turn adversity into a source of positive action and creativity, raising, that is, this concept of well-being beyond something that is more than simple repairs, and turning it into a dynamic, regenerative model that drives progress regarding the SDGs. Thank you, Andres, for that perspective, interesting perspective, not just in terms of how you underscored the idea that mental health perhaps is one of the least protected areas in terms of our right to health. It's undervalued, but we also know that it has the potential to be a source of innovation and creativity. Quite interesting remarks there. As you said, an active collective effort, or rather, a collective asset. Okay, now I would like to introduce you to Estefania Mirpuri Merino, the director of the ONCE Foundation for Latin America. Estefania, you have the floor. Last, we apologize, not least, and welcome. Thank you, Susana. Good morning to you all, distinguished authorities, distinguished chair of the event, Minister of Health, Ms. Aguilar. It's truly an honor to be here with all of you and to share the opportunity to talk about an issue that is so crucial, as pointed out by the individuals preceding me on this panel. And we are referring to access to healthcare services, but primarily I'm pleased to address the challenges and difficulties that we face when trying to access these healthcare services, and specifically those individuals who are vulnerable or persons with disabilities. Now, we are here representing the ONCE Foundation for Latin America. This is a Spanish foundation that was originated jointly with the National Service for Blind Individuals in Spain. One of the key objectives was to work on social inclusion of blind individuals or individuals with poor vision in the large number of Latin American countries. Now, regarding health, we know that health is a crucial issue, and I actually agree with what one of the panelists affirmed, that health allows us to, it's not just about guaranteeing well-being, but when you have good health, you can enjoy other areas of our lives, such as access to employment. Allow me to refer to a key affirmation, and that is the right to health must be a universal service and right, and inclusive. And I would like to share with all of you some data, some statistics that I think provide us with excellent context and allow us to gain awareness with regard to what people with disability experience. According to ECLAC, 12% of the population in Latin America and the Caribbean has some type of disability. And then, according to the World Health Organization, 40% of those individuals, of persons with disability, do not have access to health services, and more than 50% cannot meet cannot afford, cannot pay the cost of these health services. If we were to break down these data by disability, we could refer to the following important issue. 26 million people in Latin America and the Caribbean have a visual disability, and more than 60% of those pathologies that lead to visual disability could have been prevented had those individuals had access to proper healthcare services. That means that we could have avoided these economic costs that the governments and states have taken on. So what are the key gaps that people with disabilities face in terms of gaining access to healthcare services? Well, I wanted to list these gaps because I think it's important for us to be constructive in our actions and positive, and also to address the different proposals to improve the situation and close these gaps. Now, first of all, one of the issues is the economic. Data have shown that one of the main barriers to paying for these health services, if paying for these health services is one of the barriers, we are truly limiting the ability of people with disabilities to have health services. It's quite clear. It seems redundant, but it's clear. And if you cannot afford to pay for these health services, the situation is even more complex. But that's one of the gaps. But there are other accessibility-related gaps, and this accessibility is understood as universal accessibility. Again, so I'm referring to technological barriers. How many times, for example, have people with disability not been able to read or fill out a form that needs to be read or filled out before accessing health services. How often have they not been able to read their prescriptions or read a medical report because these documents are not in an accessible format for those individuals with visual disabilities? Moreover, we should also ensure that all of these data are private because these are extremely sensitive data. Often, we see that on many occasions, the first door to health services is an app or a platform that are not accessible to people with disabilities because these forms of information do not include technology that allow for universal access. And I'm referring to access that depends on the disability. How many other times have we seen that the device where we can pull out a paper ticket to get in line for services to be attended, to be served at either the hospital or where have you. This information, when they call your turn, is often not announced over a PA system, but rather shown on a screen. So again, people with a visual disability are excluded. They don't know when it's their turn. So there are issues related to the physical context. We have data showing that 1 out of 4 health services in the region, in the LAC region, are not accessible. Not even the physical entrance provides accessibility to people with disability, and that is the first barrier. But there are other barriers. Again, people with visual disabilities do not have the right conditions because they do not have the right signage in either the appropriate contrast on the screen or appropriate font size, or there's no information in Braille. And often at health centers services, we see that the setting is not appropriate for these individuals to easily move around the physical facilities. There are other barriers such as attitude type barriers. The universe of healthcare professionals must provide dignified care and treatment to people with disabilities, and this involves appropriate attitudes, appropriate language, and take the necessary time to serve people with disabilities. Often they have to meet certain quotas in terms of the number of appointments, and we know that people with disabilities may require more time and they do not have that extra support. We also know that there is other attitudes regarding journalistic attitudes, and sometimes people with disabilities will go to an appointment with accompanied, and they do that because they want to, and often the healthcare professionals will speak to the companion and not to the person with disability. And then finally, we need to continue reinforcing public policies in the health sector so that these are truly inclusive. That involves trying to include in regulatory health provisions aspects related to accessibility, or trying to earmark sufficient economic sources so that health services will reach all individuals. That also involves allocating resources to technological devices or technological assistance for people with disabilities, to include sensorial devices. Now, Our foundation works for the countries in Latin America and the Caribbean, and we also work closely with organized civil society. Civil society organizations have always been one of our allies, and we know that accessing health services is not optional, it's mandatory. And fortunately, I have the floor right now, and as a result, I would like to request to the member states that you invest in health services and that you do this so health services will truly be universal and inclusive, and that we guarantee, as the UN Convention on the Rights of People with Disabilities states, so that access to healthcare services be equitable. And 63% of the support often comes from international aid cooperation. So that is yet another key tool. And over the years, we have seen that this instrument is effective. As a result, we will continue to provide full support. Thank you. Thank you, Estefania. Thank you for referring to one of the most revealing aspects regarding inequality in our region, and that is all the different barriers to accessing healthcare services by people with disabilities. You provided very concrete examples that truly demonstrate how far we need to continue traveling so that healthcare services will actually accept universal services to people with disabilities. Thank you for that. All right, then, I'm sure you will agree that this has been a luxurious panel, quite a privilege, and it's been a luxury to talk about these aspects and to refer to how the right to health is an integral issue, an intersectoral issue. We have heard about primary health care. We heard about mental health, health services for people with disabilities. Allow me to underscore three aspects. First, thanks to the different presentations that we heard about how it is absolutely necessary for there to be public will, policy will, to have certain values that will allow for universal health care. And this involves clearly defined initiatives and investments and indicator monitoring and following up. Secondly, and this is also key for this region, we need to recognize the inequalities, the gaps as well. And that's the heart of the challenge that we are facing with regard to making universal healthcare services a reality. If we look at the poverty rates in the region, we see that these precisely coincide with the other indicators showing setbacks. We're talking about the indigenous communities, Afro-descendants, etc., others. And thirdly, but equally important and key, we have seen that in each of the presentations we heard this morning, this idea that investing in health is obviously something we aspire to and is crucial for universal health services, but it's not sufficient. It goes beyond rhetoric. Regulatory frameworks are not enough. What we need are investments, and the investments need to be evidence-based. And the evidence is clear with regard to the return on the investment in health, and also the cost of not acting in terms of health are also clear. And one of the appeals, I think, that has emerged from this panel is the need to link actions in health with other areas of action, specifically financial investments, economic investments, because rights need to be translated into actions. And this, we're talking about, requires timely strategic investments. Now, having said that, we have some time to hear from the delegations. So allow me to give the floor to my colleagues from ECLAC.
Perfecto. Entonces,
Very well then, so we'll begin with Costa Rica. The delegate has the floor. Also, given the fact that we are running late, we ask that you take only 3 minutes. Thank you, Madam Moderator. I'd like to greet all the representation here today. It's an honor for Costa Rica to participate in this dialogue round on sustainable development goals. It is a valuable space to reflect and act jointly for the welfare of our societies. And on health and well-being, we need to mention that Costa Rica health is a fundamental right and an essential pillar for sustainable development. In Costa Rica, we've achieved important advances. Life expectancy is 80.3 years, and insurance covers 95% of the population. However, we also have complex challenges such as violence, inequality, climate change, and the reappearance of some diseases. Child health care is also important. 8 out of every 3,000 born have mortality, and we require increasingly specific treatment. In 2023 to 2033, we are making a commitment to the 2030 agenda and promoting
los derechos humanos y la
universal access, intersectionality, and respect of human rights. The pandemic reminded us how vulnerable we are, but it also showed us that we need resilient health care systems. Confinement and isolation accentuated situations such as anxiety, depression, and stress. We have designed a 2024 to 2034 policy with main axes, which are the inclusive surroundings, intersectoral work, and prevention of suicide. We are also fighting stigma and promoting the participation of all sectors to guarantee our population's health. From Costa Rica, we want to stress the approval of menstruation and justice law, which guarantees the access to hygienic products and recognizes the rights of women and their capacity of menstruating. We also promote healthy lifestyles and work on non-communicable diseases. From Costa Rica, we'd like to reiterate our commitment to strengthening cooperation in the region in health and, of course, basing ourselves on all principles of equity and justice, social justice. Together, we can provide dignified health for all without leaving anyone behind.
muchas gracias, Costa Rica. Tiene la palabra,
Thank you, Costa Rica. The delegate from Brazil has the floor.
Hola, buenos días
Obrigado.
a todos y todas. En los últimos años, el gobierno brasileño ha
Good
adoptado
morning.
varias iniciativas
The government of Brazil has adopted a series of specific
y avanzar en la realización de los ODS.
policies to advance on SDG 3. One advancement is the program on health, which seeks to expand access to healthcare services at the basic care units, providing adequate and necessary healthcare to the population. Brazil has also invested in the expansion of the vaccination campaigns, guaranteeing the protection of millions of Brazilians against diseases. Another is a national mental health system that seeks to offer psychological and psychiatric help to our citizens, promoting a better emotional, psychological health. We still have many challenges to guarantee that healthcare be equitable, especially for Afro-descended and marginated populations. In Brazil, maternal mortality of Black women is double that of white women. And this makes evident structural differences that need to be overcome to guarantee equal access to health. This is the reality of Brazil, and we seek to correct them with interinstitutional efforts to fight gender violence, obstetric violence that especially affects Black women. In order to monitor the advances, Brazil presented last year a national voluntary review, and the Ministry of Health devised a program that follows up on the implementation of this SDG. National cooperation is a priority for Brazil. We have actively participated in global debates and in the discussions of the G20 in 2024, when Brazil chaired the group, and our chair at the BRICS this year as well, to discuss universal coverage. I would like to reaffirm that Brazil recognizes healthcare as a fundamental right, and through robust actions and the collaboration between government, civil society, and our international partners, we will continue to advance to build a healthier future for all. Thank you.
Muchas gracias, Brasil.
Thank you, Brazil.
Pasamos la palabra a México.
We'd like to offer the floor to Mexico now.
Muchas gracias. Señoras, señores.
Thank you, ladies, gentlemen. Guaranteeing a healthy lifestyle is a pillar of public policies in Mexico. Within the framework of the National Plan for Development, we are reducing inequalities,
pertinencia cultural, asegurando que todas las personas accedan a servicios
maintaining cultural pertinence. The idea is to offer quality healthcare services to all, with a plan that seeks to take into account the differences between men, women, and the entire population in preventing and accessing health. Mexico has put special care into maintaining this fundamental right a reality. And of course, comprehensive health care for all, prevention of gender violence for indigenous communities and realities. We have differentiated services, the promotion of equality and health, eliminating barriers that women are facing with the different LGBTQ communities, and the prevention of diseases and vaccination. This has a presence in 23 states, offers free medical care for those who don't have Social Security. This intercultural model adapts services to the needs of each community, advancing in the reduction of maternal mortality, guaranteeing access to sexual reproductive rights, prevention in teen pregnancies. Mexico has updated the guarantee for women and adolescent girls so that they can have their own care, and of course, taking into account a series of methods. We have the promotion of healthcare and the prevention of chronic diseases and promoting a healthy lifestyle. Over 3,500 schools were included a very healthy environment. Mexico has also led a fight against junk food in primary schools as an important element of this health strategy. The 2030 agenda requires resilient and inclusive methods and The idea is to make it a reality for all, reaffirming our commitment to universal coverage in health. We want to take this opportunity to make a call to join our voices in the framework of this fourth FD4. Mexico would like to reiterate the importance that our region take a firm resolution from a multidimensional approach and no longer reducing itself to only measurements by the GDP. It has been mentioned that these dimensions have a terrible outlook on some sections of the population. The fact that they are unable to access, for example, HIV treatment drugs. So Mexico is making a call to have a regional voice that can allow us to move forward in this matter. Thank you.
Muchas gracias a la delegación de México. Cedemos la palabra a la delegación.
Thank you to Mexico. I'd like to offer the floor to Peru.
Hasta quienes dirigen la mesa y el panel.
Thank you very much. And thank you for all the presentations. In the case of Peru with SDG 3, there was clear progress in some of these child figures before the pandemic, but there is a stagnation during the pandemic, and this puts everything at risk. We saw this yesterday, and according to recent figures, we have seen no variation since 2017, when we saw one death for every 1,000 live births. We have a low mortality rate, but there hasn't been much progress in over a decade. So its value in 2021 is similar to that of 2011, 20 deaths for every 1,000 live births. In terms of maternal mortality, we have a reduction from 275 from 1996 to 71 in 2017 to 2021. So the preliminary figure for 2023 is around 52 deaths for every 1,000 live births, according to the Ministry of Health. To tend to the challenges of this front, we have a network of comprehensive healthcare networks, which has been implemented, and this is a set of organizations that offers solutions for equitable health. And the idea is to integrate this into a specific population through the coordination and complementarity, which offers solutions through the population it serves. In this sense, the Ministry of Health has contributed to the SDG goals, SDG 3 in this case. In terms of processes, we have been implementing this. The Ministry of Health, together with the Office of Compliance of the central government, is supplementing the formulation, considering that for 3 years we've had a multi-sectorial national health policy, and it not only characterizes what we see in the sector, but also education, transportation, housing. And we have looked at this for every institution, looking at the advances that supplement and contribute to improvements in Peru. Prevention and control of cancer, maternal care, and other processes are ideal to tend to treatment. And efforts have been made to take care through the pandemic of boys and girls by means of a proper screening. In public-private partnerships, we see the participation of entrepreneurial groups that are participating in Peru and contributing in every space where we see the effects of the pandemic on the population. We see huge challenges in coordination and articulation of the national health system in offering the standards of quality that will allow taking or addressing the specific needs of our population. Another challenge is bridging gaps in infrastructure. It is not It will not come to fruition unless we improve those quality gaps. The lack of infrastructure is also followed by a lack of medical personnel, and that also prevents them from offering quality health care. And of course, care for minors. In Peru, in every administration, there are executive proposals and there's legislative approvals, but it's important to allocate budgets to this. And with health, we have been working with budget programs that allow us to take care of a budget at an early age, and of course, maternal and neonatal health. This goes hand in hand with the Ministry of Health and Social Priority in order to work at a regional level, establishing a fund for performance. And it's important to reduce these gaps, and of course, with the corresponding budget allocations that will guide the regional governments to follow this effort. Peru is doing everything possible in order to have more favorable results by 2030. Thank you.
Muchas gracias a la delegación de Perú.
Thank you to the delegation of Peru. We'd like to offer the floor to the representative of the High Commissioner of the United Nations for Human Rights.
Distinguished delegates, panelists, colleagues, we welcome the emphasis in this discussion that health is a human right. And we thank ECLAC, our colleagues in ECLAC, for including information on the connection between human rights and the 2030 agenda in this year's fact sheets. Fundamental aspects of the right to health that provide essential guidance to implementing SDG 3 include the aspects of availability, accessibility, acceptability, quality, participation, accountability. Latin America and the Caribbean countries receive a wealth of recommendations through the international human rights system that provide important roadmaps for achieving SDG 3. We would like to offer the following observations. Access to sexual and reproductive health services is at the very heart of women's and girls' right to equality and is fundamental to the enjoyment of all other rights, such as the right to health, education, work, and an adequate standard of living, as well as their ability to participate in society and assume a leadership role. Despite commendable progress in some countries, we need greater commitment and attention to sexual and reproductive health in the region. Women and girls' full autonomy and control over their reproductive functions is essential to achieve not only SDG 3 and 5, but all the SDGs. We would like to acknowledge the important initiatives and good practices in the region. However, challenges that jeopardize human rights, such as child and adolescent pregnancies, death directly caused by environmental pollution, or lack of access to safe sanitation services remain key obstacles to the enjoyment of the right to health. Greater attention is needed on disadvantaged groups, including people of African descent and indigenous people. Looking into drivers of social exclusion and structural barriers to access health, placing emphasis on participation, protecting the civic space is essential to design health systems that work for everyone, not just a few. a few points on the issue of resources that has been very much at the center of this discussion. Dangerous levels of debt are obstructing low and middle income countries from investing in health. The Financing for Development Conference provides a historic opportunity to build a more equitable and democratic global debt architecture that is more responsive to states' obligations under international human rights law and the challenges of developing countries. We need to ground economic choices in human rights. Human rights-based approaches to domestic public resources are critical to translate human rights commitments into financial commitments, increase investment in the right to health, achieve more inclusive and equitable outcomes, and efficient and transparent resource management. And we welcome the leadership of Brazil, Colombia, and Chile in establishing the Regional Platform for Tax Cooperation for Latin America and the Caribbean in 2023. This is an important platform for collaborating to ensure that tax policies are progressive, equitable, environmentally, and socially sustainable. We stand ready to support greater use of human rights-based analysis of budgets and taxation systems towards ensuring compliance with states' obligation to mobilize and use maximum available resources for economic, social, and cultural rights. Thank you.
Thank you to the representative of HCHR. Pasamos la palabra a la FAO.
Good morning, everyone, ministers, authorities, and also UN colleagues. Achieving SDG 2 requires comprehensive measures dealing with health. Agri-food systems play a fundamental role for SDG 3. FAO promotes the transformation of agri-food systems so that they may be more sustainable, minimizing environmental impact and improving access to healthy diets. Healthy diets are fundamental in order to deal with all types of malnutrition, such as delay in growth, the overweight and obesity, and likewise non-transmissible diseases. In 2021, non-healthy diets were responsible for 10% of all deaths at a world level. The FAO and the WHO have identified that healthy diets are adequate in terms of nutrients, balanced, diverse in terms of groups of food, and also moderate. Achieving these principles requires a governance system for food security and nutrition, and likewise investment policies that encompass the production of food and also include the consumption of healthy diets, ensuring food environments that are much more healthy. As from the FAO, we support member countries in the implementation of school food programs and food education and nutritional education, and the labeling of food, among many other strategies that have already been mentioned here. And despite the progress, access to healthy diets continues to pose a major challenge for Latin America and the Caribbean, a region that represents the highest cost of healthy diets at a world level, with inequalities in terms of access to food, and we must deal with that. In 2022, 27.7% of the regional population was not able to gain access to healthy diets, with the highest index in the Caribbean. On the other hand, the FAO promotes actions with the approach of one single health, and also supports the comprehensive management of pests and the reduction of resistance of antimicrobial resistance and its impact on human health. This approach is important for health safety, reduce diseases, and promote sustainable practices. The strengthening of governance and intersectorial cooperation are fundamental for resilient and sustainable food systems. Food safety is fundamental for public health. Strengthened food control systems can prevent diseases transmitted by disease and reduce different diseases. As healthy food fight against malnutrition and reduce the burden of diseases transmitted by water and food. Environmental contaminants from food and from the soil, from the land, are not monitored, despite the fact that they have a significant impact upon the appearance of diseases and must be dealt with an agri-food approach. As from the FAO, we reiterate our commitment with the transformation of agri-food systems for human health and for the health of our planet. Thank you very much. Thank you, FAO. And now we have the final intervention of this section that will be delivered by UN Women. Thank you, Susana. It's a great pleasure to be part of this panel and to listen to you all. As from the perspective of UN Women, we believe that it is fundamental to acknowledge that health and well-being cannot be achieved effectively without the full inclusion of the gender perspective. Gender inequalities have a profound impact upon access, quality, and the results of healthcare. Women and girls, especially in context of vulnerability, face structural and social barriers that limit their access to health services, as some of you have highlighted. Some of the key areas where the gender complementarity in SDG 3 are expressed are, first of all, access to health services. We believe that it is fundamental for health policies to be inclusive and intersectional. Secondly, sexual and reproductive health, that has already been mentioned. The need to guarantee that all women, regardless of their social, economic, and cultural context, may gain access to these services in an equitable and respectable manner, respectful of their rights. Sexual and reproductive health is inseparable from the concept of autonomy and the empowerment of women, because it enables them to make informed and free decisions about their own body health and well-being. Thirdly, gender violence and mental health. Andres has already referred to this, but gender violence in all its shapes, physical, sexual, psychological, and economic, is one of the main threats to the health of women and girls, with devastating effects in the short, medium, and long term. Violence doesn't have a direct impact upon the physical activity of women. Not only has that impact on women, but also has a profound impact on their mental and emotional health, impacting their ability to live a full life and actively participate in society. Women that survive violence are also much more prone to developing mental health problems such as depression, anxiety, post-traumatic disorders, among many others, and we need to pay attention to that. And the fourth issue is the impact upon the unpaid work burden. And again, I go back to the need to have public and private care systems and integrated and community programs enabling women to download their care burden. The overburden of unpaid work can lead to physical and mental damage. And fifthly, the leadership of women in health. We evidenced during the pandemic that 72% of those that provided care during the pandemic were women, but only 20% were involved in decision making. And that issue remains the same. We continue to face discrimination when it comes to health-related decision-making. And I'm very happy to find a woman health minister, a woman undersecretary, and that means that there is a leadership that is coming on board, and hopefully there'll be more in the future. Health is a universal human right. When we talk about the right to health, we refer to the fact that all people, without any distinction whatsoever, may gain access to physical, mental, and social well-being. And likewise, women. I'm convinced that we can anticipate greater needs by women and their children in terms of psychosocial support and mental health services. And in consequence, we must strengthen these policies. Thank you very much. Thank you, Maria Noel. We conclude this session. Please allow me to once again thank this excellent panel and reiterate together with the consideration of these final interventions, that the right to health is absolutely intersectorial and intersectional. It must be based on a profound look at inequalities. And lastly, And I believe that we have reiterated the importance of linking the translation of regulatory aspects in terms of the right to health with timely financial investments. And in that sense, I would like to invite you to connect all efforts to make the right to health a reality, focusing on financing for development. That is a marvelous opportunity that we will have with a conference on financing for development that will be held soon in Seville, Spain. Thank you very much. And now we will offer the floor to the President, who will give us some guidelines. Thank you. Thank you, Susana. We would like to ask you all to remain in your places whilst we make some changes here before the second panel discussion, which is SDG 5, gender equality. Thank you.
Good morning. Let us reconvene. I would like to begin panel 2, SDG 5, Gender Equality. This panel will be moderated by Maria Noel Baeza, the Regional Director for the Americas and the Caribbean of the United Nations Entity for Gender Equality and the Empowerment of Women, UN Women. You have been recognized, moderator. Thank you, Chairman. It is an honor for UN Women to moderate the panel 2 today on SDG 5, Gender Equality, within the framework of the 8th meeting of the Forum of the Latin American Caribbean Countries on Sustainable Development. Gender equality is not just a fundamental human right, rather it is a structural condition for progressing towards sustainable development and thereby consolidating democracies, hopefully parity democracies that are also inclusive throughout our region. The compliance requires decisively addressing the structural nodes of gender inequality that we have referred to here and take on truly come through with the commitments addressed under the 2030 Agenda and the regional agenda on gender equality and the Beijing platform, which celebrates its 30th anniversary this year. This panel is being discussed at a key time. We only have 5 years left till 2030. And this is a historic milestone that continues to be effective. The fact that the Beijing platform continues to be effective is a historic milestone. Now, we know that there has been progress. We have regulatory frameworks, better political representation, many laws applicable to violence, but violence rates are not dropping. We still have this glass still half full in terms of gender-based violence, and there are also statistics information systems lagging behind as well. But we do know that we live in a very complex context involving multiple crises, economic, social, climate, care crises that have worsened existing inequalities and that have a disproportionate impact on women and girls. I would like to extend warm greetings to all the panelists joining us here today, and I'm sure that this conversation will allow us to have different institutional perspectives. I would like to first introduce Ana Westmis Garcia, Chief of the Division for Gender Affairs of ECLAC. We will refer to the main findings of the new report issued by ECLAC and UN Women. You have this on your tables in front of you. Keep it in a safe place. It's excellent. This report assesses 5 priorities for this year regarding gender perspective and provides evidence for public policy making, effective public policy. Then we have June Sumer, the chair of the Permanent Forum of People of African Descent. She will refer to the necessary actions to accelerate achieving gender equality with a special emphasis on closing gaps that affect African descendant women in our region. Then we have Pamela Martin Garcia, representative of Vecinas Feministas. She will share with us the measures that civil society believes to be crucial for making progress on attaining the objectives under the 2030 Agenda and the regional agenda. Did I forget anyone? Yes, Ana Raquel Martinez Chamorro. From the Regional Ministerial Secretariat for Women's Affairs and Gender Equity for the Santiago Metropolitan Region. Unfortunately, the minister is in India with the President of the Republic. Allow me to begin this joint presentation that Anna and I will make. Allow me to begin with this by saying that this document is a result of a joint effort that is in keeping with a strategic agreement with ECLAC, and we have been working together for a while. This is since the third. Well, we had the third regional conference on women, and we have this second publication related to gender indicators. It's a second joint publication. So I would like to extend a special consideration to Ana Huesmes for her leadership of the Division for Gender Affairs, but also to Ms. Garcia and Elena. They are both part of the regional office in Panama, and they have worked closely with us on publishing this document. Now, this slide talks about Latin America and the Caribbean and how we have recorded significant efforts and progress towards gender equality. Believe it or not, there are significant advancements, and it's important to point this out. The region is known for its progress in different objectives related to the Beijing platform, and this has been in synergy with the regional gender agenda, which has been around for 7 years. This is the only region that has the regional women's conference. Not any region has secured the progress that we have. The structural challenges remain, though. In order to consolidate advancements and do good on the commitments taken on, obviously our region needs to accelerate the pace. We only have 5 years left. The 2030 agenda refers to the urgent need to work towards gender equality under 7 SDGs, specifically SDG 5, which is the one that we will be addressing on this panel, and to do this under a transformative perspective towards social sustainable development, and including the care economy. ECLAC has estimated that in 2024, half of the 2030 targets are headed in the right direction, but still insufficient for full compliance. And only 25% of these targets, and we've seen information on this thanks to the executive secretary, are doing okay with regard to compliance and attainment, but there are other targets that unfortunately have shown setbacks. So this is the context. And with regard to SDG, which aims to have gender security and to empower all girls and women, that is an objective in and of itself. And so we have known that as a result of this, gender equality has been mainstreamed throughout the 2030 agenda, and this reflects a series of gender indicators that date back to the group of the proposal issued by the group of gender statistics as part of the Conference of Statistics of the Americas. Now, on the basis of these indicators, there has been a report on the progress with regard to gender equality globally, and this is in keeping with a report issued by UN Women annually and the UN Social and Economic Affairs department. This is a gender snapshot. So we see the 2030 agenda constitutes the regional expression, and this report allows us to see how our region is doing with regard to each of the indicators. So it truly is a benchmark tool for decision making, and it contributes to speeding up equality. And now I would like to give the floor to Ana Huesmes so that she can move on with the rest of the presentation. Good morning. Thank you, the chairman, panelists, dear colleagues. It's an honor for me to participate on this panel to talk about the importance of gender equality and SDG 5 and empowering women and girls and autonomy, women's independence, independence of girls, adolescents, and women, and the contribution that the region has been making to global fora consistently. Now, I would also like to recognize, as we heard during the previous panel, they would like to recognize the leadership of this region, first of all, for having SDG 5 and for having this standardized goal, and also our leadership role in mainstreaming gender throughout all of the 2030 agenda aspects and the various mechanisms, and also so that the actual indicators have been adopted. Now, the indicators are not fully completed. Not all of the countries report on these indicators, but without a doubt, our work with the Statistics Commission and the Regional Women's Conference and the preparatory work in Mar del Plata and the work in Beijing, all of that has been crucial and key. I would like to greet Karen Garcia and Elena and Ms. Baeza for the coordination. And I would obviously like to say that the region has gone further. We have a regional gender agenda. We know that the conference has provided guidelines. The previous panel referred to the right to care, and this is the region that for the first time ever has not undermined the care economy in Buenos Aires during the last conference. And I would also, Maria Noel talked about the different progresses towards equality. Now, we are not going to present all the details of the report, but the report has also received a great deal of support by the FAO with regard to this report. And now, because of time constraints, we will be focusing on 1, 5, 8, and the closing chapter. Now, as mentioned, this region has made progress with regard to formal equality, progress with regard to gender parity, with regard to education and other areas, but again, the region is quite far from securing substantive equality. We know that this is even more complicated given the limited fiscal space and the development crisis, as ECLAC has coined these terms, not terms, but called these different actions. And this is why we're here. We're here to underscore this sense of urgency and to drive support for collective action. And this was mentioned back in 1975. There is a great deal of hope for equality, and this remains as such. I would like to mention some data for you. You have all of this information in the document that has been published in Spanish. This PowerPoint is in both languages, and soon, shortly, in the upcoming weeks, this document will also be available in English. 3 out of 10 women are living in poverty, 1 out of every 10 women in extreme poverty. And in keeping with the statistics, even though there is a challenge with regard to intersectorality, we've talked about indigenous women, Afro-descendant women, we know that that's the issue. How can we have disaggregated data regarding them? We see that young women, indigenous Afro-descendant women, and women in rural areas face greater poverty. And this is a middle-income region. Some countries are high-income country, and we can never forget Haiti. We must recall their context always. And so this is a very heterogeneous region. But again, not a single country has been able to do away with gender-related poverty. And there's another issue. The countries that have made quicker successes in reducing poverty have not necessarily been able to reduce the gender inequality gaps. So this is clear. We know that mainstreaming is not sufficient. We do see high levels of female poverty. You can see the figures on the screen. And we also have a regional indicator that refers to economic independence, as well as other aspects such as the capacity to have your own income. 1 of every 4 women in the region does not have her own income. 40% of the women in the 5th poorest quintile do not have their own income. So in Latin America, poverty is female, and it primarily affects, as I said earlier, women in rural areas, indigenous women, African descendant women, and young women, our talent pool for the future, are so affected by this. Let's move on to SDG 5. This is another indicator that is, there's another indicator that's complementary in the region, and that's women in the workforce. We have realized that we cannot only talk about, by the way, this was the region that was quite vociferous in terms of referring to women in the work and how paid domestic work is extremely precarious and that we need to work towards decent work systems related to domestic work. And we are talking about how women allocate practically 3 times more time in the 23 countries, according to time use surveys, to domestic care. We also have the ECLAC Observatory and database. Women spend 3 times more of their time on care issues than men. And we have also seen trends. The data are not comparable, but we've seen trends that women work less time. All the countries show these data. We work more, but it's unpaid work, and we work less on paid work. So this clearly is the primary barrier for women to take part in the labor market. And it also has an impact on self-care, on recreational time. And we know that this is a key concern in the Caribbean and elsewhere. And the previous panel talked about this, talked about everything related to chronic disease, non-communicable chronic disease, and how this has an impact on growth. And so time allocated for care will be a significant debate in upcoming years related to the consumption and production patterns in our countries.
Un elemento fundamental es eliminar las prácticas nocivas, que en el caso de la región se expresa como matrimonio infantil precoz y forzado y mutilación genital femenina, que también se ha detectado en algunos territorios. 1 de cada 5 mujeres estaban casadas o unidas antes de cumplir los 18 años. Esta es una práctica nociva que tenemos que eliminar, tiene todavía una enorme permisividad social y reconocemos que hay 14 países que ya han prohibido el matrimonio infantil sin excepciones. Este es el estándar, pero definitivamente, así como la región ha avanzado todavía de manera insuficiente en disminuir embarazo precoz, embarazo adolescente, en matrimonio infantil tenemos una enorme deuda, es una tasa que casi no se ha movido en los últimos 20 años y estamos trabajando con UNICEF, con UNFPA, con ONU Mujeres, realmente para avanzar muchísimo más en este sentido. La violencia, ya lo mencionaba María Noel Baeza, esa pandemia en la sombra, esa discriminación que mata en nuestra región. Además, y el indicador de ODS es el 8% de las mujeres han sufrido violencia física, sexual o ambas por parte de su actual o anterior pareja. Ese es el indicador que seguimos en el ODS. Pero los países que han hecho encuestas de prevalencia muestran esta terrible realidad. Cerca del
Between 63% of women have expressed some sort of gender violence. And these years we have been, last year we celebrated 30 years of the Convention of Belém do Pará, and we have seen violence in all of its areas. We have been working with comprehensive laws, and it is time for the implementation, for advancing in production and statistics, where statistical information can be prevented and move forward with the necessary laws, these laws that have been so difficult to do and that have so much work behind them. We need to move forward with the different responsibilities. We have also reported this in the observatory. We're seeing about 4,000 women that have been victims of femicide in the year, well, last year, 11 violent deaths for gender reasons every day. And in most cases, it is violence by their partner or previous partner. There are advances in the region. This is a region that has had the idea that femicide must be classified and we need to respond. We are seeing normalization of it. And so We also see 36%. This is dropping as we go into the labor market and the local organizations. We see there's deliberation, and we would like to greet the Caribbean and commend them for their success with these global indicators. And it is comprehensive as a region. We are looking at the public funds for gender equality. This is a very important indicator. We are in debt. We need to revert these information systems. We need to invest in equality monitoring, especially when we are questioning the fact that women's rights are human rights, and we must have data, we must have information, we need to monitor progress, but also not have any setbacks. Here we have the unemployment rate. It is reflected there, and we will have a panel on this in the afternoon, but women have a lower participation in the labor market, greater unemployment. There is still a wage gap, and we are seeing that for every 100 monetary units, women receive 82. There is a persistent wage gap in all our countries. It's important to think about the remunerated work. 24% of women that do not study and are not in the labor market normally is due to the fact that they are at home. It is a greater percentage than the case of men. And most of the time, it's because they are carrying out some sort of care. That is why women are having better educational averages in different countries, and they are exceeding this. And we see a huge gap, therefore, care is very important. We have dedicated more time to this with SDG 27. We are looking at 20 years of statistics work and systematically preceded by Mexico, with more countries of the region participating, and with ECLAC and UN Women, we are conferring greater value on the Statistics Conference, and of course, trying to achieve synergies with all of the subsidiary organs of ECLAC, all the agencies, the Montevideo Consensus, the Development Conference, the Aging Conference. All these are necessary in order to advance on this paradigm that we see in the region, which is this idea of moving towards regional agenda, a regional pact between Latin America, the Caribbean, and the European Union with a global alliance for care, and advancing towards this, maybe with Maria Noel for the next women's conference that will take place in August in Mexico. And the main topic will be transformations in political, social, economic, environmental aspects. And we would like to see how Latin America and the Caribbean countries are carrying the gender equality agenda forward. And we will see this in all of these summits. We need a multi-level approach. The idea is to advance on a regional agenda and have a collective intergenerational approach with strategic investments and have more integration, more regional cooperation. Thank you. Thank you I would just like to say that evidence and data are not point of arrival. It's a starting point to transform this reality that we're seeing. And with the current trend, we see the need to accelerate efforts in order to achieve these goals. We have a problem. In the region, we see a pause. We see a setback as well in the compliance of several objectives. What really, it truly affects the population as a whole, not only women. And we need to accelerate this. Hopefully, we will see the commitment of you all. If we focus on SDG 5, only one of its 6 goals with available data allow us to foresee its compliance. Most continue with to follow a correct trend. We see that in yellow, but there are some still red. It represents an urgent call for action. It's important to mention that we need to double efforts in order to guarantee progress and promote transformations that guarantee equality and the exercise of women's rights in all their diversity. We need to have data and separate by race, by ethnic groups, by LGBTQ plus community, and women with disabilities, rural women. We are not all equal. We're not all the same. And it's important to obtain these data. And women in the region also suffer several other differentiations and discrimination. We see less opportunities for self-care, personal development, and participation. And this does not necessarily translate into equal conditions when we think about the labor market. We see a persistence of this gap in salaries. Let's not forget that this gap translates to insecurity. There's also a lack of guarantees to prevent violence. And let's not forget violence against children, which is also very perverse. Finally, I would like to say that these structural nodes that ECLAC has given us and that we've made our own and are part of the gender strategy of the regional conference continue to feed the autonomy of girls and boys. And of course, it is not very likely that these obstacles will be overcome in the 5 years that we have left of the 2030 agenda to reach the 2030 agenda. So the celebration of the 30 years of the declaration and Beijing platform and the commitment of the regional gender agenda stress the importance of accelerating the implementation of effective public policies with an intersectional approach based on evidence. So the paradigm of the care society adopted at the Buenos Aires commitment in the last regional conference is projected as a strategic path towards gender equality and sustainable development of Latin America and the Caribbean. I would like to invite you to reflect on the situation. The document you have in your hands makes visible the different indicators, the data that we have. I'd like to encourage you to use it as a tool to promote new public policies that are transformative with commitments that are sustainable for gender equality. Thank you. As a second point of the agenda, I'd like to invite John Sommer to share some of the necessary actions to succeed in achieving gender equality and bridging the gaps that affect women. Thank you. John, you have the floor.
A warm welcome, Caribbean welcome to all participants from the island of St. Lucia. I acknowledge the presence of my esteemed panel, and I thank ECLAC for the kind invitation to speak on this panel. I congratulate you on your proactive and dedicated review processes of the 2030 Agenda for Sustainable Development. Over the last few years, we have devoted time to the issues of equality, unity, and sustainable development in the Caribbean and Latin America. And the intersectionality of the SDGs are very clear when we speak to goal number 5 on gender equality. As the chair of the United Nations Permanent Forum on People of African Descent, I direct your attention to the first International Decade for People of African Descent, 2015 to 2024, under the theme Recognition, Justice, and Development for People of African Descent. This decade coincided with the first 9 years of the Sustainable Development Goals. Assessments of the first decade conclude that the international and regional human rights mechanisms have acknowledged that women and girls of African descent face discrimination in various and overlapping forms, and illustrates how discrimination against women and girls of African descent is manifested in the intersectionality of race, gender, and class, along with other factors such as age, socioeconomic status, sexual orientation, and disability. Further, while the SDGs are a good foundation because they are not wholly economic in nature, they also tackle the social, political, and environmental. They do not adequately consider the specific needs and realities of women and girls of African descent. A gap or deficiency accentuated by the lack of disaggregated data in Latin America and the Caribbean hampers efforts to address specific needs and challenges. Hence, the tendency to conclude that there is much progress in achieving SDG 5. The Committee on the Elimination of Racial Discrimination, CERD, has also highlighted critical issues such as violence and racism in public discourse, education, employment, and media representation, which are central to the discrimination that women of African descent experience. There are also elevated poverty rates among women and girls of African descent caused by educational disparities, due to the lack of access to quality education, due to labor market inequality, where women generally have less access to formal employment opportunities, social norms and gender roles, where traditionally women and women of African descent are often placed in caregiving positions without adequate support for compensation. Economic vulnerability, for example, with regard to natural disasters, which frequently impact the Caribbean nations and disproportionately affect poorer communities where Afro-descendant families reside. Health disparities, limited access to healthcare services, which lead to health issues for women and hinder their ability to work or pursue education. The human rights situation of women and girls are the results of historical, patriarchal, political, legal, socio-economic, and cultural structures and practices that ignore their specific experiences. These structures and practices remain across cultures in both private and public sectors, limiting women and girls and their access to opportunities, leadership, decision-making, and power positions, and resulting in gender inequality, sex-based violence, and discrimination. For women of African descent, the situation is exacerbated by the existence of racism, racial discrimination, and related practices inherited from colonialism and enslavement. The compounded effects of racism and sexism results in multiple and intersecting forms of discrimination against women of African descent and impedes the full enjoyment of their human rights. This further renders them distinct from other women who hold similar positions of leadership and power. The challenges must be approached in a holistic manner if sustainable development is to be achieved. We must frontally address the inequalities entrenched in the race, class, and gender dynamics if we are to achieve and sustain development. Moreover, we must keep in mind the global agendas for justice, including reparatory, socioeconomic, and digital justice, which must be at the heart of achieving sustainable development. In fact, the stakeholders of the Permanent Forum have made it clear that there can be no sustainable development without reparatory justice. Today, the issue of the human rights of women of African descent must be considered in the assessment of the progress of SDG 5 and many other SDGs, as these rights are further impacted by the lack of economic opportunity and autonomy, encompassing credit, land ownership, and inheritance, among other issues. In some regions, many women and girls of African descent lack the access to education, face discrimination in education and in the labor market, and are concentrated in undervalued, low-wage, and care economy. For women of African descent in political and power spaces, violence, intimidation, harassment, mobbing, and abuse are real and evident, including in the media. The effect of such intersectional racial violence threatens to eliminate the gains that we have made, made by women of African descent, excluding them and limiting their influence in decision-making and power positions. Systemic racism in health remains a concern for women of African descent, as they continue to be at high risk of death from pregnancy-related causes, face poor health due to chronic diseases, and are disproportionately affected by violence at all levels of society. The UN publication on maternal health of women and girls of African descent in the Americas in 2023 highlights the following findings. Afro-descendant women and girls in the Americas are disadvantaged before, during, and after pregnancy. Afro-descendant maternal deaths in particular are alarmingly high in both absolute terms and when compared to those of non-African descent and non-Indigenous women in the region. Structural racism and sexism are evident in maternal health disparities that exist across income levels and national and regional borders. Racism and discrimination by medical providers increase the likelihood that women and girls of African descent will experience mistreatment in maternity care. PAHO has actively involved in addressing health disparities and social determinants affecting girls and women of African descent. And this organization recognizes that these groups face unique challenges due to the combination of historical, social, economic, and cultural activities. ECLAC too has noted that women of African descent experience high levels of poverty compared to other areas. Overall poverty rates for women of African descent in Latin America and the Caribbean are alarmingly high, reflecting deep-rooted inequalities that require targeted policy interventions and social programs in improving their economic conditions. In closing, ladies and gentlemen, there cannot be sustainable development when inequality has imposed invisibility on 25% of our population. In 2022, there were over 130 million people of African descent living in Latin America, and it is important to note that official statistics may underreport the number of individuals identifying as Afro-descendants due to social stigma or differing definitions of racial categories. In the Caribbean, the total population of people of African descent is estimated at 44.6 million as of 2023. This means that in Latin America and the Caribbean, close to 160 to 170 million people identify as being of African descent. And that means that approximately 80 to 85 million can attest to gender inequality based on race and further discrimination based on gender and location within small island developing states and rural communities. To deal with racial discrimination in the region in order to ensure sustainable development means not just advocating for financial, social, political, and environmental adjustments, but for demanding structural and systemic change and mindsets. We must advocate for major modifications in our nations of
in the modification of our notions of equality and equity. They must be both intentional and measurable if we are to impact and transform the lives of women and girls of African descent. I thank you.
Thank you very much. That was an amazing presentation of the realities of people of Afro-descendant and the need to put a focus on this population, 85 million, as you well said. That's an amazing opportunity to change that reality, hopefully before the end of this Agenda 2030. A continuación tengo el gusto de invitar a Pamela Martín
I would like
García,
to
quien dará
invite
su informe respecto
Pamela
a las
Martín
medidas que
Garcia,
considera prioritarias para el
who
logro de los
will
objetivos
talk about
comprometidos.
the priorities for the
Pamela
achievement
es
of the
representante
2030
de
agenda. She
Vecinas
represents
Feministas. Adelante,
Vecinas
Pamela, tienes 6
Feministas.
minutos, por favor.
Please go ahead, Pamela. You have 6 minutes for your
Lo mejor
presentation.
posible. Gracias. Buenos días a
Thank you.
todos.
Good morning, everyone.
Quiero empezar
I would like to
diciendo
begin by saying
las feministas estamos
that
salvando
feminists are
y para ayudar a la interpretación lo voy a
making
repetir.
a
Las
bigger
feministas
contribution.
estamos
Feminists
salvando los
are
hogares. Esta
saving
es una frase
the
típica del cono sur,
furniture.
específicamente
Those
de
are the
Chile,
typical phrases in the
cuando
southern
tenemos
cone,
un
especially of Chile,
desastre
when we
natural, un
face a
incendio.
disaster or
Tenemos que
a
elegir qué
fire. We
muebles
have to
estamos
choose
salvando.
what furniture we have to save. And in the midst of these multiple crises, and when hatred is so prevalent, feminists are saving the common home. We are saving communities. We are looking after ourselves, and we're also caring what we have conquered. But that doesn't mean that we are going to stop here. They want us to be isolated, disorganized, and yet we continue to weave networks as we have done for many decades now. We have done this in the midst of dictatorships, so we have done so with the appearance of armed groups, and we have built and we have formed part of that democratic spring and of the strengthening of democracy in all spheres of life. Feminists have been present. However, that democracy that we have today, and that is being challenged and that wishes to be eliminated by those that preach hatred. I like to talk about the Hatred International. Has certain failures, and we're aware of that, and its quality is not adequate, and we must continue to build that, and we must have a democracy that includes everyone and that is imbued with an ethic of solidarity, and undoubtedly it's urgent to defend it, to strengthen it, and look after it. And for that purpose, we need to strengthen movements and protect human rights defenders. This region has the largest number of murders of human rights defenders. And we are also experiencing an age of cruelty, a pedagogy of cruelty, as mentioned by Rica Segato of Argentina, an end of empathy with oneself and with the others. And that cruelty is expressed in different ways. It is expressed in the environment, it is expressed in the economy, it is expressed as a result of inflation, with poor pensions, with exorbitant prices. It is expressed with a genocide in Gaza, and also expressed in the bodies of women, girls, and also expressed in the LGBTIQ plus community. And therefore, all this is transnational. We think together, we go to the same summits, we think in vertical terms, we enter into communications, and we shape agendas. And they measure each millimeter of what they are doing. And what is it that concerns them? Well, they're concerned about the children that are to be born, but they're not concerned about the children in Gaza. They're concerned about the unborn children, but they're not concerned with the exorbitant figures of poverty. And if somebody is not paying attention, I would say that there is no child that is unborn. They are not the subjects of rights until they are born. And these preachers of hatred are at the highest positions of power, legitimating hatred, and thus we find many actions of hatred, and we have many examples in the region. In In Argentina, we had a lesbicide where a man set fire to lesbian women in a home. We have femicides, and we have already heard the figures of this epidemic. We also have the attacks on the participation of civil society organizations with restrictive measures in Peru. We have the work burden, and we have mentioned that over and over again during this week, and what that means in terms of the GDP. Every 20 seconds in this region, when I end this phrase, a teenager gives birth in Latin America and the Caribbean. And we also have countries that bear upon their shoulders the shame of insecure abortion, such as in El Salvador, Haiti, Honduras, Jamaica, Nicaragua, and the Dominican Republic. We also have the criminalization of the relationship of people of the same sex as in Trinidad and Tobago, and the dismantling of gender violence programs, as occurs in Costa Rica. Now, faced with so much cruelty, the force begins the resistance of feminist movements and trans-feminist movements, and the defenders of the land and of the environment. And we have resources, and that has been evidenced here by our historical allies. We have 47 years of a gender agenda. We have the Montevideo Consensus. We have tools in order to continue to resist, but this is not free of charge. It involves a cost. It has a cost upon our bodies, upon mental health, and upon the collective care that we must undertake as from the movements. Within this context, what is urgent is to conduct a geopolitical reconfiguration. We're still impacted with this dependence on cooperation from the north, where countries and states are called upon to rethink about their financial sustainability and to strengthen South-South and triangular cooperation. And to round up, I would like to pose the following question. If we believe that feminist movements and trans-feminist movements have the same or greater power than anti-right movements, and the answer is yes, we have the same strength in order to face them up to them and resist, but we have a crucial difference. We do not use the same tools. So we do not use intimidation, violence, and fear. We have other tools. We have creativity, love, union, sustained work, expertise. And we also have examples of that in the region. We have Colombia with abortions up until week 24 and the elimination of child marriages. That also forms part of feminist alliances and movements. We have Nayarit, Chihuahua, and Campeche, on top of Mexico with 21 states that have depenalized abortion. In Uruguay, we have President Orsi's adding a trans person for the first time to his executive, and we have Justice for Telma, an important case in Argentina where Brazilian justice did what it had to do. And so we are a tide. We're a green tide. We're a multicolor tide. And let us imagine that what will happen in 2030. Well, we will do what we have always done. We will resist, and we will be looking ahead. We will be work and provide strength to this new world, because we are not going to be left with this pain, and we will struggle for the liberties, the freedoms that we are still lacking. Thank you. Thank you, Pamela. And I believe that feminists have been saving our common home for more than a century, when suffragettes began, when we weren't even people or citizens. And yet we now have our rights, and we are not going to take not even one single step back. Now, I would like to offer the floor to Ana Raquel Martínez Chamorro, who is the Regional Ministerial Secretariat for Women's Affairs and Gender Equity of the Santiago Metropolitan Region. Please, you have 10 minutes. Good morning. As mentioned, I represent Minister Orellana, who is presently in India together with President Boric. I would like to specifically refer to what is mentioned in 5.1 of the development goals related to recognizing and acknowledging unpaid domestic work via public services, infrastructure, and social protection policies. In that sense, we have to account as a state of our progress, and that has gone hand in hand, undoubtedly, of a work that has been participative. In 2023, when we were able to generate, together with UN Women, we were able to generate dialogues together with a whole series of people throughout our country known as Hablemos de Cuidado. Those dialogues provided us with social legitimacy, but at the same time enabled us to talk with key stakeholders in Chilean society about the issue of care. That implied the participation of over 12,000 people in all regions of our country, and only evidenced what we have already known, that 80.4% were women, because historically they have borne the burden of care. And based on this work, we were able to create a national care system that focusing on intersectionality, integrality, and of course an intersectorial approach. Up until then, Chile had a whole series of services that provided care for people, but these were not related or interconnected. The objective, therefore, was to create and promote support networks so that a cultural change and a change in paradigms could be achieved to finally obtain what is known as the Society of Care. In 2023, we provided what is known as the basis of Chile Cuida. Chile Cuida seeks, among its principles, to understand care as a social and human right, and for that purpose we undertook these dialogues, and that implied certain important actions. First of all, quantification. We have spoken about the importance of data, and in Chile we only had estimations about how many people provide care in our country. And we did that by using a tool that we already have in our state, which is the National Household Registry, but generating a module so that people that provided care could register there. And thus, we were able to quantify this. And in October 2024, we have identified 144,000 carers, and 114,000 of them, in other words, 86.4% of them, are women carers. And thus, we were able to understand that the estimation that we have as a country is that in our country around 1.2 million people provide care, undertake care tasks, and that women devote more than 41 hours per week to that work. So we have a difference in terms of a gender gap in accordance with our last national survey on care. That was the result of a commitment that our president entered into with the Ministry of the Economy, despite the fact that we lost that during the pandemic when domestic care became even much more acute. That reveals that we have a gap of many hours between men and women when it comes to providing care. Now, together with that, in addition to having this quantification, in June 2024, we submitted a bill to Congress that tried to achieve something that the rest of the state didn't understand, because we began to understand care as a triple identity right. In other words, the right to care, the right to be cared, and the right to self-care. Now, this is relevant because in the past, the state only envisaged certain services to people with disability or to people that require specific types of care, but it wasn't understood. What wasn't understood was who was present there. There are people that receive care need to be cared for, and the people that provide care also need to be cared for. And we're talking primarily of women carers. Now, this has had a very good aspect precisely as a result of these participative spaces that we had. And that is why in March of this year, we can share good news with you, because the bill was approved in the lower chamber, and it has also already been sent to the upper chamber, to the Senate. So hopefully by year end, we should have a law to establish the basis for what we have named Chile Cuida. Now, the objective of this bill is to establish a network-based management system, institutions, plans, programs, policies, services, and benefits that seek to provide care and support and linking the state with families, but also communities, eliminating the redundancy of offers that we used to have when it was only aimed at the person that needed care and in a hyper-focused fashion. Now we can seek measures that seek to establish relations with social services to provide support and care, a change for carers, a free time for them, and of course, community networks. Likewise, we have produced a national policy for care and support that was launched in March of 2025, and its objective is to establish a new way of the social organization of care. Our objective is to deprivatize care and to socialize this as a responsibility of society as a whole in order to acknowledge care work, delay and prevent and reduce dependency, to promote autonomy and mainstream social and gender co-responsibility. And we hope that its implementation will advance in the framework of the 5 Rs as proposed by the UN, and to recognize, redistribute, reduce, recompensate, and represent care.
We have another objective, which is related to the first National Care Support Plan, which defines specific commitments and actions from different sectors, and it is a 2-year plan. I'm mentioning this because this is not per chance. As you know, we want to draft a state-level policy that would remain over time. That's why it speaks to the need to define deadlines, responsible parties, targets, and goals. Finally, I would like to refer to how, during this entire process, we have defined programming and measures to strengthen existing programs, such as the National Caregivers Roster. 120,000 individuals have already signed up, but we think there's roughly more than 1 million out there. And also a credential for caregivers, and that would, to a certain extent, allow us to identify these new subjects of care, that is the caregivers, and also recognize that the state could recognize this work, thereby granting certain benefits, such as early, timely services within the state. And this could be done by FONASA, the Banco de Estado, and others. Likewise, we have already announced something quite important, which is implementing the community-based care centers that seek to provide care to unpaid caregivers, and also allows for those individuals who rely on care to try to be as self-sufficient as possible. Now, this also involves educational services for caregivers through public and private services. We have also instituted a system to pay caregivers, and we also have the 4x7 program that was implemented in more than 190 districts throughout the country to provide support for 2,500 women. It allows for women to drop their children off at a caregiving center. I would also like to mention support for reinforcing the caregivers network. This boosts the quality of life of caregivers and provides support for care-dependent individuals. I'm about to wrap up. This provides time for caregivers for recreation, free time. Now, again, all of this is related to other relevant commitments taken on by our government related to this SDG. And again, this is related to a national voluntary review for pension, and we also have a bill, as mentioned earlier, the comprehensive law adopted last year after being in the Congress for 7 years. This allows for a violence-free life. We also have an intersectoral strategy related to sexuality and the national support and care system in the national caregiver roster. Hopefully this bill will be passed through the Senate and will become a law for caregivers and care recipients. Thank you.
Muchísimas gracias, Ana Raquel.
Thank you, Ana Raquel, for providing us with a status update with regard to the care system in Chile and the various advancements made over recent years. It's UN Women is proud, jointly with ECLAC, to have provided support to the government. Hopefully, the law will be enacted this year. In any event, thank you. This caregiver roster is quite innovative. It's a good practice. Now, allow me to open the floor to the delegates for their statements. Brazil, go ahead. Thank you. Good morning. Still? The Brazilian government is firmly committed to creating sound national mechanisms to foster gender equality. The salary wage law addresses wage gaps and fosters following up on fairer wage policies. The national care policy is another historic step towards recognizing care as a right and as a task that should be shared by family, state, and society. By implementing full-day schooling and daycare. We also have the National Pact to Prevent Feminicide as a way to address violence, and the program for women living violent-free to strengthen the protection network and expand services, specialized services. Regarding the Harassment and Discrimination-Free Prosecutor's Office, there is a statement to provide greater judicial security to how sexual harassment is addressed in the federal sector for civil servants. Brazil's experience in recent years reinforces how we cannot have inequality without addressing hunger, social injustice, racism, misogyny, which truly impacts women's lives, especially the most vulnerable women. That is why, in addition to leading the Global Alliance Against Hunger and Poverty, Brazil has policies such as the Family Package, which benefits more than 20 million families. 83% of these are actually female-headed households. We also have the gas subsidy, which provides support to 5.4 million Brazilian families. 90% of these are women-led households, and 73% of the beneficiaries of the Family Farming Food Acquisition Program are women. Internationally speaking, despite progress made with regard to universal gender-related language, we regret not having reached a consensus regarding a specific paragraph related to the rights of African-descended women and girls and racism, as well as language on health, reproductive and sexual health. We cannot have sustainable development without gender equality or without ethnic racial equality either. Thank you. Thank you. Costa Rica has been recognized. Thank you. Good morning. Ladies and gentlemen, the Sustainable Development Goals represent a collective commitment for a fairer, sustainable, more equitable future. The SDG agenda reminds us that not a single goal can be met without the active participation of women and girls, specifically SDG 5, which is key to unlock the potential related to the other objectives, because gender inequality is related to structural barriers that prevent progress in education, health, justice, and peace. Despite constituting more than half the global population, women and girls continue to face obstacles regarding access to education, health, political participation, and wages, now, in addition to gender-based violence. Now, in this regard, Costa Rica, as the pro-tempore chair of the Council of Ministers of Women of the Caribbean and the Dominican Republic, promoted key initiatives such as fighting against teenage pregnancies and strengthening gender-based police forces. Women's role in decision-making is crucial. We would like to underscore that Costa Rica has a parity Congress, and 48% of ambassadors in Costa Rica were women in 2024, ranking Costa Rica fourth in this regard. Likewise, the country prioritizes gender equality and climate action and empowering women and girls in rural and coastal communities where vulnerability is greater. In order to guarantee progress, it's essential to reinforce local and regional coordination with regard to monitoring national and international commitments with a view to close gender gaps while eradicating human rights violence. Each step towards gender equality is progress towards a more sustainable, fair world. The path is long, but every step counts. Only when all women and girls will be able to maximize their potential in a discrimination-free, violent-free world will we be able to secure sustainable, equitable development. Thank you. Thank you to Costa Rica. Ecuador has been recognized. Thank you. Good morning to everyone. First of all, allow me to commend the panelists for their spot-on presentations. I would also like to thank the Regional Director of UN Women for her valuable contributions during this work week. It's an honor to take part in this forum and to share the progress that Ecuador has made with regard to gender equality and eradicating violence. Our commitment is solid, and this is reflected under public policies that reinforce the judicial system, boost care for victims, and promote respect for all sectors of our societies. One of the most relevant steps forward has been reducing by 24.2% the national feminicide rate for each 100,000 women, and this was during 2024 when compared to the previous year, 2023. Now, this shows that the strategies implemented thus far are yielding concrete results regarding gender equality. We have also reinforced the role of women in decision-making. 75% of the ministries in Ecuador are led by women. Now, this accounts for 33% increase, 30% percentage increase when compared to the previous period. This is a clear example of the political will to show these gaps, close these gaps. Ecuador has gone up 24 points with regard to gender aspects, and we are ranked 16th. Now, this is the result of the application of effective policies aimed at doing away with structural inequalities and fostering equality across the board. As far as the production sector is concerned, we have become one of the first Latin American countries in implementing gender equality policies in the job at the job place. Now, this recognizes public and private companies that foster economic growth under the gender approach, providing more equitable and safe working conditions. In this regard, and there's special support for planning. We continue to work on a methodology to assess policies to include the human rights and gender approach. We receive support by UN Women to this end. The purpose is to determine whether or not the policies are promoting gender equality. We have also created a legal framework that guarantees a fairer and more inclusive society. In this regard, 3 key laws have been enacted: the organic law for supporting and transforming the situation for girls, mothers, and other victims of feminicide. This organic law as well for reforming the situation relative to on-the-job harassment and violence. And there's another law that guarantees equal pay and does away with gender-related wage gaps. Ecuador moves forward with decisive steps to have a more equitable, fair society. We continue to promote public policies that are a reflection of our common goal as a country and as a region and as a world. Thank you. Peru has been recognized. Good morning. Greetings to the moderator and panelists. Gender equality in Peru is a primordial objective. Despite this, well, we have seen a drop in gender violence in all of its forms. We still require extra effort to eradicate this and to ensure the full exercise of sexual and reproductive rights. Evidence of physical, sexual, psychological violence by men against women in recent months has shown a slight upward climb for 39% for the 2018-2023 period. Now, if we break this information down to types of physical, sexual, and psychological violence, we can see drops in all 3 categories. The percentage of women suffering physical violence drops from 10.3 to 17 dropped from 17 to 10%. The Ministry of Women has also recorded several types of progress. For example, we have published the National Gender Equality Policy adopted in 2019 that focuses on solving discrimination, structural discrimination against women caused by sociocultural patterns, excuse me. Also, the policy addresses institutional cultures and norms that reinforce subordination of women. Another regulatory milestone in Peru was the enactment of Law 13.3.4 to prevent sanctioning and eradicating violence against women. This provides policies and measures to protect victims, as well as for reparations when damage is caused. Regarding more concrete efforts to stop gender violence, we have the National Program for Eradicating Poverty Against Women, and this in Peru is what we call the Aurora program, and this involves actions to prevent violence and provide care and services and protection to victims of violence against women. And this provides support for sexual violence victims as well. As part of these measures, there has been reports on municipal ombuds offices for women and girls. 90% of the municipalities nationwide, rural, 31% of these have been accredited to address domestic violence cases. We have also reported on the implementation of 91% of women's centers. These provide workshops, awareness regarding gender-based violence, etc. It's important to make progress in the regulatory realm because we have seen a slight drop with regard to forced marriages when compared to 23. a large number of women have reported being married before turning 18. Then we need to make progress there. This means that publishing the National Gender Equality Law and the law to eradicate violence against women and family members and Supreme Decree which demands mandatory gender training of public civil servants all represent regulatory milestones on the path towards securing gender equality. The Ministry of Women has been fostering all national policies, regardless of the topic, that fostering that all national policies include the gender component and that the indicators include gender equality aspects to have a better understanding of, well, in order to improve public interventions across the board. We also have challenges to secure SDG 5, which is strengthening prevention measures. For example, evidence has shown that the strategy to eradicate gender-based violence involves actions, but you cannot ignore prevention. And so we've seen an increase in the budget for Ministry of Women, specifically for services, care services. And then we have mainstreaming the gender focus, which is yet another challenge. And the policies, national policies, have been working on that in recent years. We see that this is also trickling down to the planning area. Another challenge is complementarity, intercultural aspects, and intersectional approach, in addition to gathering information on gender inequality.
Y es una característica de información un poco complicada.
It's quite difficult and complex given the characteristics of the territory in Peru. But this, of course, means that we should make the effort to have the information. Thank you, Delegate.
Dominicana, por favor. Gracias.
Dominican Republic has the floor. Thank you, Maria Noel. I'd like to first thank you and Ana for the presentation of the report on the gender indicators, as well as the panelists that we have shared. It is the second publication on the indicators on gender, which show the advances of gender equality and compliance of SDGs in 2023 as part of a regional expression.
And of course, this has been followed by UN Women and Gender Affairs at ECLAC, following the UN mandate with a special mention to FAO and in other instances to ECLAC from the Statistics Division and others. I would also like to thank, in my capacity as Executive President of the Statistics of the Americas, that to mention the effort that we have made together with Carlos Garcia and Andrea Llerena, who have been in charge of this report, as well as those who are part of the team that accompanies us. So they are a tribute to sorority. This report shows the importance of statistical data to elevate the awareness and to manage knowledge and make decisions based on evidence. It is oriented to guarantee rights, promoting individual and social changes, because first, the data and statistics make visible the vulnerabilities and equalities and inequalities that we see in the exercise of human rights in different sectors of the population. And the public policies, plans, and projects that aim at to bridge these gaps and are of the utmost importance to obtain the expected results of these policies. And when statistics and data are produced from gender perspective, they play a very important part to accelerate public policies. This is of the utmost importance for evidence-based decision-making and for the design, monitoring, and evaluation of inclusive policies that are equitable and enable the analysis advances to guarantee the rights of women and girls. This following the mandate of the 2030 Agenda and its commitment to not leave anyone behind. For example, based on data and statistics in the Dominican Republic, taking into account the household survey from the National Statistics Office, we address the issue of sexual and reproductive right and health based on the elaboration of the prevention policy and teenage pregnancies that the Dominican Republic showed through the work with girls, boys, adolescents, and by the City of the Dominican Republic. Following the preliminary information we had from the National Health Care Service, we've seen a significant reduction in teen pregnancies in the Dominican Republic, which have gone from 27,476 pregnancies in 2021 to 17,000 in 2024. And you know what this means in terms of rights for an adolescent. And we need to invest on the same. It requires an investment on data, periodic data, and which in a detailed and disaggregated way allow us to understand the needs of the different groups and guarantee gender equality and monitoring. This requires the existence of these methodologies that allow us to better address the realities and phenomena, economic, social phenomena. And once established, it's important to have personnel that could take them to practice, including the generic aspects of the statistics reproduction system. And when we identify the needs and go on to the design, the collection, the processing, and dissemination, among other phases, I would like to stress, as I have in previous sessions, the Statistics Conference of the Americas and Women's Conference, with the contributions that these people have made by the promotion of regional standards to advance in the measurement of gender indicators that have risen as an institutional aspect of the Statistics Conference of the Americas, a space that, as a region, we have made significant contributions to. We've also sought to promote public-private partnerships, such as the panel that I moderated yesterday, allow us to see the emerging aspects of artificial intelligence and better understanding gender and climate change, which is essential for the islands of the Caribbean, and that we began working with as of last year. These partnerships will allow us to count on the standards that will allow us to compare the realities of our countries and to better design statistics that will support us in generating information, contributing to manage decision making. Thank you.
Muchas gracias, Michiotis, y muchas gracias por el trabajo maravilloso.
Thank you very much for the amazing work you're doing as president of the conference. I'd like to offer the floor to the delegate from Venezuela. Good morning. Actually, good afternoon. I would like to greet everyone present. We have heard several times that the core of the 2030 Agenda is social development.
Asimismo, se ha puesto en evidencia el fenómeno estructural de la feminización de la pobreza. Por otra parte,
on the other hand, we've ratified that it's not enough with political empowerment of women. It's important to make it sustainable. These programs grouped in the Venezuela Mujer mission, we want to talk about the experience of the Development Bank, Women's Development Bank. And it marks a very important turning point for women in Venezuela, defined by different characteristics. One, granting microcredits, microloans, and we see this as going beyond aggregated macroeconomic data, financing to associative aspects, knowing, having more details on these social programs focused on attention to their basic needs at a local scale, comprehensive care through non-financial services that are not part of traditional aspects. And contributing to, with the grain of sand, to the reduction of gender gaps that still persist in these contemporary difficulties and circumstances. We need to bridge this historical debt, building a better society for all. Thank you, Delegate. I'd like to offer the floor to the Delegate of Mexico. Senator, you have the floor. Thank you. I would like to especially underline that we would not be talking about Sustainable Development Goal 5 if we didn't have a previous story. I would like to point out that the first International Conference of Women took place in Mexico in 1975, 50 years ago. And one of the women that was most recognized is substantial for the elaboration of the Declaration Against All Forms of Discrimination. This was led by Aida Gonzalez, Mexican ambassador. This is of the essence for us to reach 30 years ago, to arrive in Beijing 30 years ago. And Beijing has opened a very important situation. What has happened? Women and, of course, very important institutions such as the UN agencies, UN Women, and of course, I'm also talking about ECLAC, have allowed us to transform the language. We have changed it completely, and having been invisible, most of mankind, we have been present with our causes. In the case of Mexico, one of our main aspirations was to achieve the gender quotas and parity. In 2019, we achieved an institutional reform that obliges parity in everything, and both at a republic level, in the legislative and executive powers as well. Today, of all three powers, we have women leading the presidency of the republic, the first woman president in Mexico, who has also embraced the women's agenda. But this political empowerment that allows us to be leading all three branches of the government, 50 and 50%, and that establishes in the law the obligation for a quota, and we still have, however, a lot to do, because parity in the decision-making space is lacking in other areas. So what have we done with the agenda? We have enacted very important laws. A law against all forms of violence against women is extremely important. We've been able to transform legislation so that rape and harassment can become very serious crimes. And with technology, the wonder of having them has also implied certain risks, and we have built this law that uses personal data that hurts the intimacy of women and is disseminated in social networks. There is also the Malena law. While we advance in the legal aspect, in reality, and in the actual culture, there is still significant aggression against women. Ley Malena was based on a woman who was the victim of acid that was poured on her by her partner. We have a constitutional reform for Law 1303, which enables so that no candidate that has exerted any sexual violence or does not pay alimony cannot be a candidate. Together with these advances, we also have significant challenges, and the violence, this femicide as a concept that has been adopted by Marcela Lagarde, one of the leaders in feminism in Mexico, states that advances should become a world free from violence. We continue to experience femicides, and it is quite unfortunate. And we want to change the predominating culture because this prevalence in femicides is usually by someone who is in their family, someone they know, or their partner. So we need to move forward. We need to advance in these matters in order to guarantee rights for women. It is not only about commitment, but also having specific sanctions to guarantee our rights. And the commitment with all of these constitutional reforms sent by the President of the Republic must guarantee that women can live with access to sexual and reproductive rights so that we can bridge the salary gap that affects us and so that we can fully engage in education and the labor world. These are aspirations, but they're also part of our commitment. Thank you.
Muchas gracias, senadora. Ahora, a continuación, le doy la palabra al
Thank you very much. Now, the Vice Minister of Uruguay. Thank you, and good afternoon, everyone. Here is, well, we will change the presentation, but I want to say what I was going to say yesterday. We talked about some commitments that we have. And Uruguay knows that it is unequal. These are projects that we've seen in Parliament have been unclassified these recent days. What really matters is that Uruguay has a huge problem with wedding. It is allowed as of 17 years of age. So this has already been unclassified, and we're working on that. We have some information, but not very high quality data on the salary gap. And we have also declassified by will, so that there is an obligation to inform salary or wage gaps, and it will be much more specific, so we will be able to better understand where these differences lie. The third is very moving for us. It expresses the worst type of violence, which is sexual violence, which is, it's not only women, we also have children and adolescents that are victims. So Uruguay suggests that these never expire, and that would turn us into a different country. But as I said in the beginning, that the interventions made by the other panelists changed what I was going to say a little. What Pamela mentioned made me rethink my comments, and with some references to our government and to others. I am part of a generation that between 2010 and 2015, in my case, coming from sexual diversity, led what Uruguay says is denied to the government, which were social movements, and these put Uruguay at a very important moment. And here we have rights, the Afro movement, feminism, and all that. And I'm sorry, I'm going on about several things, about how different things were going to happen. And I wanted to share with our colleagues that this is a very personal situation. We're not really used to wearing so many hats, but when we talk about gender, when we talk about ethnic and racial aspects, when we talk about so much pain that has been accumulated, we are talking about our lives and the inability to develop them. So I feel that we need to put more love into politics and to the development of these policies, because not discussing these matters, not advancing or working on them, is putting ourselves on the side of perpetrators of inequality. Thank you.
Thank you, and you're quite right. We must always put more love into what we do. Now I'd like to offer the floor to the High Commissioner's, United Nations High Commissioner for Human Rights, distinguished delegates, feminists and colleagues. It's a great pleasure to speak on behalf of the High Commissioner for Human Rights. The 2030 Agenda is explicitly grounded on international human rights instruments and prioritizes the principles of inequality and non-discrimination. 36 countries and territories in Latin America and the Caribbean have undersigned the UN Convention on the Elimination of All Forms of Discrimination Against Women. We celebrated that in countries of this region, laws have been approved to prevent violence against women, and we highlighted that 14 countries have approved comprehensive laws to deal with all forms of violence in different spheres. But despite this effort, there are still structural challenges such as the persistence of femicides, the sexual division of labor, social organization, which is unequal when it comes to care, and gaps to technological and financial resources. As discussed today, economic violence is something that we want to bring to the fore, because that is a very damaging type of gender violence against women and girls, and it has often been left aside. However, it's an important obstacle for the exercise of human rights. Economic violence represents a barrier for the empowerment and the economic participation of women. The enjoyment of economic, social, and cultural rights of women is a necessary condition for a fair and equitable society, and also for sustainable development. the committee that supervises the Convention for the Elimination of all forms of discrimination against women has highlighted that gender violence against women and girls, including, of course, economic violence, is one of the social, political, and economic mechanisms which is fundamental through which the subordinate position of women is perpetuated compared to women and their stereotype typical roles and becomes an obstacle for equality and in consequence requires urgent measures. So we need laws, but we also need public policies in order to change behaviors. Cultural and social norms often perpetuate gender biases and justify or normalize economic violence. For example, macroeconomic policies often are regarded as neutral in gender terms, but they may have discriminatory effects when they are applied in societies where there are already structural inequalities and multiple discriminations against women, both in the legislation and in practice. At an international level, national accounts must consider the economic value of care and support work, both paid and unpaid, because this is not included in the estimation of GDP and of other macroeconomic indicators. We need to promote actions in order to promote the economy of human rights of women that prioritizes people and that seek to eliminate discriminations, reduce inequalities via education and social economic rights and the right to development, among other rights. Thank you very much. Thank you. Now I will act as co-moderator now, and I offer the floor to the representative, and I thank the representative of UNHCR for reminding us that there is no area of policies that cannot be reviewed as from a human rights perspective, and as from a perspective of gender equality, and as from a perspective of diversity and intersectionality that forms part of the agenda that we have been building and continue to build in this region. Now I'll offer the floor to the FAO. Thank you. Dear Anna, very good morning to all of you. I would like to greet ECLAC, UN Women, in the person or represented by Anna and represented by Maria Noel, together with the panelists that accompany us this morning. I would like to thank the delegations and civil society organizations that accompany us today in this very important activity that reviews how we are faring in our region when it comes to sustainable development goals. As from the FAO, we are highly concerned with progress that has been made with regards the SDG that has to do with the elimination of hunger, because regrettably since 2018 we have evidenced a trend, the trend to feminize all malnutrition forms in Latin America and the Caribbean, not only of hunger. We're talking of malnutrition as a result of lack of food, but malnutrition also as a result of excessive food or obesity. Women in our region are the ones that are present are suffering most food and nutritional insecurity, and also more obesity. And the Caribbean, above all, regrettably, are the ones that have the highest rates at this time in terms of the feminization of obesity. And this is a situation that leads us to think about the welfare state that we seek for our region. And also dwelling on key aspects of what for us will be our next regional women's conference. Issues related to intersectionalities. And here I would like to thank the agencies in this conference, because they have attached a very important relevance to the issue of intersectionality. What is happening to women in rural areas? Again, we are aware that they are far more They suffer far greater violation of their rights, greater poverty, greater feminization of hunger, but also the issue of care. I believe that what will be fundamental is the discussion of community care within the scope of the regional conference. And I would like to invite delegations to think how we are able to contribute to the discussion around the need to think of care systems that actually are transformed into services for rural women. There are 4 elements that in the recent global report of the FAO that I would like to invite you to read, together with this report that we are producing in our regional office, and that we will soon we will be publishing a report of FAO at a regional level about this global report, SWAP, that has a lot of disaggregated information. And I believe that for delegations and for all of us here, it will be fundamental to read for the next conference, because it refers to 4 aspects where we have evidenced as a result of country experiences that have made headway in terms of bridging inequality gaps in the rural world, and what they have done. First of all, social protection systems that actually reach rural communities. Regrettably, that gap continues to exist, and the public policy related to this social protection is fundamental. The issue of access to land, the work that we conducted recently, and I would like to support what the president of the Statistical Conference has said, and also thanking Karen and Andrea for conducting this work together with ECLAC in terms of bringing to the report everything that is related to the situation of women in terms of the right to land, in terms of access to land. We believe that another aspect that needs to be reviewed, and here parliamentary work is very important. We need different legislation. We need to remove discriminations there. And of course, data, better data, disaggregated data, all that is fundamental. And so that is also a message for us all. I would like to conclude by saying that together with the regional conference on women, this year we will also be holding and we have entered into a partnership with other UN agencies such as UN Women, such as the UN Population Fund, in the commemoration of the Decade of Rural Women in Latin America. That was also promoted with SIMOIA. And I would like to remind you of what the UN General Secretary has highlighted in terms of celebrating next year as the year of women farmers. And that will lead perhaps to a more coordinated work around these issues. And of course, the year of agricultural or agrarian reforms. Within the framework of lack of access by women to land, it is fundamental for us to discuss that. And here I call upon civil society to obtain the necessary support in these initiatives. Thank you for the opportunity, and well, the discussion is ongoing, and we'll meet at the regional conference. Thank you. The regional director of UN AIDS has the floor. Thank you, Maria Noel, and I would like to also express my gratitude to all panelists for an excellent panel discussion. I would like to benefit from the fact that we're commemorating 30 years of the Beijing platform to remind and bring to the fore the issue of women and HIV, which was a central issue discussed in Beijing. Because I also have concerns 30 years later, and I want to highlight some of them. One of them is the late diagnosis. So women are not receiving a timely diagnosis of HIV. And sometimes it impacts, this reality impacts 50 or 70% of women with a late diagnosis. And this leads to a greater mortality on the part of women. The mortality of women for AIDS-related problems has increased in countries such as Peru, Panama, Paraguay, El Salvador, Costa Rica. We are also aware that the most discriminated women in our societies have a greater prevalence, among them sexual workers, transgender women. We also know that Afro-descendant women, as was mentioned, for example, in Brazil, Afro-descendant women have a prevalence which is twice as much as women that belong to general population. And despite that, we have scarce data. Some women from indigenous communities have a greater prevalence. For example, women women in Peru have a very high prevalence, and this is of concern. A report that will recently or soon be issued by the International Community of Women that live with HIV reveals that 71% of women in a study that encompassed some 5 countries outlined, again, more than 70% mentioned that they have been subjected to violence because they were women and because they were HIV positive. I am not going to repeat all the important actions that all panelists have referred to, but highlight that we should include women in the suffering the risk of HIV or living with HIV. And a very important issue when it comes to this pillar of care mentioned by Chile in its program, in its programs, is self-care. I believe that this pillar is very important because women receive this late diagnosis because they don't have time, or they don't know that they are at risk, or they don't have time to resort to the services that are necessary. And as I said this morning, we have innovations that are available. Innovations such as the oral PrEP, which is available, and women don't know that they could gain access to it, plus also all the other tools that we have available in order to promote prevention. Thank you. Thank you very much. Please, Regional Director of the UN FPA, on behalf of UNFPA, I would like to also congratulate this panel. And if you allow me, I would like to go back to the discussion of the previous panel in the sense that we need to emphasize the need to make headway with the generation of socioeconomic evidence about the aspects that have fallen behind when it comes to gender equality. In concrete, we need to advance, for example, in estimating how much what is the cost for countries of maternal mortality? What is the burden upon health systems and upon social security systems? Or what teenage pregnancies cost? And children's marriages, how much it costs in terms of lost productivity and also in terms of the loss of fiscal revenues. Now, this evidence is necessary, but likewise the positive evidence of the return over investment when it comes to strategic investment for the advancement of gender equality. And I believe that this is absolutely fundamental in a context that is increasingly polarized and ideologized, where we even question the basic concept of gender equality. But the idea would be using this evidence to continue to promote the agenda and reinforce with data that beyond ideologies, gender equality is a very good investment and a very good economic policy. And in this sense, and repeating what was said in the previous panel, the Conference on Financing for Development is an ideal opportunity so that in collective terms, this region may put this idea forward with studies, with analyses, and also involving very especially ECLAC banks, development banks, CAF, World Bank, IDB, with this idea. And with this idea to transform this toxic narrative that we are increasingly evidenced in various spheres about the questioning of basic rights of women and gender equality. Thank you very much. Thank you, Susana. Now I'll offer the floor to civil society. Please go ahead, María José Lobertino. Thank you very much, María Noel, Ana Westmes, and all the panelists, and greeting our colleague Pamela from civil society, and also supporting her words. I would like to speak on behalf of the Citizens Association for Human Rights and on behalf of feminists in Argentina. For us, the feminists that were in Beijing in 1995, it is it truly makes us very proud to have contributed to the advancement of SDG 5 in these years, achieving the law on abortion, the law on egalitarian marriage, on gender identity, and the law on parity in political appointments. However, we are truly shocked within a context where our government has left the 2030 agenda, threatens to do away with the abortion law, with the egalitarian marriage law, and with the law on gender identity, and it has already done away with a decree that enables the non-binary ID card. And of course, we are out on the streets so that we don't fall behind and trying to prevent the elimination of those laws. However, what has disappeared is the Ministry of Women. What has also disappeared is the National Institute Against Discrimination, Racism, and that I presided at a given moment in time. We have taken financing away from sexual and reproductive policies, and what has also been done is that finance has been eliminated from policies against gender violence. There is no financing for comprehensive sexual education programs. The ENIA program, which was the program to prevent teenage pregnancies, that obtained many achievements and successes. So we are truly shocked. More than 200 NGOs in Argentina signed a document that we submitted to the UN questioning all these regressions, especially understanding that they violate international treaties, human rights treaties undersigned by Argentina, and that violate the principle of non-regression that is enshrined at an international level.
Of course, we are consternated by harassment, by political power for feminists. There have been harassments and aggressions against female journalists, female influencers, artists, just for saying and repeating what we all say in the feminist movement, women's movement. We are also profoundly concerned with physical aggression and violence against our retired women who meet every Wednesday. There have been regressions with regard to pensions for people with disabilities, and so every Wednesday pensioners mobilize, and several Wednesdays in a row, our seniors have been victims of violence. So we're concerned with that. We're also concerned with flooding and fires in Argentina, the criminalization of many of our environmental advocates and defenders, specifically indigenous groups, the threat to amend the migration law, which is obviously something that is important, and there's resistance. There is also a lack of resources or inputs for individuals with HIV, inputs also for birth control and abortion. And this, again, leaves our provinces, where federal state leaves our provinces in charge of many of these policies. As a result, this leads to greater inequality because, as you know, not all the provinces have the same resources. So on the one hand, we would like to request the solidarity of the agencies in the system to support what is being carried out in the Argentine provinces. We know in that regard that UN EP, UNDP, UN Women are doing their part. And we would like to say that our care bill has been stuck in the parliament, and we hope that our parliamentarians will continue to drive this despite the context. This year, we have witnessed large mobilizations in early February, led by the LGBTQ plus movement, and there was a spontaneous mobilization, and all the other organizations joined efforts and movements. And on March 8th, we also witnessed a key mobilization, and then again the Plaza de Mayo mothers protested as well. And this is in I would also like to say that with regard to the UN and the region, we know that we have this ongoing foreign debt. Nonetheless, we hope that this opportunity today for multi-regional dialogue will continue to exist and persist beyond the ideological differences, and may we continue to be unified. Let's not sink our own ships, because the governments, the administrations come and go, and those who remain are all of us. We're all part of society. Sometimes we hold positions, sometimes we do not. So just I would like to remind all of you here that at some point in time you will be on top or on bottom, and we're all part of society, and civil society always tries to defend society's rights in keeping with the same principles and values, and in keeping with the fundamental human rights, which is something that affects us all, and this is regardless of the powers that be in the moment. Thank you. Gina Vargas has been recognized. Thank you, Maria Noel. I am Regina Vasquez. Oh, I'm sorry. I'm sorry. Vargas from Peru. Then I will give you the floor. Okay. I would like to echo Maria Jose's remarks and Papela's remarks. I think these have been key contributions. So I echo these, and I would say that I fully agree, but let me refer to other aspects too. I would like to commend the panelists. It truly has been quite a luxury to have you all here with your insights. I believe that the linkage between the Beijing platform and the 2030 agenda is not only necessary, and they are complementary mechanisms, but this linkage is extremely powerful and democratic, and I think that's one of the key challenges we have, that is to continue attempting to strengthen both of these elements and secure their progress. It's not just about SDG 5, which, by the way, is important, but it's about mainstreaming and enriching all of the benefits related and the actions related to the Beijing platform. There's something else that I think is important and that has been addressed by many of you, and that is the way in which the agenda, the Beijing agenda, which, by the way, has not been a static experience. Now, for 30 years, we have seen a wealth of different insights and reflections and analyses, and this constitutes a significant advancement. For example, there has been treatment of intercultural aspects, recovering the rights of women and others, and the rights that were stalled for many years and other aspects. But allow me to now make special mention of the meaning of care as now a key component relative to the progress. Now I would like to, as a result, resort to a dear member of CEPAL, who's no longer here, Alicia Bárcena, who clearly said that it's important for us to make sure we have a change in the model, the economic social model, by 2030. And clearly, great strides towards that have involved including care, the care component. It's not just about sexual and reproductive rights, but it's also about having care included in policy, in economic resources. This allows for greater freedom in terms of profound democratic change. So it is true. We need to, in order for there to be progress regarding development, women need to see progress with regard to economic, social, personal care aspects. So we've seen interesting advancements. For example, Chile. I think the progress in Chile is quite profound. There are other examples as well. And there are different ways to assess reality. Some may be partial if you do not include the comprehensive dimension of change affecting women. Allow me to wrap up by saying that all of this obviously reinforces something that is democratically weak. I mean that we have low intensity democracy in many of our countries. So progress regarding the care component and the agendas that we are referring to gives greater impetus to expanding democracy above and beyond the electoral system. For example, when the Chileans fought against the dictatorship, and they would do this in the street, at home, in the bedroom, etc. And this expands inward and outward. The care component is related to all of these different dimensions, to the environment, rights to land, related to the planet. The care component, which is fundamental for certain population groups that are marginalized, as well as for the LGBTQ plus group, which in some cases because some countries their rights are denied. Or what about sex workers? Again, another key group. Often they have spoken here at ECLAC. So if we are unable to change the sexual conventions in such machista societies, let's at least give those people their rights. I, again, wanted to wrap up with something that is rolling around in my mind. I would like to congratulate Aida Gonzalez. She is the official person responsible for Mexico in Beijing. So she has been an enormous support for our cause. Thank you. Thank you, Gina, for your thoughts. Go ahead. Thank you. I am Regina Pascarrillo. I am representing the network of Afro-Caribbean, Afro-descendant women, the diaspora. We cover more than 200 civil society organizations. Gender equality is a key pillar of the 2030 Agenda, as we have mentioned. However, for women who face intersectoral discrimination, which is the case of the African descendant women in the region, this continues to be a far-off goal. There has not been enough progress. Progress has been threatened by certain policies in the region. Without going further, I would just like to mention that it's crucial to recognize that the barriers preventing our participation have a direct impact on our ability to comply with SDGs. In that regard, if we take an intersectoral approach, which is crucial, by the way, that will allow us to do away with existing asymmetries among the various stakeholders, including civil society, with a view to secure inclusive, progressive inclusion. We are concerned with the setbacks with regard to questions on ethnic self-identification on some population census. Without disaggregated data, data that is sensitive to ethnicity, the 2030 Agenda would, in the end, make invisible the people it aims to protect. We need human rights-based indicators that reflect our reality. We know that there is racism in different sectors such as health, education. Sustainable development, as a result, will only be sustainable for us if all of the women live discrimination and violence-free lives. The commitment to equality should be materialized under practical experiences, comprehensive policies, for example, that directly and indirectly address gender and racial discrimination and that are intersectoral. Public policies that are the result of the public engagement of we, the affected women, and recognizing the historical debt against Afro-descendant, indigenous, rural, and urban women and girls is key. True gender equality is unattainable without this racial adjustment. Our network reaffirms solidarity, as mentioned by my colleague. Solidarity is essential to guarantee rights, to eradicate violence, and to build discrimination-free societies. Thank you. Thank you. And with that, we have wrapped up the delegation intervention component. This has been an extremely rich session, thanks to the interventions by the panelists and the delegations. Allow me to close by saying that there is a commitment to work, and the commitment is stronger than ever before. Not just because we only have 5 years till 2030, but because we will continue marching forward despite everything else. SDG 5 is not just a goal, but it is the foundation for fair, sustainable, inclusive, and diverse societies. Let us continue moving forward decisively with this intersectoral approach that we have referred to so often today. And with that political will, allow that transformative political will that, of course, requires funds and budgets. That's crucial. We've said that so many times. Allow me to mention that jointly with ECLAC, we have produced a regional report that was circulated to all with regard to action for equality, peace, and development in the region. 30-year Beijing anniversary. It includes national reports from all of your countries, and this implies that the Beijing Action Platform continues to be effective and necessary. We have this glass half full right now, so we need to give it that extra push. I would like to, as a result, invite all of you to hold strong to your commitment for the benefit of all. Thank you. Thank you, Maria Noel. According to the agenda, we will be on a break until 2:30 p.m., at which time we will reconvene here. I would just like to let you know that there will be several side events during the lunch break. If you would like to learn what these are, please go to the events website. Thank you.
Tú me dices, ¿eh?
Buenas tardes. A continuación, quiero presentar al señor Fabio Bertranú, director de la Oficina para el Cono Sur de América Latina de la Organización Internacional del Trabajo, OIT, quien tendrá su cargo
I would like now to introduce the moderator of panel 3, which is on SDG 8, decent work and economic growth. Thank you, Chairman. It is a pleasure to share with you, good afternoon, this panel to review SDG 8, decent work and economic growth, which, as you know, is a very relevant SDG for the agenda. It is relevant in terms of the connection and the spirit of the 2030 agenda that connects with the outcomes, the targets of the 2030 agenda, but especially its relevance in a dimension that currently significantly affects the region in terms of the challenges implied by economic growth and decent work. Economic growth that, as reflected in the report prepared by ECLAC, Latin America and the Caribbean, in the challenge of accelerating towards meeting the 2030 agenda, transitions towards sustainability. This reveals the very relevant gaps that we have in terms of growth and decent work, and the importance of recovering a rate of growth that allows us to close gaps through productive policies that once again place at the heart of macroeconomic policy investment, and that this may translate into the possibility of creating formal quality jobs with labor rights. And so now I would like to introduce the panel members with presentations of 10 minutes each, and that will share the experiences, good practices in their countries, sectors, and their views on how to speed up this very important target and goal. First of all, Paul Shedd-Green, Minister of Foreign Affairs, International Trade and Immigration of Antigua and Barbuda. It is a pleasure to welcome you, Minister, to this panel and hear of the vision of such a region and the Caribbean at the table. And then Carlos Rafael Emiliano Gomez, who is Director General for Treaty Follow-up Administration and Supervision of the Mexican Ministry of Economy, also very relevant to the context of international economic affairs that we're living through with the view from Mexico. And also the Minister of Labor, Employment and Social Security of Paraguay, Monica Ricalde, from the heart of the southern cone of Latin America, to hear of the labor policies and social security policy. And lastly, Fanny Sequeira, who is the Secretary General of the Confederation of Rerum Novarum Workers, and will share the view of a very important group of the labor world, the CDRN, their approach to the challenges that workers are seeing to speed up SDG 8. And so I would now like to invite Minister Paul Shedd-Green to please take the floor. Minister, it is a pleasure to hear you. 10 minutes.
Gracias, señor moderador. Today, for maximum effect, I will speak only in English. I want to start by thanking you, moderator, the organizers of this very important exchange, and my fellow panelists who today will join in presenting not just generic discussions, but real-life discussions citing examples and experiences from respective countries. But before I delve into my presentation, which I hope to cover within the prescribed time, I beg leave to posit 10 global imperatives which emphasize the interconnectedness of economic growth with social equity, sustainability, and labor rights, each one reinforcing the foundational principles of SDG 8 in Latin America and the Caribbean. You realize, moderator and colleagues, that as I go through my presentation, that the Antigua-Barbuda experiences and efforts to achieve SDG 8 are all premised on these 10 foundational principles. We'll agree from the get-go that SDG 8 aims to promote inclusive and sustainable economic growth. Its caption, Decent Work and Economic Growth, allows us to have a critical look within the context of small island developing states, which due to our unique economic, environmental, and social realities pose certain challenges and opportunities, both of which demand tailored strategies. A critical consideration for us relates to just how we do, as island nations, exploit and manipulate these existing opportunities and challenges to accelerate the achievement of SDG 8. In the case of my country, Antigua and Barbuda, and I dare say for many other small SIDS, it is well known that tourism is the main industry contributing significantly to employment, foreign exchange earnings, and GDP generation. The time has come, however, for us to transition our traditional tourism sector to one that promotes sustainability, inclusivity, and one that builds resilience. This paradigm shift, as I want to refer to it, will lead to the creation of additional jobs, lowering unemployment, reducing our economic vulnerabilities, while promoting and intensifying the protection of our cultural heritage, fostering the evolution of ecotourism and community-based tourism initiatives. It was only last month, the month of March, that the Antigua-Barbuda Parliament approved, for the first time in our history, a cultural heritage protection bill, which was a comprehensive piece of legislation designed to safeguard the nation's historical sites and artifacts, both on land and underwater, and to incorporate internationally accepted standards for heritage protection. Today, as we examine SDG 8, I encourage consideration be given to the sustainable exploitation and use of our ocean resources to further support and expand marine industries, which will drive growth, create jobs, and preserve marine biodiversity. In Antigua and Barbuda, we have established the Department of the Blue Economy and the National Ocean Governance Committee, both empowered to lead the nation's pursuits related to sustainable development of the blue economy and the maximization of the economic and social benefits to be had. Additionally, it was just yesterday, 24 hours ago, that Antigua and Barbuda deposited our instrument of acceptance of the WTO's Agreement on Fishery Subsidies, demonstrating our unwavering support for the sustainable use of our marine resources and clearly for the SDGs. Similarly for us, promoting green technologies and renewable energy remain at the fore of our national development priorities, aimed at reducing dependence on fossil fuel while creating a new sector and sectors of employment. We have undertaken commitments to net zero carbon emissions by 2050 and have already unveiled a fleet of electric vehicles for use within the public sector. The government of Antigua and Barbuda has designed and currently manages a package of concessions in support of alternative energy generation, including outfitting several public buildings to include schools with solar panels. The government has already also announced plans with regards to Barbuda. That's our sister island, which was ravaged by Hurricane Irma in 2017. Where our ambition on Barbuda is to achieve a 100% renewable energy grid by 2030. One of the primary targets for SDG 8 is the promotion of youth employment, education, and training, with the objective to substantially reduce the proportion of youth not in employment or without adequate training and education. Antigua and Barbuda has made significant investments in this area and in the area of tertiary education with the establishment of the Fort Landed campus of the University of West Indies. We have also made investments in technical and vocational training and education with the establishment of the Harrison Center, Antigua-Barbuda School of Continuing Education, along with the Antigua-Barbuda Institute of Continuing Learning. At the University of West Indies, a suite of initiatives to include training in AI literacy and other AI-focused programs form part of the education, the platform for training our youngsters as we look to the attainment of the achievement of the SDG 8, decent work and economic growth. As a side note, colleagues, it should be noted that notwithstanding significant investments we've made in education, including increasing the prevalence and use of technology in the classroom, which relate to SDG 4, we believe that we are on track to achieve SDG 4 by 2030. To bring you back to the issue at hand, SDG 8. SDG 8 is about ensuring that economic growth benefits everyone. This suggests focusing on inclusivity with special attention to marginalized groups such as women, youth, and persons with disability, and indigenous communities. Therefore, policies and programs that support entrepreneurship, access to finance, and social protection are imperative to foster the creation of more equitable growth. My government has established an entrepreneurial development fund aimed at assisting young Antiguans and Barbudans with the startup capital required for various business initiatives. Additionally, in operation are a plethora of social protection programs targeting the most vulnerable and marginalized in our society. These programs are managed by the Social Protection Act of 2020, crafted to address poverty and deprivation, establishing a social protection board, a social protection commission, and an appeals tribunal, all part of the infrastructure required to achieve SDG 8. We are also instrumental in the UN's Vision for Everyone resolution, aiming to ensure access to eye care services for all by the year 2030. Some of the major challenges undermining achievement of SDG 8 concerns our high vulnerability to external shocks, such as fluctuating commodity prices, global financial crises, and climate change impacts. This volatility has undermined efforts to achieve sustainable economic growth and decent jobs. Devastating impacts of COVID-19 presents a prime example. And as we sit here today, we are all living through the dreaded experience of a perverted interpretation of liberation. I will say no further than that because I believe that the audience is fully aware of exactly the implications of this new interpretation of liberation on the attainment and achievement of SDG 8. Our high dependency on imports due to our limited natural resources and domestic production capacity translate into the heavy reliance on imports, including food, fuel, and manufactured goods, is yet another of our challenges. Trade imbalance has serious implications for economic stability, making it difficult to promote sustainable economic growth and job creation. Notwithstanding the above, there are some possible strategy considerations to be explored. including encouraging diversification of economies, exploiting areas of competitive advantage, to reduce dependence on a single sector, such as tourism. This could involve supporting agriculture, renewable energy, and technology startups. The policy measures should also include incentives for businesses that promote innovation, sustainability, and job creation, and a conscious decision where the creating of new partnerships is concerned. Strengthening resilience to climate change is also extremely important and should be incorporated in our development strategies. This can be done by investing in sustainable infrastructure, protecting ecosystems, and ensuring that disaster risk management and adaptation strategies are integrated into development plans. As I conclude this presentation, reflecting on steps taken by Antigua Barbuda, achieving SDG 8, particularly within the context of small island developing states, requires a multifaceted approach that considers the unique challenges of our nation. By focusing on sustainable economic growth, diversifying industries, investing in human capital, and addressing climate change impacts, we can enhance our resilience and create pathways for inclusive growth and decent work for all. However, overcoming challenges such as limited resources, external shocks, and high vulnerability to climate risks will require strong political will, enhanced South-South partnerships, international collaboration, and long-term strategic planning. Ladies and gentlemen, if it pleases you, I'd have walked you through but a snippet of the actions taken by Antigua Barbuda and recommendations general for the achievement of SDG 8 in the Caribbean and the wider Latin American community. Thank you.
Muchas gracias, Ministro Paul Chet Green.
Thank you very much, Minister Paul Chet Green. Thank you for sharing your priorities and challenges for Antigua and Barbuda that reflect the reflections and needs of a sub-region like the Caribbean. Very important. Now I give the floor to Carlos Gomez Rodriguez. It's a pleasure to have you here in the panel. Thank you. Good morning, all those who are with us this afternoon. On behalf of our Secretary of Economy, Marcelo Grad Casawon, and the other Secretary of Foreign Trade, Mr. Rodrigo Gutierrez Romano, I want to thank the participation in this panel and convey greetings to my distinguished colleagues, to Mr. José Manuel Salazar Siriñac, Executive Secretary of ECLAC, to Mr. Fabio Bertanov, Director of the Office for the Southern Cone of ILO, Mr. Paul Chet Green, Minister of Foreign Affairs, International Trade of Antigua and Barbuda, Mrs. Mónica Recalde, Minister of Labor, Employment and Social Security of Paraguay, and Mr. Fanny Sequeira, Secretary General of the Confederation of Workers, RORO. The Mexican economic policy not only has focused in poverty reduction, but also in sharing prosperity. In Mexico, those who are in a poverty situation, they can abandon this threshold to a minimum income. We seek to guarantee access to those rights like education, health, labor, culture, housing, and social security that are essential to lead a life with well-being throughout the whole life trajectory. To give you an example, I will give 3 actions that are driven by the government of Mexico so as to reach the fact that everybody should live with well-being. First, the promotion of social well-being plans. Then the building of a national development plan, putting in the center persons in the center. And then finally, the Mexico plan is an industrial strategy seeking that economic growth will reach out to all persons of the country. Since 2018, we've adopted the task of driving comprehensive programs focusing in youth, artisans, and farmers. The program Building the Future starts with labor training. Today, 3 million youth have been trained, and 60% of them are women. And on the other hand, through the program Sembrando Olivas, productive harvest projects have been promoted for consuming of surplus, generating 2,500 permanent jobs and 8,000 transient jobs. With the original program, we work with the crafts persons for their entrepreneurial training. The economy of the sector grew in 12.4%, and women have been most benefited. The promotion of these well-being programs led to a reduction of poverty of 9.5 million persons regarding 2018, as well as a reduction of 2.4% in the unemployment rate. Also, 40% of our formal jobs are used by 9 million women. For the government of Mexico, it is key to build a nation project in accordance with the real needs of the population. For that, in addition to raising those social programs to constitutional level, our national development plan today was built based on citizen participation and thus their voices about concerns, needs, and proposals. Therefore, the Development National Plan of 2025-2030 has 4 axes: governance with justice and citizen participation, development with well-being and humanism, moral and labor economy, and sustainable development. Also, it integrates 3 cross-sectional axes: substantive equality and rights of women, public innovation for national technological development, and the defense of the rights of indigenous and Afro-Mexican communities. In the economic axis, we will continue placing the workers in the center of decision-making. We are raising an economic equitable development strategy, promoting shared prosperity, where we recognize that the creation and access to decent work is the main path to offer to persons possibility of accessing better quality of life.
Thus, this plan also aims at ensuring quality jobs and decent wages. So, encouraging social economy is a must. I'm talking about cooperatives, associations, and with indigenous groups is an alternative based on solidarity and the environment. Another strategic goal is to strengthen our fields and ensuring food security. The support of agriculture and the protection of the farmers and those who work on the fields is precisely this. Under the leadership of the Ministry of Economy, we launched a plan that aims at encouraging the internal domestic industry for the strengthening of our national labor market. Through the modernization of the trade infrastructure, strengthening strategic sectors such as innovation, technology, automobile, pharmaceutical sectors, agrospatial as well, and through polls based on the regions that have special conditions, through the expansion of mid and higher education and the training of labor. Together with the national goals, we will change the productive structure of our country so that the growth may be equal, sustainable, and with sovereignty. The relevant industries change according to the provinces or the different sites. But in view of this, we have created ecosystems at local economies so they may flourish. And this towards SMEs mainly. The small and medium companies will be more important in the manufacturing world, especially for essential products. This is very important because we must realize that in Mexico, SMEs are responsible for 98% of the economic units in Mexico. Another important pillar of the Mexico plan has to do with the water plan to ensure sustainability of our resources, encouraging good management of water in all uses, avoiding the pollution of our rivers, seas, and basins. We are thus building sanitation. We have also a large investment portfolio, both national and international, to implement a new system of investment that will be aligned with sustainable development. And in Mexico, we're clear that we must create more jobs with better salaries, with fair conditions, and we must encourage training and the use of technology on the job. Thus, our goal is to become the 10th world economy with 1.5 million additional jobs in specialized manufacturing, growing in 15% in national content and global value chains, the formation of 150,000 strategic skills, making sure that 30% of our SMEs will have access to funds and attracting investment to the environment, social and governance tendency. In a world economy that is more and more interdependent, shared prosperity is a joint exercise. The strengthening of national economy is not just an economic strategy, it also involves a social policy. Having sound trade strategies will have an impact on the economy in the communities from an economic standpoint, and also in using technology and reducing poverty. It will also affect education and health. During this last stage, the period of the implementation of the 2030 Agenda, we believe that economic growth doesn't really have any sense as a goal in itself. Its true meaning is a path towards a higher goal, which is the general well-being of our population. Thank you on behalf of Mexico. Thank you, Carlos. Rafael Emiliano Gomez, General Director of Follow-up, Management and Supervision of the treaties from the Ministry of Economy from Mexico. Thank you for making a summary of what Mexico has been committed to on behalf of SDGs. I now call on the Minister of Labor from Paraguay, Mónica Recalde. Thank you. Good afternoon. I bring greetings to all of the colleagues, a part of this panel, as well as the General Secretary, delegates, ministers, and representatives from international agencies. Before anything else, I'd like to thank ECLAC's invitation to be here, and I congratulate this forum that has been held in such important times, 5 years after, up to the 2030 landmark. This is an excellent occasion to assess the regional progresses, to share lessons learned, and to reaffirm our commitment towards inclusive, sustainable development, where decent jobs will be the main pillar of social development in Latin America and the Caribbean, going towards SDG number 8, and its implementation faces tremendous challenges. The increase in the occupied persons in the region in the last few years is mainly due to the expansion of informality. This is due to a productive system that creates low productivity jobs, thus replicating informal labor. In order to change this trend, we must have sustained development, increasing productive industries, and having policies that will make formal jobs through training and the development of skills for the future. The government policies in my country are well aligned with the implementation of SDG 8. Economic growth, employment, and competitiveness are all part of the pillar Paraguay grows, and ensuring a decent job and formal labor are all key for our plan Paraguay 2050. And this is in part of our national development plan. Paraguay has, in the last few years, been known for sustained growth. In the last decade, that has been at an average of 3%. The macroeconomic, fiscal, and monetary discipline has been fundamental in order to recently reach investment grade for my country. That involves a tremendous opportunity and a big challenge to continue on the road towards growth, diversifying our economy and bring in more investment. The Paraguayan government has conducted tremendous investments in flagship programs for our vulnerable population. They have to do with education, with a new program that has been a bet under the administration of our President Santiago Peña, called Zero Hunger at Schools. And this is targeting child nutrition and retention, quality jobs, focusing women, and the support to small producers. The idea is to cover with nutrition more than 1 million children, creating more than 30,000 decent jobs as well. With a program to support workers for access to housing called Serogapura, we will for the first time allow for low-income workers to truly have access to a decent house. And there's also a universal pension for the elderly with a coverage of 100% for our older persons. This has been a policy that has taken time but is already here. This has a very important component with the creation of quality jobs and also with access to social security that impact directly the well-being of our population. That means that poverty and extreme poverty has been reduced in 24. The idea is that we meet SDG 8, and in that endeavor we are facing many changes. First of all, we have new laws that promote social security as an essential right. And we are also simplifying the registration of workers and enterprises, small enterprises. That means that we have new workers in the formal world, involving 1 million new workers. We're also promoting child or juvenile jobs, offering access to Social Security to include more and more trained youngsters into the labor market. We have also strengthened labor oversight with transparency, efficiency, and modernization, ensuring that we will meet the labor rights of thousands of workers. We have renewed the public service for employment with new technologies through the digital portal Impera PI, facilitating connection between the labor supply and demand, especially for young people. We have improved the employability of a person through training and professional skills, with more than 150,000 persons that are part of yearly courses. And mainstreaming throughout all of our public policies, we have strengthened social dialogues and the resolution of conflicts through a tripartite table and different agencies with a wide participation of unions and professional associations, where we are building long-lasting consensus with labor peace and fostering fair jobs and healthier jobs as well. In spite of the progress reached in having more formality with training and with all of these plans, we still have structural challenges that condition full implementation of SDG 8. The labor informality is still the main obstacle, affecting 64% of the non-agricultural workers, and this is even worse for women, youngsters, and older persons. These are groups that have many barriers ahead towards formal, decent social protection jobs. This is related to a protective matrix where the jobs are mainly concentrated with low-wage jobs. Another key challenge is the need to anticipate ourselves to the changes in the labor markets, adapting the national training system to the dynamics of our productive markets, especially those that have to do with the digital transformation, green economy, and the development of the national care system. We must also align the demands that the market have with those who are being trained, because this sometimes limit the opportunities of young people to get good jobs. We also recognize the need to continue reducing the structural gaps related to gender in access to jobs and in terms of labor conditions. The burden of non-paid work that women do, especially without any accessible care, limit their participation to decent jobs. Finally, let me say that this forum is not just a means to check what's happening. It's also for collective inspiration. The necessary changes that are needed for decent jobs, labor inclusion, and the sustained growth cannot be reached single-handed. Paraguay reaffirms our commitment with regional cooperation, multilateralism, and shared learning as basic instruments to speed up the implementation of the 2030 Agenda. There's no development without decent jobs, nor any of this without social dialogue and equality for all. Thank you for your attention. Thank you, Ms. Monica, Labor Minister from Paraguay, for summarizing the priorities and the challenges that you are facing in your department, and also for your strong commitment towards multilateralism. We will now have our last presentation. I call on Fanny Sequeira, General Secretary of the Confederation of Workers, Rerum Novarum. Fanny, you have the floor. Thank you for being here with us.
Bueno, muchas gracias.
Good afternoon. Thank you. Continental and world syndicalism, as well as many instances of social, civil society, and popular movements, recognize the partial progress in some SDGs. Unfortunately, not as many. We do see that there's lack of headway in most SDGs. There is a diagnosis that is shared on the difficulties that our countries encounter to meet by 2030 SDGs. I will quote UN's words on Pact for the Future. And it says, in most SDGs, progress is very slow, or sometimes they have backstabbed vis-a-vis 2015. Progress in sustainable development has taken years, but at a standstill. We see more poverty. Human rights are threatened, and we run the risk of leaving behind millions of persons. Likewise, ECLAC has said that only 23% of the SDG goals are on their way to be met in the region by 2030. This is conditioned by the three development traps, as explained by ECLAC, on the inability of our countries to conduct these structural changes. As to SDG 8, 8.3 and 8.4 objectives will not be met by 2030. But aside from that, there are negative trends that we are seeing, and of 8 to up to 8.10, progress is very slow and will not be done by that date. According to ILO and World's Unionism, and CSI and the CSI in the region, the leaving behind the social contract will make it difficult to meet that agenda. And this is seen in the exclusions and deprivations that some groups are subject to, and the risks and damages to our democracy, because its institutionality is seen in some countries only through political authoritarian ideals. This brings in more conflict between our society, lack of social dialogue, and lack of a basic consensus. In many countries, we have seen that the separation of power is being weakened, and how justice is offered, and how human rights are being weakened, including human rights. We add to this a new international crisis that has been led by the trade and geopolitical system that are bringing more instability in the globe and go against the 2030 agenda and global peace. As to SDG number 8, there are national voluntary reports that bring in a positive graduality in the implementation, but there are strong problems in the treatment and in some of the components. The decent jobs should be the main source of sustainable human development. The trends seen show a delay in many things, and many processes are at a standstill. That means that we have a list of obstacles and the urgent measures that are needed to meet these expectations as a society. For millions of persons, a decent job is still a utopia, whereas precarious jobs and livelihoods are still at substructural levels.
To a great extent, this is because public policy has not, in depth and sustainably, addressed the causes of unemployment, insecurity, lack of protection, inequality, and gender inequity, including wage gaps and labor and productive exclusion, also due to what ECLAC calls the trap of the inability of our economies to grow, and we would add to grow and distribute, to which we add another two concomitants related to inequality and effective governance. It is without a doubt that there are people, many people, who are being left behind, same as others that have already been left behind. Although this is not reflected in national voluntary reports frequently drafted in the continent, excluding active participation by the union movement and ignoring its contributions, especially regarding SDG 8, to progress and overcome the stagnation of SDG 8 is necessary to ensure the strength of the rule of law and democratic institutions, and adopting labor policies favoring sustainable human development, decent work, ensuring social and economic protection, decent wages, with full respect of labor rights, union freedom, including especially the right to strike and collective bargaining, which in many cases are breached. with the guarantees of health and security at labor, and their major shortcomings with concrete actions to prevent and eradicate child labor in all manners, with a fair transition and the preeminence of effective social dialogue and full and real participation by unions. These policies must focus with special care on the eradication of gender gaps at work and considering other actions ensuring decent work for women, establishing a national integral care system with appropriate financing in line with the 5 Rs of the ILO, establishing vital minimum wages and equal pay, and against the gender violence and discrimination, adopting quotas to retain and hire women in sectors where they are underrepresented, same as reappreciating occupations in feminized sectors. No aim may be achieved without the full egalitarian and significant participation of women in political, labor, and economic life, as well as youth. Likewise, policies must cover and protect all vulnerable sectors, same as those of platform economies, digital, informal, migrant, among others. For this purpose, the declaration of the civil society mechanism is very eloquent in its conclusions and recommendations. We also identify with the recommendations made by ECLAC to overcome development traps. Although all societies involved in these projections, governments have historically committed to this, and this is unavoidable. It is essential for governments to ratify and ensure compliance of ILO standards to ensure the rights of all working people. And lastly, to make the necessary transformations for human and lasting and sustainable change, it is necessary to change politics and the socio-economic development model, which must be achieved through a new social pact with people at the heart, and that is direct towards the achievement of SDGs and social justice, ensuring coherence between ethics and policy. This is the most transcendental commitment of the international community in order to aspire to a hopeful future and where no one may again be left behind. And I cannot but end my participation without expressing the deep concern of unions and civil society before what occurred in my country, Costa Rica. Today, while this forum was being held, a presidential decree was published removing financing and the declaration of public interest of the 2030 Agenda. They eliminate the commitment to SDG 17, which is a hard blow for people, the 2030 Agenda, and its SDGs. And we're hoping that this should not become a trend for other governments of the region. Thank you. Thank you very much, Fanny Sequeira, Secretary General of the Confederation of Rerum Novarum Workers. Thank you for sharing the vision of workers and union organizations in the region. Before moving on to the interventions by delegations and possible comments and remarks, in the description of the responsibilities of the moderators to provide a brief summary of the interventions. And so I, together with José Manuel Salazar, the Executive Secretary of ECLAC, to highlight the relevance of these presentations in the sense that all have combined the double dilemma of bringing together the relevance of economic growth, improvements in productivity, productive diversification, productive policies, and the challenges of promoting decent work, and that, in other words, also means the various dimensions that affect the well-being of people. And that the major challenge in our region is to overcome the growth trap that is accompanied by a persistent index of labor informality in the world of labor. However, the four presentations also expressed different policies and practices that drive forward an attempt to overcome these dilemmas affecting the region and the various sub-regions, and particularly in the Caribbean. Minister Paul Chet Green told us the relevance for the island states in the Caribbean that face a serious vulnerability to macroeconomic shocks. Also, the dilemmas posed by the climate crisis and the structural challenges of their economies and economic activities that may link sustainable tourism development and the generation of jobs with an impact on growth, as also the emphasis that these governments are giving policies that driven or drive the use of renewable energy and various public policy, sectoral policies in order to facilitate with these policies the promotion of youth employment as well as the technological modernization in sectors, and have a strategy to address the vulnerability of these economies. And in this sense, if I interpret this correctly, this is the reality of many countries in the Caribbean. Carlos Rafael Gomez from Mexico spoke to us of the relevance of the concept of shared prosperity and also the relevance of having an integral approach to growth policies and policies to promote labor and well-being, with several actions being carried out by the government of Mexico in the promotion of labor inclusion of young people with a future, and the various strategies to reduce poverty, and essentially the citizen participation approach in the construction of a development plan. So listening to the citizens, listening to stakeholders is essential. And then in Mexico, trying to look for strategies to overcome, or rather to introduce through an industrial policy, economic diversification, in actively including innovation policies, technology, and sectoral policies, with an approach on including SMEs and their supply chains in different industries, and also the relevance of investment in order to dynamize and achieve the social well-being. Monica Recalde spoke of the important challenge of the informal economy, informal employment, but also initiatives such as the Peseta program that addresses not only the focus on most vulnerable groups, but also including other policies that can, in combination, may trigger greater employment, and through labor institutions that aim to not only reinforce regulatory policies to facilitate the registration of companies and social security, but also other institutions in order to improve the quality of work and the productive potential of the workforce. And so done through innovations in employment policies, professional training, and also labor inspection, and they are addressing the challenge jointly. And lastly, Fanny Sequeira, who expressed the need to renew our commitment with the social contract, and where social dialogue must play a very important role, seeking consensus in order to promote that shared prosperity. And also, same as Minister Recalde highlighted, the relevance of the gender dimension, the relevance of having a care system that may address the challenges of women's inclusion in the labor force, but will be also essential to realize the demographic transition affecting the region. And lastly, I would like to highlight what Fanny Sequeira said regarding the principles of fundamental rights and labor, union freedom, eradication of child labor, but also the approaching issues with a fair transition approach in order to more comprehensively address these issues, in particular sectors that in relation to the climate crisis and the need to have a policy that promotes production and consumption in a more sustainable way. And this requires a productive transformation and organization of work, also requiring dialogue among the Association of Employers, Workers, and Governments. And lastly, I would like to excuse Pilar Estades, who was going to be with us as the chairman of the board of SMU, but who apologized for not being present. But of course, we do have business representation in all dialogue, seeking consensus, not only tripartite, but we must renew that commitment in order to continue promoting and speeding up the achievement of the SDGs. Well, I hope to have complied with the need for a summary by the Secretariat. And so now I would like to invite the delegations to take the floor and express their or make their comments, remarks, and suggestions. So first of all, Brazil, who had requested the floor from before, and then the Office of the High Commissioner of Human Rights. Yes. Good afternoon. Brazil reiterates a commitment with the promotion of decent work and economic growth, recognizing the key relevance of SDG 8 for the construction of a development model that is inclusive, sustainable, and centered on human dignity. Strengthening the labor setting, especially for young people and women and vulnerable population, is a cross-cutting priority for the country's social and economic policy. And for this, various initiatives have been put in motion with the Esperanza Garcia program that seeks to mitigate racial inequalities, and the AGU program without harassment and discrimination that combats moral and sexual harassment as well as other forms of discrimination in the overall advocacy of the Union. These actions seek to ensure working conditions that are more fair and for everyone, reflecting commitment to equal opportunities. Brazil also recognizes the need for economic growth that is aligned with contemporary challenges such as transition to a sustainable economy and the digital revolution. Bioeconomy-centered projects, renewable energy, and the reindustrialization that is sustainable have shown to be promising, offering new opportunities and contributing to a sustainable and inclusive future. The country continues to invest in policies to formalize employment, professional training, and encouraging innovation, and strengthens the value of regional cooperation as a means to strengthen chains of production and extend decent opportunities for decent work with economic integration and social justice. Lastly, Brazil is committed to do an effective follow-up of indicators related to SDG 8, focusing on the compilation of gender broken down data, also for race and territory, in order to ensure that the policies applied really reach all sectors of the population. We will continue to collaborate with other countries of the region, sharing experiences and looking for innovative strategies to build a fairer and prosperous future for all. Thank you. Thank you. We thank Brazil for their intervention, and now we invite the colleague from the Office of the High Commissioner for Human Rights to speak.
We would like to focus our remarks on the use of gross domestic product, GDP, as the main indicator used to measure economic progress. And this was a point that was raised this morning, including by the delegation of Mexico. And why the commitment to develop a framework on measures of progress and sustainable development to complement and go beyond GDP in the Pact for the Future, this is Action 53, is a historic opportunity to accelerate progress on human rights and the 2030 Agenda for Sustainable Development. We all know that despite decades of GDP growth, we have failed to reduce inequalities, redress historic injustices, tackle urgent environmental challenges, and dismantle inequitable concentration of wealth and power. With its focus on what generates most economic profit in the short term, GDP often undervalues activities that make positive contributions to society. It overlooks the economic growth, often relies on exploitative use of natural and human resources, and sustainable consumption and economic policies that can negatively impact the most marginalized. And what is more, GDP doesn't measure people's enjoyment of human rights, quality of life, and well-being. So using only GDP fails to take into account the multidimensional nature of vulnerabilities, the specificity of country context, and their actual needs. As a result, many middle-income countries and small island developing states are excluded from accessing concessional loans, despite having high levels of extreme poverty or repeated exposure to climate shocks and other vulnerabilities like being landlocked. Debt relief mechanisms also offer less favorable debt restructuring conditions for middle-income countries under debt distress. So what we're saying is that to live up to the ambition of the 2030 Agenda and the Pact for the Future, international human rights standards provide the benchmark for what we need to measure, and they provide a universally agreed legal framework to address the blind spots of GDP. And this is central to a vision of a human rights economy, a vision promoted by the Office of the High Commissioner for Human Rights, which measures success not only by the size of annual growth of GDP, but how well the economy delivers on people's rights and safeguards the planet. And at the UN Human Rights Council, numerous states from this region have expressed support to the vision of a human rights economy, and we're grateful for this support. As envisaged by SDG Target 1719, building on existing initiatives, new measures will need to reflect the multidimensionality of sustainable development, while also be concise, widely accepted, and comparable. In February this year, the Human Rights Council discussed metrics going beyond GDP and complementing GDP. And this points to growing attention by states and commitment to develop and apply indicators of progress that go beyond GDP and fully integrate human rights, gender equality, environmental protection, and intergenerational justice. So to conclude, an alternative measurement framework rooted in human rights would include metrics that, number one, include key human rights indicators to assess the extent to which economic and development outcomes and processes contribute to universally agreed human rights norms and standards. For instance, indicators that measure the respect for a right to a clean, sustainable, and healthy environment, or indicator on the mobilization and use of maximum available resources for economic, social, and cultural rights, which is a requirement in the covenant. Number two, contribute to the human rights principle of equality and non-discrimination by systematically taking into account the impact of economic and development policies on inequalities and non-discrimination, including gender-based discrimination. Number three, better capture the economic and non-economic value of unpaid care and support work. And number four, explore the use of new data sources and methods, including citizen-generated data and AI-enabled tools, while applying a human rights-based approach to data. My last point is to underscore the importance that the process towards developing new metrics that now we have with Action 53 in the Path for the Future, be inclusive and engage a range of stakeholders, including civil society. Thank you.
Bien, agradecemos a la colega de ACNUD.
I had said UN Women, but I had a FAO colleague. Then, yes, then afterwards, UN Women. Thank you for this space. From FAO, we want to reinforce the idea that to transform agri-food system is essential to advancing SDGO in generating decent employment and economic inclusive and sustainable growth in Latin America and the Caribbean. The agri-food systems are an important source of livelihood for youth and rural populations, offering opportunities to address structural vulnerabilities through specific investments and inclusive policies. The participation of youth in agri-food systems is key for the future economic growth. To support the young can promote the transformation of a sector. The barriers for decent employment for rural youth and women must be overcome with inclusive labor policies, social protection systems, and programs that are gender-based. A strengthening of youth work and resilience and employment in fragile contexts can promote economic stability. Child labor, especially in agriculture, continues to be an urgent concern. To reach the 8.7 goal of SDG 8 demands transforming agri-food systems, strengthen policy formulation, and promote safe policies, avoiding child labor, offering alternatives of decent work. The migrant workers also are key in the agri-food systems, but frequently they are the ones that suffer the most or face exploitation. It is essential to guarantee safe migration routes and regular ones and just labor conditions, access to justice, and labor formality. Financial inclusion is another key factor for economic empowerment. Financial services adapted to rural life and support frameworks can facilitate entrepreneurship and rural development. In spite of progress, still there are many gaps between rural and urban, gender and ethnic gaps that are marked in the region. So to institutionalize social participation and policy formulation, promote cooperatives for in the International Year of Cooperatives. And all of these are key steps to create inclusive and resilient, productive and sustainable economies, ensuring that no one is left behind in the search of decent jobs for all and prosperity for all. At the same time, opportunities for all. Thank you, colleague from FAO. UN Women, Maria Noel. Thank you. From UN Women, we consider the situation of SDG 8 globally continues to be a matter of concern, given that the factors hampering the labor situation of women persist. Limitation of hours of work, low salaries, inequality, and distribution of unpaid care work. The very little access to services after maternity, child care, and UN Women acts in order to achieve economic rights and growth for all through the promotion of decent work, equality in remuneration, in payment, and the access to the just distribution of unpaid work. In the present world, women face inequalities, limiting her economic autonomy and access to quality employment. In our region, the rate of female participation was maintained in 52%, below that of men, which is 75%. In spite of the fact that the gap of unemployment between men and women has been reduced, reality is not so, because the employment rate, including all that want to work and find no opportunities, is greater in women. 13% in women, 8% in men. The informality is another obstacle, especially in our region. More than half of women work in informal jobs without access to social security nor labor stability. And this places them in a situation of economic permanent vulnerability, limiting their possibility of professional and personal development. And the salary gap continues to exist, 17%, most unfair. Another challenge is inequality in the use of time. We women allocate 3 times more time than men to unpaid work. Now, in AI and automation that are rapidly transforming formal jobs, women run even higher risk of being displaced. And digitization and automation are redefining that labor market. And we need to guarantee equitable access to technologies and to science, engineering, and mathematics in women. Currently, there is a low representation of them. Currently, we have a unique opportunity to build a present where technology will help to change social standards, not perpetuate stereotypes that unfortunately exist. You can count on the support and commitment of UN Women to promote the inclusive, sustainable, and decent work for women. Thank you. Thank you, UN Women. And the colleague from ILO has requested the floor. Nelson Martinez. Yes, thank you. Good afternoon. Only 2 minutes to highlight some of the things that have been presented by panel colleagues. There is important relevance in the link between these 2 dimensions: development, economic growth, and decent work. It has been recognized how important it is to promote sustainable growth, but at the same time that it be together with the policy framework that will transform economic growth into development. Although our region has substantively progressed in recent years in reducing gaps and deficits of decent work, still the path is a long one to be treaded. And it's important for the region to find solutions to these challenges in the dialogue, social dialogue, tripartite, and also among productive sectors. Informality is something real. Labor informality was considered as a comorbidity in the framework of the pandemic. This determines certain or different effects, not only labor, economic ones, but also social. 1 out of 2 workers in our region is in an informality condition. And of course, this is translated into exclusion from social protection, rights protection, and also in the contribution to economic, social development of our countries. To move towards this goal, SDG 8.3 mainly referring to progress in matters of informality is an important challenge that calls immediate actions in order to guarantee decent work in our countries. I would like to thank for the opportunity. Thank you, colleague from ILO. There are no further requests for the floor, so I will give back the floor to the ambassador. Thank you, Fabio. Yes, we have finished the segment on decent work and economic growth. We'll close until 4:30, and we resume the session at 4:30 p.m.
Buenas tardes.
Good afternoon.
Vamos a empezar
We
con
will
el segmento
begin with panel 4 on underwater life. I invite Mr. Juan Bello, Director and Regional Representative of the UN Environment Program, to moderate the roundtable. Well, Mr. Juan Bello, the floor is yours. Thank you, Ambassador, and good afternoon, everyone. On behalf of UNE, for me, it is a great honor to be with you at this session. I'd like to welcome you to this dialogue on SDG 14, underwater life, a topic of great relevance for the sustainability of our region and, of course, the entire planet. As the political declaration of 22 of the UN Conference on Oceans says, oceans regulate climate, sustain biodiversity, produce oxygen, provide food, and a means of life for billions of people, and play, of course, a fundamental role in trade and development, sustainable. And that is why it is not exaggerated to say that a good part of the planet process that are essential to life and human well-being depend on oceans. ECLAC, with the support of French cooperation, is drafting the outlook of oceans, seas, and marine resources in the development in Latin America and Caribbean in preparation of the third conference of the UN on oceans and UNOC 3. This very important paper puts forward the challenges and progress made in the region for sustainable use of marine resources with the sustainable and inclusive development approach. We should point out that our oceans, unfortunately, are under the pressure of several threats. First, our seas and oceans continue to be affected by the excessive use of fertilizers and the dumping of wastewater, untreated wastewater. For example, from 1999 and 2019, the use of fertilizers in the region increased from 17 kilograms per hectare to 39 per hectare, whereas the use of pesticides for farming use was doubled, going from 388,000 to 870,000 tons during this period, which has a tremendous impact on water ecosystems, continental and marine. Second, we see with great concern the rise in pollution due to plastics in the region. At present, it is estimated there are 1.6 million tons of garbage accumulated on beaches and 771,000 tons of garbage accumulated in the oceans of Latin America and the Caribbean. Only in the Caribbean, and as the data compiled by ECLAC show, every year there are about 320,000 tons of plastic garbage uncollected. And this situation, in addition to the impact of ocean currents that are intensified in the Caribbean, mean that the subregion, for example, shows plastic pollution 3.5 times greater than the world average. Third, data show a decline in marine biodiversity in the region, including a rise in the area of ecosystems, coastal marine ecosystems, and degraded marine ecosystems, all degraded. More than 75% of the fish populations in the region are overexploited, and it is important to point out the activity in the region of foreign fleets that are very highly subsidized and so therefore artificially reduce the cost of fishing operations, contributing in this way to overexploitation. All of these processes, we must add the impact of climate change and the acidification of the ocean. For example, in the major Caribbean that houses the second coral reef, the largest in the world, this acidification has produced a 37% erosion, weakening corals and affecting marine life with a negative impact direct on fishing and the food security of the local populations. While this occurs, we see how the rise in ocean temperature is intensifying the frequency of hurricanes and tropical storms with devastating effects on coastal populations, and the economic impact is described in the report recently launched by the UN Office for the Reduction of the Risk of Disasters. And in view of this, we would like to take this opportunity also to make visible certain progress made by the region, which are very important. The SDG 14 report, or the report on SDG 14 presented by ECLAC, includes an interesting compilation of initiatives and good practices that offer a sound basis to consolidate, expand, and accelerate action in favor of oceans. In this sense, one of the most outstanding progress is that protected marine areas in Latin America and the Caribbean cover close to 23% of marine territory in the region, with outstanding examples in Chile and Colombia. As to commitments for sustainable fishing, we believe that the adoption of the agreement on fishing subsidies of the World Trade Organization is important to reduce unsustainable fishing practices. We should also point out that several countries have implemented measures to reduce plastics of a single use and improve waste management with an impact on nations. With regard to international environmental governance, we are pleased to see progress made by the region in the agreement made in areas outside national jurisdictions, especially ratifications by Belize, Chile, Cuba, and Panama. And we're hoping that more countries of the region will continue to move ahead in that direction. And also, we highlight the progress made by negotiations for a legally binding agreement for plastic pollution, including the marine environment, and which is expected to be adopted in August this year. Our region will have a preparatory meeting in Panama at the start of June. We also like to take this opportunity to highlight the ministerial meeting on water convened by Peru for May 27th, 28th in Lima as an initiative driven in their role as chair of the Forum of Ministers of the Environment of Latin America and, of course, the third conference of the UN on Oceans that represent opportunities that are very valuable to continue furthering the ocean agenda at regional and global level. Now then, with all of this, I am now very pleased, I truly am honored to introduce the excellent panel that we have for today and that brings together leaders of government, experts, and representatives of the fishery and community level to discuss the measures that we could adopt jointly to consolidate the progress and speed up action in favor of SDG 14. Today's discussions will help us to identify opportunities for the region and strengthen collaboration to ensure healthy oceans and are also sustainable for present and future generations. Without further preamble, I am now pleased to invite His Excellency, the Minister of Foreign Affairs and Culture of Costa Rica, Mr. Noco, who is connected online and with whom we would like to begin this dialogue today. Minister, you have the floor. Your Excellencies, distinguished colleagues, I'd like to thank Executive Secretary Mr. Salazar Sarinax and ECLAC for this important space for regional coordination and the always firm commitment to sustainable development in Latin America and the Caribbean. Reflected also in the formulation of the report, Outlook of the Oceans for Sustainable Development of Latin America and the Caribbean 2025, that will be launched within the framework of the third conference of the United Nations on Oceans. And likewise, I am pleased to be part of this panel together with the distinguished panelists to do a collective inventory of the progress and consolidate strategies to speed up compliance of SDG 14. Excellencies, this is a time when multilateralism is decisive to safeguard oceans. Important progress in intergovernment processes for collective governance of the ocean show that international community is clear regarding the collective aim to protect oceans as an absolutely necessary aspect for resilience, peace, and sustainable development of the planet. It is in the hope and firm conviction that we can imagine a new relationship with oceans based on science, international cooperation, and justice, intergenerational, of course. The implementation of SDG 14 represents an enabling condition to achieve many other sustainable development goals. However, we continue to face a deep disconnect between the level of threat to the oceans and the level of investment, action, and cooperation that we mobilize to protect it. This disconnect is the root of why this aim continues to be the least financed of all. What we need is to transform that gap into an opportunity, and for this, it is necessary to have three fundamental pillars: ambition, mobilization, and action. Ambition in our commitments, mobilization of all available resources, public, private, scientific, technological, and coordinated action that is measurable and tied to outcome. Latin America and the Caribbean is an ocean region par excellence. In 23 of our countries, marine territory exceeds the land. More than 27% of our people live in coastal areas. Biodiversity or marine biodiversity, coastal cultures, and blue economies are an essential part of our identity and our potential development. However, and despite our vulnerabilities, we are an active part of the solution. In the recent year, Colombia has welcomed the Convention on Biological Biodiversity. Brazil will host COP30 on climate change, and Chile offered to host the Secretariat of the BMJ Treaty, and as a co-organizer of UNOC 4, we're celebrating the recent involvement of the countries of the region in this call for a precautionary call on underwater science and a firm ratification of Treaty BBMJ that Costa Rica is soon to include in its legal framework after the internal procedure. For our part, in Costa Rica, we've extended our protected marine areas from 1.4 to 16.5 million hectares, exceeding the 30% of our exclusive economic zone. We have strengthened our systems for monitoring, developing indicators involving more than half of local governments in these efforts by means of the network of cantons promoting SDGs. We know that there are still significant gaps in terms of data and capacities. To face these, we are working in public-private partnerships, investment in technology for monitoring, applied science and technical training. And also, we have made of the blue diplomacy a pillar of our international action, and we carry out high-level events on ocean action. Immersed in change from June 7 and 8 last year, and launched the Declaration of Peace for the Ocean, which is a global call to create awareness on the role of oceans in the planet and to further concrete actions necessary to improve human interaction with the sea. This declaration was subscribed by 27 countries and 10 NGOs. In addition, together with France, we are co-organizing the third conference of the UN on oceans, UNOC 3, which will be held in Nice now in June this year. This conference represents an historical opportunity to translate our aspirations into concrete commitments. In a global context that is challenging, strengthening governance of the sea through multilateralism is a priority that cannot be delayed. No country can face alone the challenges that faces a global common good such as oceans. Costa Rica and France have determined 3 priorities for this conference. First, to conclude multilateral processes that are key, such as negotiation of the Treaty on Plastic Pollution and achieving the threshold for ratifications for the entry into force of the BBMJ agreement. And second, mobilize resources and partnerships for a sustainable and inclusive blue economy. And third, to strengthen ocean science and their links to public policy. And we invite all member states to actively take part in the negotiations of the political declaration and to record voluntary commitments that are ambitious and put forward proposals and initiatives that are inaugurative at parallel events. The Ocean Action Plan of Nice will be our collective legacy. We're pleased that NOC 3 will house a meeting of heads of state and government of Latin America and the Caribbean. This space will allow announcing concrete commitments, launching initiatives for the region, and show that leadership in our region is at the height of the challenge. And that is why the presence of the countries of the region at the highest level is essential. Likewise, TALK region, organized by ECLAC in the month of May in coordination with Costa Rica and France, will be a milestone in this road towards Nice and will allow us to align priorities, identify cooperation opportunities, and foster robust regional participation based on evidence and directed action. Ladies and gentlemen, the success of UNOC 3 will not be measured based on the number of speeches, but the ambition of our action. Costa Rica is convinced that protecting the oceans is not a sectoral agenda, but rather a condition for peace, justice, development, and sustainability of the world. We're celebrating that today, within the framework of this 8th meeting of the Forum of the Countries of Latin America and the Caribbean, we are discussing the relevance of marine ecosystems and strengthening of marine governance, because this reflects the commitment by our region to SDG 14. I invite you to continue working together coherently, with determination and solidarity, and that our commitments may translate into concrete solutions, that our data become decisions, and that our seas may continue to be the source of life for present and future generations. Ocean already has an owner. It belongs to all of us. Thank you very much.
Thank you very much, Mr. Foreign Minister. Really, your words, your messages are extremely important for all of us here present, for the countries of the region. It is a call to close that gap between the level of threat faced by oceans and the level of financing to achieve the Sustainable Development Goal number 14. And thus, we thank Costa Rica for your very important leadership globally in all senses, and especially within the framework of the UNOC 3, that surely will be most successful. Thank you, Mr. Foreign Minister. And with this, we can now invite Mr.
Victor Alegría. He is the Director of Sustainable Development of the Ministry of Sustainable Development and Climate Change of Belize, and precisely thinking how the large Caribbean is one of the regions highly vulnerable to the effects of climate change. Therefore, we would like to ask your perspective. What do you think have been the most successful Belize strategies to strengthen the resilience of coastal communities, and how is this articulated with the multilateral action agenda? And can you tell us about the blue bonds and innovative mechanisms to finance marine conservation and how they have worked? And what opportunities do you see for the rest of the countries of the region? You have the floor, Mr. Victor Alegría. Buenas. I think I should.
Would like to first of all thank Mr. Jose Salazar and the ECLAC team for convening this important forum, as well as inviting me to serve in this distinguished panel. Thanks very much. Excellencies, distinguished guests, ladies and gentlemen, it is a pleasure to join you this afternoon to share the efforts and experiences of Belize in implementing the SDG 14 Life Below Water. For Belize, like other small island developing states, SIDS 14 means life, very simple. The SDG 1 cake that you can see behind me, the diagram highlights that the biosphere, which includes the oceans, is the foundation on which our economies and societies are built and is the basis of all SDGs. Marine ecosystems are interconnected, and harming any portion will affect the broader region and its economy. This is why implementation of the Antigua and Barbuda agenda for SIDS is critical, and why regional initiatives like the Pro-Caribe Plus are essential for sustainable ocean governance. Pro-Caribe Plus is a historic mechanism operationalized in January 2025 and developed from country requests to improve coordination and collaboration in the region on marine issues and to support the achievements of the SDGs and multilateral environmental agreements at the Ocean Climate Biodiversity Nexus. Pro-Caribe Plus seeks to enhance collaboration among countries and among intergovernmental organizations in the MOU area as part of efforts by the signatories to achieve and safeguard healthy marine and coastal ecosystems as a key driver for human well-being and thriving sustainable ocean-based economies. In Belize, Pro-Caribe project is supporting enhanced fisheries traceability for key commercial species such as the spiny lobster and queen conch. This effort brings together regional fisheries mechanisms from English and speaking Caribbean to share traceability softwares that have been built and have been developed in the region and for the region, a great example of the South-South cooperation. I encourage all countries in the wider Caribbean region to sign to the OCM MOU as soon as possible. Locally now, Belize faced significant threats from climate change, particularly in coastal regions. Its vulnerability to sea level rise, hurricanes, and extreme weather events has led to various strategies aimed at enhancing resilience in coastal communities. Many of these strategies align with global climate action frameworks, such as the Paris Agreements and regional multilateral cooperation efforts within the CARICOM and the Caribbean Community Climate Change Center. Belize's NDC also prioritizes the marine and coastal ecosystems for climate adaptation and mitigation, linking existing initiatives like the Blue Bond to national policies. And to share a few examples specific of successful examples in Belize, I would like to at least highlight 3 or 4 out of many that we've actually been able to successfully implement. The first is implementation of the Integrated Coastal Management Plan, which manages coastal resources sustainably through community involvement, monitoring and regulating land use, fishing and tourism, all of which are key drivers of coastal resilience. The creation of a marine protected areas network that conserves marine biodiversity, protects critical habitats like coral reefs, and support livelihoods for coastal communities that depend on fishing and tourism. Sustainable fishing practices that implement a quota system for commercially important fish species such as the lobster, conch, and finfish based on scientifically determined sustainable catch levels by 2030. developing an early warning system and disaster preparedness, enhancing community readiness for extreme weather events in partnership with organizations like CDIMA and the 5Cs. Climate financing and capacity building access through international funds, such as the GCF, to implement climate adaptation and mitigation projects that strengthen infrastructure in vulnerable coastal areas, support research on climate impacts, and develop community resilient programs. Distinguished guests, in line with climate and financing, the Blue Bond in Belize has been an important initiative and an innovative mechanism for advancing marine conservation. In 2021, Belize issued a 360 million Blue Bond supported by various stakeholders, structured as a debt for nature swap, where part of Belize's foreign debt was restructured in exchange for financing marine conservation efforts. The Blue Bond proceeds are used to protect Belize's barrier reef and fund sustainable fisheries management projects. As highlighted in Belize's VNR 2024, this initiative, among others, has significantly improved the economy of Belize, reducing national debt by 12% and aiding in poverty reduction from 36.5% to 26.4% between 2017 and 2023, and decreasing unemployment from 13.7% to 4% in the same period. It provides approximately 4% annually for marine conservation efforts and a 23.5 million endowment starting in year 21, estimated to reach as much as 92 million by 2041. Key achievements from the bond so far includes that 20.3% of Belize's marine territory now legally protected as biodiversity protection zones. A legally binding commitment is in place to expand protection to 30% by next year, 2026. And the development of a national marine spatial plan, which is very important and is grounded in science and aligned to IOCA, UNESCO, and IUCN guidelines. Under the Blue Bond Agreement, Belize was the first to implement a nationwide territorial use rights for fisheries, referred to as a TURF model, under its managed access program, granting exclusive right to small-scale fishers, reducing illegal and unregulated fishing, promoting sustainable harvesting methods, and empowering communities, thereby strengthening fisheries governance. Also, half remaining public lands in the Belize Mesoamerican Barrier Reef System have been legally designated as mangrove reserves with a permanent ban on conversion and sale. This supports natural defense mechanisms against storms and sea level rise, and supports fish nurseries, biodiversity, and blue carbon storage. In concluding, while these actions contribute to achieving different SDG targets within SDG 14, 4.2, 4.4, 4.5, it also aligns well to the ABAS and the priority areas that we have identified last year in setting the 10-year agenda. All the aforementioned also and all initiatives contribute to achieving strategic objective 5, very importantly, of Belize's medium-term development strategy, the Plan Belize medium-term strategy that focuses on benefiting everyone and leaving absolutely no one behind. Thank you.
Muchísimas gracias, señor director.
Thank you, Director. It's highly inspiring to see the many policies, territorial planning, involvement of private sector and communities, precisely to reach such important progress in SDG 14 and those of financing, mainly because it is a subject, hopefully, cooperation will be promoted to learn from all that progress, all those advances, and to be implemented in other parts of the region. Thank you very much. Now I would like to invite our colleague Maga Takagi, Program Leader at the Regional Office for Latin America and the Caribbean of the Food and Agricultural Organization of the United Nations, dear Maya. And I would like to mention that 3 of the 4 fishing areas of Latin America and the Caribbean face serious problems of sustainability, including one that is considered the most overfished, overexploited of the world, and that comes from distant fleets from Asia and Europe that operate in the border of the exclusive economic zones.
So, a framework question, please. What does FAO propose to strengthen governance and sustainability of these shared fisheries? And what instruments are there available for countries of the region to exercise greater control and protect resources in this context? Go ahead. Thank you for the opportunity to be speaking about such an important SDG. I'm going to PPT, a presentation, so as to see, have this visual input, very nice pictures for the last session of the day. Before answering the question, I wanted to give you an introduction referring to the importance of oceans as source of life and development, and also as a source of fundamental food for 600 million persons in the world, depending on them for their livelihood. And in Latin America and the Caribbean, 85 million persons. We are speaking not only about food, about employment, about development. These food have an important health component as well. Also, as an introduction, yesterday, our Secretary General of ECLAC, in his report, referred to the SDG, and FAO has also 4 of submarine life. It's interesting to see that 2 of the indicators that are green there, that are close or that have been achieved, it's precisely regarding international instruments, policies of regulations for fisheries, and the degree of implementation of international instruments to combat illegal fishing, 1461 international instruments and 1471. Now, about the subject that you have mentioned, sustainability of fish population or sustainable fishing still is far from the target. That 1471. And much has been said in this session, although we have moved forward in regulations, in laws, in policies. What we need to achieve now is the implementation in order to achieve the other indicators. And answering now the question as to the importance of marine systems for nutrition and food, they're linked with the health SDG. It's important to say that they provide important nutritional benefits, unique as to proteins, fatty acids, omega-3 that are indispensable for healthy nutrition. Also, it is linked, and research shows they're linked with improvement in the results in birth and cognitive development of children, and the link with their diets and also of mothers, and also reduce risks of cardiovascular and neurological diseases. Therefore, it's important to mention that the level of consumption is still very low, both globally, which is global per capita consumption is 20.7 kilos in 2022, and in Latin America, only 10.7 kilograms of per capita consumption per year. It's one of the lowest rates in the world, as and therefore it is an important challenge for the implementation of policies, investment, and technologies in order to guarantee an increase in consumption. But the question is, do we have sufficient production so as to increase consumption of seafood? Because for that, you need to have more than a proportional increase for this. And second, is there sufficient production? Is there sustainability in this production? This is the second question.
how can we measure this, and how can we propose mechanisms in order to strengthen governance and sustainability of fisheries? The first point of action proposed by FAO is this concept of blue transformation that seeks to address challenges associated to environmental degradation, hunger, and have these elements as long-term solutions. And the idea is to work on three objectives: intensify and expand and sustainable aquaculture, ocean and part is non-ocean, effective management of all the fishing sector with an effective management, putting an end to illegal fishing, and also promote improved value chains of water food, reducing waste, increasing traceability, and access to markets, and creating awareness of the consumer. So the need of increasing the supply of water food is of 13% for Latin America and the Caribbean and 20% for the world. So there is room for growth. There is a need to increase the consumption for health, but we need to do it sustainably. And now this is the next slide mentioning precisely what our chair has said, the status of fish populations, and are they at a biologically sustainable level in 2021? Unfortunately, 62% of marine populations that are caught in biologically sustainable levels went down 2.3% less than in 2019. And these, here we need for the region, for the Southeast Pacific region has 33% of population within sustainable levels. That is that all those circles being blue, the bluer, the better. So we know where it's not blue and where we can improve in connection with external fleet that are not necessarily under the regulations of countries. Let us go and move to instruments, implementation of international instruments we are working on. All these international instruments seeking the promotion of sustainable fisheries development and management calls for international and regional cooperation, because the order needs to be placed in territories, in oceans, and regulations in transition areas and zones. We have this indicator since 1974, an important instrument, INDNR, that is, and FAO is the custodian of this indicator, and we have the promotion of the agreement of FAO with seaports, 16 countries in Latin America that have signed this agreement, because it provides elements and we also have the fight against illegal, non-regulated fisheries and an international framework to prevent it.
And this is naturally going to be helpful for the flag state. These are all available for countries. And finally, I'd like to answer what initiatives has FAO adopted for small fishing? What can be set up? Well, while I talk about these instruments, I would like to make available publications and documents from FAO that you can download with this QR code. There are lesson learned, guidelines, and the importance of small-scale fishing. We hear about 22 as the International Year for Small Fishing. This is to raise awareness on this sector. And one of the results are the voluntary guidelines for small-scale fishing. And we have this available for you, by the way. We have copies. You can have them in paper or you can have them downloaded. The idea is to provide further value and appreciation to small-scale fishing. This is because of its nutritional value and also to decrease food insecurity in the world. Well, FAO is also conducting work with the communities for systemic focus on fishing on mangrove. And this is very important because when we talk about mitigation to climate change and the subsistence of fishers, in short, sustainability requires urgent action in order to meet all SDGs with a commitment of all sectors, with technology innovation in order to have sustainable sea production, and with international cooperation for healthy, prosperous oceans in order to improve production, to have a better environment, better nutrition, and to live better, leaving no one behind. Thank you. Thank you, Maya. Indeed, this is an appeal to action. Aside from everything that has been agreed on, the instrumentation of international measures, and also the setting up of a framework for blue transformation, and with intensification, efficient management, better change. This is so useful because it's a model that the countries have at hand to speed up their actions. Thank you very much for the material that you have brought from FAO to be available to all member states. Now I am pleased to invite Ms. Lea Cabral. She is a researcher from the French Institute for Research on Development, and she is also from the Mediterranean Oceanographer Institute. The investment in R&D on sea levels is very low throughout the world. The average is of 1 point of the research budget at large, and Peru and Ecuador invest about 5 or 3%. But the average for the region is of about way below that of the world. So R&D in Latin America on ocean issues is very low. We would love to hear from you why investing in science and technology and sea development, why can this become determining for progress, prosperity, and sustainability of the region? You have the floor. Thank you. Let me first of all thank you for the invitation and for the opportunity of bringing the perspective of science and R&D to this topic. Let me give you some background information. Investment in science, technology, and education is globally pretty low, not only in ocean studies, but in everything having to do with the seas. 0.7% of GDP is the average for the region. There are differences naturally from country to country and region to region, but it rarely is of more than 1%. It's way below the investment in sciences on OECD countries. There, that is of about 2 or up to 4% of GDP. So the investment issue in science is seen throughout the world, but it affects even more some sectors such as sea sciences and oceanography. It's very difficult to calculate the precise share of R&D that is voted to studying the oceans, because these are general funds, and the research is now multidisciplinary. But we can estimate, and as we said, the ocean investment is of about 0.1% of the total spending in research and development in the region. That's 10 times less than what we see for the rest of the world, with exceptions such as Peru and Ecuador. But it's a shame that our region that has such tremendous competitive advantages to study the sea, Chile has more than 5,000 kilometers ashore, do not allocate more importance to this. This, I think, is a reflection of the little importance that the countries in the region allocate to scientific study on the sea, in spite of the importance of the seas for our economies and for our nutrition. But there are other figures, there are other indicators of the dynamics of this scientific research. One indicator has to do with productivity. That is to say, how many scientific articles are published. The world average is of about 50 articles per million inhabitants, having to do with oceans. In Latin America, we have the same figure. The average is the same as the world average, so 50 articles per each million inhabitants. Even though we have 10 times less investment in this region, and there are some countries in the region, such as Chile, Uruguay, where that productivity is 2 or up to 4 times greater than the world average, even though the investment is so much smaller. Now, this, I think, is a plus for the researchers in the region, but that's not just it. It also reflects the importance of international cooperation between Latin America, Caribbean, and the global north. If investment in science in Latin America and the Caribbean is low, that doesn't mean that other countries are not interested in studying our own seas. Actually, the world is very interested in this because we have very special ecosystems, such as, for example, the Humboldt current. Many people with little oxygen are able to, many of the species that have little oxygen, they go up and they go down and they thrive. We also have a special connection between the Antarctic and the other oceans throughout the world. So the question, why investing in oceanography? Why should we better understand the marine ecosystems? Well, I have identified 3 elements that deserve mentioning here. First, why is it important to invest in sea science? In order to implement effective preservation policies and to protect small fishing in the region, such as, for example, the reef corals that we've already talked about, and in the South Pacific, the kelp forests that are a hot spot for marine diversity. Let me give you some examples. Monitoring marine ecosystems to understand the dynamics of the pollutants or tropic or pollutants in the ocean. That is to better understand how the pollutants, by the plastics, metals, and whatever, how they behave once they reach the basins and go out into the sea. This would allow us to better manage and to better collect these pollutants and find out the vulnerable areas around the shores, devoting more efforts into regulation. Secondly, the second pillar on why we should invest in R&D in marine sciences has to do with the promotion of economic practices that can be sustained, that would improve fishing, that would avoid overfishing, and to protect the biodiversity as while creating revenue. A study on biology, on genetics of fishes, allow us to quantify the stock available, to estimate the future projections, to find out how much can be caught without endangering the species. Often in our region, we have a very intense practices in fishing as compared to the North Country. This would ensure food security, but it would also maintain a sustainable development perspective in countries that depend on the fishing production for their own economy and livelihood. Thirdly, technological innovation. The ocean, the sea, may be responsible for a source of resources to bring in solutions to the challenges that we're facing nowadays. It allows us, for example, to create renewable wind or sea energy. It can allow us to have bioproducts thanks to technologies, to blue technologies. That is to say, or using seen organisms, plankton, bacteria, seaweed, in order to have human consumption products without the use of chemicals. These are all alternatives that are sustainable and the alternative to the petrochemical conventional industry. And another thing I wanted to talk about something close to my heart, because this is something I study, and that's the adaptation to climate change. The seas are fundamental in order to regulate the weather. They contain and they take up greenhouse gases. That is, they absorb these gases. They mitigate these gases. But this regulating role is at stake right now because of climate change. So to better understand the impacts of climate change on, for example, acidification, oxygenation, and the pollution of our coastal areas, will bring in solutions to face these effects and to mitigate their damage. With the ocean, we are able to see that there is something endangered, but also as an ally in the search for technological solutions. I will give you two examples in our research and according to my experience. The first one has to do with the restoration of marine ecosystems that were affected by salmon breeding in the south of Chile. This can naturally be extrapolated to other countries and other species like shrimp and others. We use microorganisms, the bacteria that come from the sea, that live in the sea, and that have been impacted by this, but they have been able to adapt. And we use these organisms to get rid of the pollution in some sea bottoms. Another example is a solution based on nature. With climate change, the conditions of less oxygen, more oxidation affect some microorganisms are organisms that produce greenhouse gas, so that is negative naturally, but we can also take advantage of the biotechnology available to find the microorganisms, bacteria that can, for example, produce biogas, methane, and this in turn can be used as renewable energy. We're researching precisely this kind of thing with bacteria from the south of Chile that are being affected by climate change, but that would allow us to take advantage of biogas as a renewable energy. So these are two perspectives of research on sea sciences that I wanted to bring to you. Thank you. Thank you so much, Alia. In this forum, we have heard of many, many challenges that are so critical for the region. And what you are bringing to us is the proof of how science, in view of the oceans, can find solutions to these challenges. And that is exactly what happens in the Caribbean with seaweed, sargasso. It's a very serious problem, but from science, we can make these solutions. That is investing in sea sciences, in blue chemistry, is a way whereby the countries in the region could accelerate the way towards sustainable development. Thank you so much for these perspectives, Leah. Now it's a pleasure for me to invite Ms. Zoila Bustamante, chairperson of the Confederation of Small Fishers in Chile, and also from the Latin American Union of Small Fishing, ULAPA. This is a very valuable perspective that will come to this discussion that is so interesting. Let me say that for our region, small fishing is extremely important for the economy and the food security in all of the region. Dear Solia, what do you believe are the main barriers that small fishing finds in the region, and what can the governments do together with you as solution? Can you comment on how you believe that small fishing is being affected by climate change, and how this is affecting the transformation of the sea environment? Thank you. Thank you very much for the invitation to be here. Good afternoon. Let me say that before chairing the Confederation, I was president of the Latin American Union, and I am a fisher. I live in the south of Chile at Taquilla, Caleta, 100 kilometers from Puerto Montt. I live off the ocean, off the sea. So for me, as a small fisher person, it's very important to talk about this, especially in listening to the fellow panelists. Much has been said that we are working on as well, both in Chile and internationally.
The Latin American Union entails 14 member countries. And today, we are also working together with FAO on many topics that are related to something that you already mentioned, the voluntary guidelines. For us as artisanal fishermen, we took 4 years to achieve these voluntary guidelines for small-scale artisanal fisheries, and it's not been easy for countries to implement them. Everyone here is a member of the voluntary guidelines, and that is a support. But if the countries here and those countries that are in Latin America, Central America, don't take ownership of this, for us it is mere lip service. It is a work that was achieved from the sector. No one invented it. It was the work of all countries, all fishing countries from around the world that did this. And so allow me, I would like to ask countries present here and also those who are listening that you call on their countries to adopt the guidelines, because this is the word of artisanal fisheries worldwide, not only Latin American, Caribbean, but the entire world. So I apologize, but I could not let the opportunity go by without speaking of what artisanal fishing is doing. And in terms of the ocean, well, one of the main scourges that we have today in the oceans is pollution. We see how pollution today is destroying the sea. For us, first of all, the very most important issue is spills. Today in Ecuador, we have an oil spill which is very large and reaching the coast of Colombia. It's already reaching Colombia. Artisanal fishing has mobilized internationally in order to support our Ecuadorian colleagues. Years will go by without them being able to fish. And this is killing our ocean, not only regarding fisheries themselves, but also our communities, because they will have no livelihood. What can they work on? And so this is going to affect the food. If it will be precarious and poor, if this cannot be that there's still no rules of the game for this sort of pollution that we're seeing on our coastal areas and the oceans. A lot is said about caring for the ocean, but how do we care for it? It's a major industry that puts up the funds for them to continue working, or with our people that live on a day-to-day in the sector, where millions of fishermen around the world, millions, and almost 40%, we are women who make an effort within the sea and outside the sea, and that what we sell. And so we need to take a look at how many people live off the ocean, not only of what we can achieve regarding the ocean as such. Yes, the ocean feeds millions of people, not only artisanal fisheries, but everyone who eats fish, everyone who eats fish food, algae, millions and millions of people that live off the ocean. So therefore today in the treaty of BB and G, we as Chile and as the Latin American Union and Confederation, we are working very closely with our government and with the Foreign Office, because we're happy that they requested that the Secretariat be here in Chile, Valparaiso. Next week, we will have an international event. 14 countries of Latin America are coming to an international event organized by the Confederation to support Chile in engagement in this. So we are not only artisanal fishermen, that is what I'd like to convey. We are also managers for our communities to go beyond being mere fishermen and go beyond being a mere person. On the contrary, we are managers for our communities to see the light. We are big. We are big people, big in the food sector. Just imagine a sector such as Chile, a country with 4,500 kilometers coastline, more than 1,700 with the inland waters. And of this 100%, they're fishermen. We have a major sector of sea that we from Arica to Magellan, and not to speak of the Chilean Antarctic, to make an effort. We have people that go to the Antarctic to fish, outside the 200 miles to fish. We are not just a fisherman of the coastal border. We also fish in the high seas. And that is why when rules are made, also we must be considered, because otherwise we're just one more in the group, but we really affect this. And one of the major scourges for us is pollution, not only oil, also plastic. We're making an effort as countries, such as Colombia, on account of fossil fuels, in Chile, recycling networks and rope for people to have a better quality of life. And so we have gone looking for solutions so that our people, and myself as well, not get used to this disaster. And so I always say this. Someone once said that we were poor fishermen. And my dad had a saying, and that is, poor are the frogs that do not have anything to put on their feet, because we go to fish in the sea with or without shoes. And I'd like to take the bull by the horns regarding the ocean. We must be taken into account. We must be heard. Today, we had a big accident last weekend. Some of you must have heard about it. It came out in the news. 7 fishermen colleagues disappeared. Supposedly, they were crashed by an industrial ship. These were cod fishers. That is why I say we make efforts in all sectors, not only on the coastal area, not only in selling the goods. No, we are artisanal. I work in the sea where the waves break, and we have areas of management. Today, Chile, when President Bachelet was here, we got 30% of was a protected sea area. Today, this has risen to 42%. But look, artisanal fishermen, they have 5% management areas, where we care for the sea. We co-manage, we recover resources, and we give employment. And so that is what we do today. When you want to care for the ocean, I insist, and I want to be repetitive with this, we too should be present, because we live off the sea, we live off the ocean. Millions of artisanal fishermen that live off the sea, and for our people to continue living. For me, it is an honor to be here to tell you what it is that we do as fishermen. In Chile, we have scientific committees to see the quotas. As the previous speaker said, these are not assigned by hand. Here there are scientists that dictate the quotas according to what the status of the biomass. You have tripartite committees for that, and you have all 3 representatives. There are management plans, and we try to implement this among our colleagues of the Latin American Union, because we have the 5 miles. Ecuador has 8. Panama just has no miles. The other have 2 miles. Brazil has 5. The 5 miles safeguarded for artisanal fishermen. And why should we unite? Because we must incidentally must tell you, and for you to say and recognize that we do exist, and we work, and we do a lot of work in this country and in Latin America and around the world. Artisanal fishing feeds the people when there are natural disasters and catastrophes, and there is no public policy for natural catastrophes. And so if there is no public policy, we need to feed the people. And every time we have a catastrophe in Chile, the fishermen go out to feed the people, with or without permits, but we feed the people anyway. So is SDG 14 important to us? Of course it is. The oceans are very important because we live of it. Thank you very much.
Estimada
Esteemed Zoila, your words have been incredibly powerful, with that depth that comes only from the ocean. And definitely there are calls that are essential, including this call for participation. Put in motion all policies and plans that are required precisely for these healthy, sustainable oceans that we all dream of. I thank you very much. Dear delegates, we're running a little late, but truly, this is being an extremely interesting panel, full of messages that are very valuable. And so now I am very pleased to invite you to hear Juanita de Los Angeles Arisla, who is the director of the Colombian National Water Network. It is a pleasure to have you with us. And I would like to say that despite access to water is recognized as a human right, in reality, it's still a challenge for many communities in the region. Based on your experience in Colombia, what strategies have been most effective to prevent socio-environmental conflict regarding the use of water and ensuring access to water for communities, especially in coastal contexts that are so greatly affected by, for example, climate change? Thank you. The floor is yours. Thank you. This important panel, the UN, ECLAC, and everyone who is with us in this dialogue on the relevance of SDG 14, one of the fundamental elements. And that is why I brought this presentation, Governance of the Ocean and Global Security. It is a pleasure to be here. And also, I would like to thank you for the citizen participation mechanism. I'm from Colombia, and for us, it is truly an honor to be here to bring these initiatives to you. The National Water Association that we've been active in 16 years, and the integral protection of our water resource, integrating more than 1,700 organizations from around the country with whom we have developed more than 800 cases of the defense of collective rights and of the environment. And in this sense, we've worked on the development of a national diagnosis that we presented to the Congress of the Republic, the Ministry, the United Nations, and various instances that converge in Bogota in 2020. And we were able to present the results, our diagnosis, and we were able to justify and show not only academically, but also making a bridge between social and environmental organizations from the country and local authorities in order to see that we too are affected by the economic development model, extractivist in our country. And development can be misused when linked to armed actors, as occurs in Colombia. More than 30 years paramilitarism and 40 years of armed violence and domestic conflict, which means that there is a tremendous situation of social insecurity and environmental insecurity in Colombia. And so our environmental and social leaders were affected, victimized. Bureaucracy, privatization, infrastructure issues, and contaminant use of energy, and armed conflicts. All things that have seriously affected Colombia have led to these indexes for our country of participation in climate change. We have no the largest motor industry in the world, but we do have one of the rivers largest in the world that has not been able to be managed properly. But based on the peace process and the efforts made to achieve peace with nature and build this new Colombia that we dreamt of from the viewpoint of indigenous and Afro-descendant communities, peasants, women, young people, alternative communities, academia, and in environmental and social organizations that want a new society, we need to further new road for action and consolidate a new economic development model to integrate the private sector in initiatives for conservation and agroforestry systems, native forests, sustainable farming, and the issue of governance and of public assets and protecting public health and sanitation, increased investment in the protection of water and biodiversity, energy transition, and penalization, legalization, and of course, peace with environmental justice and peace with nature, which is the mandate that we receive from our indigenous people in the Sierra Nevada. So if we're able to do all of this, despite the armed conflict, we will be working for the restoration of human environmental rights by and redeeming our leaders who have been victimized and ensuring the restitution of rights. If we're able to align these these things, we will aim at consolidating ecological regional stability. And I believe that water, the Commission for Water and Biodiversity of the Senate of the Republic and the Chamber of Deputies 4 years ago, who has had the pleasure and the honor of being a secretariat for the first time in the first Commission for Water, furthered by civil society in recognition of the social leaders cannot continue to be victimized and pursued. Colombia is a country most dangerous to be a social leader, and we want to change this paradigm. How? Well, with the political science and citizen participation and governance as elements that do make sense when we take the stage and are able to further these elements of knowledge, the expertise with social leaders and also the private sector, but also the different actors involved. And so we're putting in the DNA of our country this commission and transforming things at nationally, development plans, furthering the debate about these topics. We've been able to carry out 20 sessions, and COP, we were able to also develop 20 sessions, and for us this has been very, very important in order to reach the International Commission for Water and Biodiversity and the International Commission for the Amazon River and the Global Pact for Water and Biodiversity. In this sense, then, I leave with you this image of our Americas. And here we see how we are working on a very important thing. We, the leaders and the people of South America, must find a common place in our identity. And this has to do with the oceans and the Andes mountain range, because it happens that our world is organized same as the human body. The world also has a structure. My body has a head and feet, and in this sense, this has been called by the Institute of Resilience of Stockholm. There are 9 main elements of the Earth, which are damage of the ozone layer, the aerosol burden in the atmosphere, the presence of phosphorus and nitrogen, green water, blue water, the change of the soil use, and many others at genetic and functional level, and elements of climate change, all associated to CO2 and the concentration and the presence of radioactive elements. All of this shows the need to further the agreement on marine biodiversity beyond national jurisdictions, because what we need is to have an interest and a social approach, diplomatic and economic, in order to address governance and integral management of our world, because Earth is divided into these different types of ecosystems, and these political divisions of countries and the history of humanity itself has led to a fragmentation of the ecosystem. And so in this change in paradigm of political management and public management at a global level of our nature, we must understand that cooperation is fundamental in order to have a due administration but also joint efforts to comply with these targets. And so the sea too is an ecosystem. And raise your hand, those who knew that the sea was an ecosystem. 1, 2, 3, 4, 5 people. Okay, not everyone. So this is an ecosystem. What does this mean? That it is intrinsically related. And we consider that this is the pillar where everything is put in order. And so it is important that we should learn that ocean currents and the different seas and oceans of the Earth are all linked. But on account of global climate change, we're seeing an increase in our ocean levels and also a negative trend for us people. The rise in sea level will put an end to coastal towns. But this is a projection that we could change if we join efforts in order to change these different instances that affect us. For example, one fundamental element, and ECLAC here is the home of statistical analysis and sample taking. And I would like to highlight that there are many monitoring processes of the ocean, but why do citizens continue to pollute, and enterprises as well? Because the states had a legal framework, And that is why we're not reducing the gap. And so here I would like to emphasize the fact that water comes from glaciers and that we're in the World Year of the Glaciers. And in this sense, we need to think of how this is either connected, and how do they reach the sea, and how we're really doing things.
Caso de Colombia, here, in the case of Colombia, one of the most critical ones, we've lost 93% of our glaciers in the last 50 years. And here you can see, for example, it is an urgent call of Mother Earth to generate an articulation and exchange between the global south and global north. Our glaciers are affected because of the presence of phosphorus, nitrogen, heavy metals in the current, air, and those first affected are our glaciers, which are our own water sources. And how can they reach out to the sea if we are impacting them? Here we have a map of Colombia. We are the sixth richest country in the world in water. And we have a giant responsibility with our continent. Therefore, it's important to highlight that the whole region is being affected by mining processes, different model impacts, and that is why the idea of declaring the mountain range of Los Andes as a subject of law, but also a call to all agencies of the UN and countries to begin a process so as to create a global treaty on water protection as a matter of international security. Based on the National Compact for Water of 2020, we achieved or made Colombia did it. And for the first time, in a respectful way, we bring this request, this initiative, so that we can declare water as a matter of international strategic security. Strengthening of public policies, education, sustainable fishing, restoration of marine ecosystems, control of plastic pollution in the coast, reforestation, incentives for innovation of clean technologies, international cooperation, monitoring control, and strengthening of community participation. We'll take this proposal to France, and will be included at the SDG level to drive plans, programs, and projects of climate and environmental, national, regional, and international governance for the joint monitoring of the SDG 14, generating economic incentives of participation for civil society, public sector, private sector in protection of the global nature heritage. And the idea is that we can be in a true advanced technological world and with water for the future. Thank you very much. Thank you, dear Juanita. Really, it has been most illustrative. And we have very few minutes. Secretariat has been very generous in providing us with some minutes for participation of delegations. So at this point, we would like to begin with Brazil. Yes. Thank you very much. Thank you all panel members for very rich presentation, enlightening. Throughout the centuries, indigenous peoples and traditional communities have developed knowledge about the ecosystems they use and production processes based on the use of the potential of natural resources, animals, soils, water. And these methods of traditional knowledge contribute to achieving SDG 14. Brazil has worked to guarantee food security and improve the living conditions of fisheries communities, playing a vital role for the economy and preservation of oceans. We have implemented policies addressed to manage fishing and promote sustainable practices like family mariculture or sea culture, and fight unregulated and illegal fishing. to the implementation of science-based management plans and the reinforcement of participatory fora, we are advancing in the restoring of marine ecosystems and preservation of species depending on this habitat. Also, Brazil has contributed actively to international negotiations like UNEP, instruments on plastic pollution, in addressing a balanced approach that is basic for the health of oceans and human populations. We will present our notes in the UN conference that will be held in Nice, France this year. This event will be an important platform to strengthen the international associations, promote the technology transfer, and guarantee that practices for the sustainable use of marine resources be available to all. Only with a comprehensive global approach can we face all the challenges of overfishing, of degradation of the environment and climate change. With this commitment spirit, we keep on working to guarantee a more just and sustainable future for all without leaving anyone behind. Thank you. Thank you, Brazil. As we have very little time left, please, your interventions only for 2 minutes. And thus everybody will be able to speak. So I now give the floor to Costa Rica. Thank you. Good afternoon, Executive Secretary, Mr. Chairman, dear panel members, delegates. I have the honor of introducing a joint intervention on behalf of Costa Rica and France as co-organizers of the 3rd Conference of the UN on the Ocean. So I will give the floor now to the representative of France. But 2 years after the joint declaration on the Conference of the United Nations on Ocean, Costa Rica and France once again jointly reaffirm in this forum the urgent need of adopting concrete measures for preserving and protecting the ocean, and thus allow the implementation of SDG 14 of the 2030 Agenda. In this time period, we have conducted a series of talks, blue talks around the world in order to mobilize local players, actors, and give visibility to the conference, including the activity jointly organized in Valparaiso in April 2024, and the next regional blue talk of May organized with ECLAC. The review of SDG 14 is an essential step for the protection of our marine ecosystems, and ECLAC offers a privileged forum and most appropriate for regional dialogue. In this context, Costa Rica and France would like to underscore the importance assigned to the progress made in Latin America and the Caribbean, particularly in that connected to the protection of coastal and marine areas, which are 22.9% at regional scale, above the average, with Chile and Colombia heading these efforts with more than 41%, followed by Costa Rica that already exceeded 30%. But still, there are pending challenges, especially referring to the overexploitation of marine resources and marine pollution, about which definite action is required for countries of Latin America and the Caribbean to virtuously benefit from this immense reservoir of wealth. I now give the floor to the representative of France in order to finish this intervention. Representative of France, and I will continue with my colleague of Costa Rica. France and Costa Rica reaffirm the commitment with the countries of Latin America and the Caribbean to continue in this path whose next conference in Nice in June of this year will be a new decisive stage and a privileged moment in order to raise the ambition of climate action 10 years after the COP21 in Paris. This new stage, UNOC 3, that has been organized by France and Costa Rica, will provide an opportunity to have debates addressing action on the ocean. Out of that, there will be operational, unprecedented results. The action plan of Nice on the ocean, which in turn will be an ambitious political declaration and a promise of voluntary commitments from all stakeholders. As mentioned by Minister of Foreign Affairs of Costa Rica in his intervention, priorities have been identified for the conference. Firstly, to advocate for the achievement and implementation of multilateral agreements on governance. We cannot allow the BBDG on high seas agreement to fail. We cannot let that. And we urge countries here to consider urgently all the national and global benefits that this treaty will include and will bring. Secondly, UNOC 3 should mobilize private and public resources in order to support a sustainable blue economy. And finally, we need to support in the scientific research in order to strengthen and better disseminate the ocean knowledge in order to allow for better informed decisions by the international community and our leaders. To conclude, we call to have collective, active, and high-level participation in UNOC 3 to bring together efforts for the protection of our marine ecosystems as global property. And this is a priority and also an effort for the well-being of all of our coastal communities. Thank you very much. Thank you, Costa Rica and France, and especially for this leadership and invitation to UNOC 3. Hopefully it will be very successful and will have an important participation of Latin America and the Caribbean. Now, it's a pleasure to recognize Panama, please. Or was it Mexico? Panama. Yes, good afternoon. Thank you for the valuable interventions of all panel members. Thank you, Chair, and thank you, Executive Secretary of ECLAC. Panama recognizes the importance of leveraging international, bilateral, multilateral cooperation, public and private, through the transfer and development of technology, creation and strengthening of capacities towards a common and sustained effort that will ensure globally the preservation and sustainable use of our oceans. It is important to highlight the initiatives to which Panama has joined in the Global Alliance for Oceans, driving urgent actions to safeguard global ocean and protect its beautiful wildlife. Likewise, to the Global Leader World Project led by FAO and Maritime International Organization seeking to protect marine ecosystems from plastic waste and other damaging substances, issued by the maritime and port industries. Also to the action of the Americas or Coalition of the Americas for Protection of Oceans and regional mechanisms allowing for the development of scientific knowledge and the exchange of the best practices as main objective to create a space for collaboration, cooperation, and coordination politically on protected maritime areas and other effective measures of conservation
of areas in the Pacific. Recently, the Panama Canal and more than 150 organizations of the maritime value chain signed a call for action by the industry requesting world leaders to work in the decarbonization of maritime international transportation for the year 2050 and to support maritime zero emission projects at the industrial scale at national level and implement policies that will turn maritime transportation in zero emissions for 2030. I end by highlighting that which has been set forth in several occasions by the Secretary General of the UN. We are before an ocean emergency and we need to change directions with tangible actions. Thank you. Thank you. Now I invite Mexico to take the floor. Thank you. Good afternoon. The protection of oceans is a task that calls for a comprehensive approach. Mexico recognizes that SDG 14 submarine life cannot be addressed in an isolated manner, but with cross-cutting public policies combining governance, environmental regulation, conservation, and sustainable development. We have advanced in reducing marine contamination for reduction of plastics, and the strengthening of and treatment of wastewaters. Likewise, we work in regulation of emissions to minimize acidification of oceans and for a sustainable fishing industry, supporting tracking, monitoring, and artisanal fishermen. In a total of 232 natural protected areas in the country. This encompasses almost 24% of the exclusive economic zone of Mexico. Also, we consider new appointments that will allow us to reach the 30% target for 2030 within the Montreal Global Framework. And this is fundamental for protection of key species like coral reefs. 131 species have been identified. 6 of the 7 marine turtles of the world, and at least 65 species of sharks, including the white one of Guadalupe and the whale shark in Mexico. And also our protected natural areas provide protection to 11 species of marine mammals, the blue whale, the gray one, and Mexico safeguards 80% of marine species of the country and 25% of marine species worldwide. From the scientific area, we promote research and monitoring through the system of research on seas, tools of geointelligence, and all these efforts reflect Mexico's commitment with the sustainability of oceans, recognizing that only through intergovernmental cooperation and participation of society will be able to meet the 2030 agenda. Thank you very much.
Thank you very much, Mexico. I am now pleased to invite Trinidad and Tobago to hold the floor. You are on.
Excellencies, distinguished delegates, good afternoon. I thank the panelists for their perspectives, and I wish to share my country's own progress on implementing SDG 14. Trinidad and Tobago, as a small island developing state, is home to 704 kilometers of coastline and a maritime territory that is 15 times greater than its land area. Our nation's prosperity has long been intertwined with our ocean and coastal resources, yet these vital ecosystems face relentless degradation. Recognizing this, the UN's open-ended working group has outlined 10 targets under SDG 14. addressing the conservation and sustainable use of our oceans and marine resources. However, some targets remain aspirational due to the lack of timeframes, clear quantifications, or measurable data. Despite these challenges, Trinidad and Tobago has made notable strides in advancing SDG 14. The 2024 SDG status report highlights that while progress has stagnated in protecting certain marine biodiversity sites, our nation has taken significant action to safeguard marine life. Since 2014, full legal protection has been extended to all 5 species of marine turtles, earning Trinidad and Tobago global recognition for its conservation efforts. Building on this, the National Sea Turtle Task Force was established in 2021 to oversee research and conservation activities. This collaborative body, comprising government entities, academia, and dedicated NGOs, has recently prepared a draft sea turtle recovery action plan to address pressing threats and knowledge gaps. In August 2023, Trinidad and Tobago's cabinet approved the National Integrated Coastal Zone Management Policy Framework alongside a 10-year action plan. This ecosystem-based approach is guiding the sustainable management of marine areas, particularly in the Gulf of Paria. Concurrently, Trinidad and Tobago has embarked on projects to build a sustainable blue economy, emphasizing maritime industries, ecotourism, and mariculture. A promising initiative in blue carbon credit design, launched in 2024, seeks to promote natural capital management while offering livelihood opportunities and generating revenue. Efforts to restore coastal ecosystems such as coral reefs, seagrass beds, and mangroves have also commenced through public-private partnerships. Furthermore, the proposed Northeast Tobago Maritime Protected Area, spanning 68,384 hectares, represents a significant step in expanding our protected marine zones, especially on that island. Our commitment to reducing marine pollution is evident through our long-standing accession to the Cartagena Convention and the LBS Protocol. Through a technical cooperation with the International Atomic Energy Agency and Institute of Marine Affairs, the Institute of Marine Affairs, received equipment and training to enhance its capacity for testing pollutants such as nutrients, heavy metals, hydrocarbons, and microplastics, as well as monitoring phenomena like ocean acidification. Despite these achievements, challenges persist. Well, Trinidad and Tobago acceded to the FAO's Port State Measurements Agreement in 2029. The integration of these commitments into national legislation remains a work in progress. The modernization of our fisheries legislative and institutional frameworks is ongoing, but hampered by the complexity of policy and legislative processes. To fully achieve SDG 14 by 2030, immense political will, innovative financing, and strengthened institutional frameworks are essential. Trinidad and Tobago recognizes that effective conservation of coastal and marine resources is vital, not only for economic sustainability, but also for the well-being of our people and the health of our planet. As we look to the future, let us reaffirm our shared commitment to sustainable development, ensuring that our oceans and marine resources continue to thrive for generations to come. Muchas gracias.
Muchísimas gracias.
Thank you, Trinidad and Tobago. With us, come to an end, and we hand over to interventions of organizations. I call on UNESCO. Thank you. Thank you very much for such interesting panel. UNESCO, through the National Oceanographic Commission, is leading and coordinating the design of social sciences for sustainable development under the motto, science that we need for the oceans we wish to have. We find that this is a good opportunity to encourage scientific work and research. We also work through our network of UNESCO in order to encourage this kind of research. Aside from this, we're working with marine preservation through the biosphere reserves. We're talking about 132 reserves in 22 countries, and much of that is found in coastal areas. Many are in communities that work with artisan fishing and showing how locally sustainable development is possible. And this should inspire policies and national strategies. I also wanted to mention that the work we're doing to encourage oceanic culture, this work must be done together with all players. As we heard here, we protect what we love, and we cannot love what we do not know. So it's very useful that young people to learn about the importance of the seas. Here in Chile, the government set up a working group at national scale to include all players, and they work precisely to foster this kind of education amongst young people. Finally, a blue economy is a very big opportunity for the region. 72% of the Latin population lives in coastal areas. So that is why I deemed this very important. The NISA conference is a good chance to exchange experiences, to find about lessons learned. So I invite all member states to attend that conference. Thank you. Thank you, UNESCO. I am now pleased to invite UN Women. Good afternoon. I greet all authorities here present. I wish to congratulate the members of this panel for these excellent presentations. It's an honor for UN Women to talk about this on a key goal of 2030 agenda. We must emphasize the important role for women in managing the seas and resources and towards sustainable development. Our oceans are responsible for 70% of the seas, but they're at crisis. Ms. Bustamante has just said that women are responsible for 47% of the 120 million persons who work in the fishing sector. This is more than men work in scale fishing. They're responsible for 67%. Thus, women have a very important role in artisan fishing. Lately, the increase of species have also caused the surging of new activities to preserve species. In spite of this, women's work is not that appreciated. They usually are ill-paid and not qualified with irregular jobs and only seasonal jobs in during harvest time. Many of these women work without contract, without the labor protection, or with basic health and security. And women earn about 64% of the wage that men earn for the same kind of work. We believe that we should promote scientific information and better disaggregated data by gender, as well as better practices. All strategies for the preservation and sustainable development should respond to these vulnerabilities. The engagement of women in fishing is key. We must recognize the little representation they have in sea sciences and take advantage of all possible solutions that may be available. As we heard from UNEP on the potential and the use of seaweed through innovation and science. The impact and the special vulnerabilities that women face, as well as their role in the coastal areas and small fishing, should be part of this round 3.0. We believe that that is the big chance, opportunity, so that all parties may bring in ambitious innovation to reduce emissions, to preserve and to restore coastal areas, and to bring in mitigation areas based on science. Thank you. Thank you, UN Women. We now close this part of these presentations with Onudi. You have the floor. Thank you, dear colleagues. I really appreciate the data and experiences that have been shared here. In spite of the tremendous potential of blue technology, this has not brought sustainable or inclusive results in the world or in the region. In spite of that, the blue industry may have a positive impact in at least 4 ways. So first of all, it can draw a road for sustainable development and shared prosperity. Secondly, it can regenerate sea ecosystems and fight climate change. Thirdly, it can help feed the world with responsibility. Number 4, it may bring in innovation and blue technology. The investment that is needed is of large scale. It must be coordinated between private and public sectors. The initiatives of blue sustainable industry in large scale requires a strong investment, both in infrastructure as well as in capital private, with flows of direct foreign investment and incentives of investment to facilitate, for example, to help out this kind of investment. UNUDI has looked at the blue industry. The idea is to promote integration, optimization, and expansion of the impact and interventions on blue environment. We must find sustainable solutions that may contribute to sustainable development and the 2030 agenda. This examines 4 key sectors of the blue industry: energy, foodstuff, tourism, recreation, transport, and trade, and using marine biotechnology, blue track, blue funding, and sea preservation. There are several industries that are upcoming as the promotion or as an addendum to those that exist. For example, renewable ocean, fish, seaweeds production, nature, sustainable marine industry, and the reduction of the impact on the seas. Inasmuch as there is a transition from a blue-brown exporting, extraction, and sustainable industry into the blue sustainable industry that is going more towards a regenerative blue industry. Our industries are thus gaining protagonism. The emerging industries with the value chain, including oceanic engineering, oceanic energy, industrial desalination, marine or synthetic biodiversity and decontamination. The association or partnership with the governments and with private sector, NGOs, foundations, financial institutions, and the academia are working together, supplementing each other. That is a commitment from UNIDI. We, in the planification of the upcoming summit, are certainly at the service of this tremendous endeavor. Thank you very much for your attention. Thank you. Chair, Executive Secretary, with this we come to an end, and I now hand over to you. But before anything else, I would like to really thank our panelists for these excellent contributions to the dialogue, and evidently to all authorities that have been here with us, contributing to the analysis of the progress in the region vis-a-vis SDG 14. I think that we are now leaving with this feeling of urgency and of commitment to help out to improve the health of our seas and coastal areas. Thank you, Juan. We have come to an end of the fourth day of this forum. We invite you to participate in the parallel events that will initiate soon. Tomorrow, we will resume our work at 8:30 a.m. with the last session that has to do with learning between PARs, SDG 17, partnerships, and reaching these targets. Good evening.